VD and VC. I came, I saw, I conquered. That means we Ayurveda people came, we saw this, and we are conquering now. That is the aim of this. The real confusion is the exact diagnosis is often difficult for a CS because whatever the neck pain the patient come, we say it has cervical spondylosis. But do we have a real definition for CS? That is what we want to talk. And disability associated is often very severe and prolonged. Therapy is ineffective many times. Whatever you should have a thorough knowledge on the anatomy. And this is also of no different. We should have a correct anatomy of all the spine. As you all know, there are 7 vertebrae and T2, T12 thoracic, then lumbar is 5, sacrum is 5 and coccyx is 4. Next slide please. And coming to this, we have a vertebral body and there is a vertebral arch. And above it, you see, those who have gone to Kerala, they might have tasted what is known as parota, Kerala parota. The disc is just similar to Kerala parota because all are on concentric circles, and if you keep a bullseye or egg bullseye in top of it, this is exactly what is. So those, I will explain you, I have kept a slide also. So we have pedicles, transverse process, superior and articular. Now all this you have to learn before to have a thorough knowledge about the cervical and lumbar spondylosis and even ankylosing spondylitis. Next slide. And this sits between the 2 vertebrae and its main aim is for cushioning. We have a central nucleus pulposus and peripheral annual fibrosis. Next slide. As I told you, it works as a shock absorber. It allows motion, contributes to lordosis, holds vertebra together, and 25% of your height is with the disc. As you grow old, what happens? The disc becomes the water in your dehydration. And then what happens? Your height will go to less than 1 inch, etc. Next slide. And articulations, you can see there's an anterior longitudinal ligament, and on that side you can see the posterior longitudinal ligament and then interspinous ligament. All these constitute an anatomy of the vertebra. Next slide. Here also another thing, anterior longitudinal ligament, you can see the posterior longitudinal ligament also you can see interspinous. This is another. Next slide. And these are the dermatomes. So once you start seeing the patient, if you have a clear-cut knowledge about this, I know 25 minutes is too less for me to explain this, but still I'll explain you how to see all this. Next slide. And how does the disc gain nourishment? As you all know, you get low back pain. At any point of time, the disc will not give you pain. Disc doesn't have an innervation. Disc doesn't have a circulation also. Only if it starts irritating other person, then only the pain starts. So how the disc get nourishment is the diffusion between the 2 adjacent areas of the spine or spinous process. All this place where the disc get nourishment. Next slide. As you all know, an Ayurvedic person, you say Vata, Pitta and Kapha. Did you ever know that modern medicine also describe the illness into 3? It can be either degenerative or Vata, inflammatory or Pitta, or neoplastic or Kapha. So this is how modern medicine also describes an illness. Next slide. As you all know, it is a personal problem because you are the sufferer. It is a national problem because it is second highest to problem that the whole nation face other than headache or alcoholism. And third is it's a clinical problem. Why? Because you treat the patient, patient is not improving, you are also not improving, and both of them is suffering, and you end up, the doctor end up having a low backache. Next slide. So why a nostril problem? Because it is the second common disease next to common cold. 4 out of 5 is susceptible to all type of back pain, and at the age of 30, everyone shows degenerative change. Now you are all younger, less than 30 years. If you take an X-ray, if you take an MRI, there will be some, but don't think that you are going to suffer, because the spinal canal has enough room for all this, and only if the gap gets reduced more than that, then only pain starts occurring. And next, it is a personal problem, because once backache, ever backache. And it is a clinical problem. Multiple etiological make it physician's headache. Treatment is conflicting, unrewarding. Finally, physician ends breaking their back. Next slide. I think we'll go, because epidemiology is not much needed. Next slide. Next slide. So there are 3 different etiologies. It can be a nerve root pain, it can be a disturbance of the mechanics of spine, and there are definite defined spinal tumors less than 2%. The all other comes under 98%. Next slide. So what is cervical spondylosis? It is a osteoarthritis changes of the cervical spine, and which may lead to degenerative changes. Pain in the neck, radiating to back of head, shoulders or arm. Paresthesia, sensory loss, weakness, wasting, and reflex impairment. All are the common features of a cervical spondylosis. Next slide. As you all know, there are 5 types of pain we come across in cervical and lumbar spondylosis. First is a local pain. The pain that occurs locally. You have a trauma, you get a pain, you confuse it as a cervical spondylosis. See, the pain occurs not from the disc, but from the innervated periosteum. Periosteum is having a lot of innervation, lot of blood supply. So that is the first thing, periosteum. Then referred pain. So many times in your clinic, patient come with left shoulder pain. You think it can be a frozen shoulder or cervical spondylosis, but it could be a heart-related issue. So the pain that is not caused from the exact cause should be from somewhere else. That is known as referred pain. Then we have muscular pain. Muscular pain, these nerves are getting innervated in so many places, and all these muscles can cause pain, and that is known as muscular pain. Then radicular pain. People come just like this, catching hold of that pain, and he will not even lift or put his hand down. So much pain. And if he lies down, when the weight of the head is reduced, when it lies down, the pain reduces. That is known as radicular pain. And funicular pain. Anything related to the spine, we term it as funicular pain, because funicular means rope, and they consider spinal cord as a rope. Anything the spinal related pain, we term it as funicular pain. Next slide. Next slide, please. And as you all know, what are the common presentation? It's a pain, weakness, numbness, restriction of movement, and upper and muscular spasm. You see, we can divide cervical spondylosis into 2, upper and lower. If it is upper, the patient will have pain over the occiput region, and also numbness over the forehead and lateral part of the face. If it is lower, it can come towards the hand, etc., scapula. This is how we divide the cervical spondylosis into upper and lower. Next slide. And there are certain uncommon this thing, because as you all know, the disc can go laterally, the disc can go centrally. If the disc goes centrally, all type of myelopathies and bladder, have you ever thought that cervical spondylosis can create bladder dysfunction? Yes, bladder dysfunction can happen if this is going centrally. I hope you can imagine this. When I was studying, we never imagined that. But now as a practitioner, we find a lot of patients with bladder dysfunction and with having cervical spondylosis. Next slide. So, a middle-aged male, the tingling, numbness, pinprick sensation and the nerve root from more in the night. Symptoms usually starts in the neck or scapular region, frequently extend from shoulder arm to the fingers. Upper cervical root afflictions, pain extends to the occiput region. And it is exaggerated by walking, overactivity, jerky drive. If you go for a long drive, there will be lot of cracks occurring in your spine and disc, finally leading to this. And there the muscles are getting rigid and the condition. In acute root irritation, patient keeps a hand over the head, HOH sign, hand over the head sign. It can be either keep over here or on the back of the, that is what. Any attempt to cuff may lead to acute pain. Attempt to rotate the neck will lead to acute pain. You cannot do like this. That is known as Sperling sign. So we have learned two, HOH and Sperling sign. There will be cervical compression. Just make the patient sit down, try to give a compression over the scalp, the pain increases. The pain shoots out. And paresthesia in the periscapular region, deltoid and lower cervical region. So rarely motor weakness is seen. Next slide. Next slide. See, as I told you, if the pain increases during exercise or strain, always think it can be of discal origin. The pain radiates to the neck or leg. Weakness of the upper or lower extremities. These are the main thing you should think as a red flag sign. Next slide. Trunk appears shorter, buttocks look flat. On inspection, a transverse furrow encircling the body between the ribs and the leg. You can see there will be a small swelling over that region. On palpation, a definite prominence of the upper angle of the sacrum is also seen. This I will be able to tell you only if there's a patient whom I can able to show you. Next slide. See, this is a stage 1. You can see stage 2. Gradually it is going down. Stage 3. There is desiccation, and finally stage 5. There are 5 types of spondylosis. Next slide. And lumbar spondylosis is a degenerative condition, low back pain, sciatica, tenderness of the affected vertebra, lumbar movement limited and painful. Patient won't be able to bend forward. Next slide. So we term in various names, Kadigraha, Trikagraha, Grudrasri and Trikashula. All Brihatrayis they consider accepted Grudrasri as the common name. Next slide. And Griva Graha means the pain in the neck. Kadi Graha is, cut means avarane, area which is usually covered. Triga means area where 3 bones converge. Graha means catching and Shroni means pelvis. Next slide. So it is just one of the Vata Vyadhis. Trigagraha, Grivagraha, Prishtagraha, Sroni Bedam are all Nanatmaja Vyadhiya Vikara Vata. Nanatmaja means Vikaras caused by single dosha. Bhava Prakasha says Trikashula as mentioned in Vata Vyadhi. In Ashtanga Hridaya, Kadi, Trika, Prishtagraha are Pakvashaya Asrada Vada Vyadhis. So we should always treat Pakvashaya Vada. Next slide. And in cervical spondylosis, we consider it as Manya Stamba. Divasopna, Asanasthana, Vivruda, Urda Nirikshanai, Manya Stamba Pragurude, Saeva Shleshmanavrda. This is how we consider it as cervical spondylosis. Next slide. Then, what is Kadigraha? Vayu Katyashara Shuddho Samova Janedrujam Kadigrahasa Vijnayo Pangu Sakti Dvayasa. Next slide. So, Vada gets localized in Kadi, Shuddha Kevala Vada, Samavastha. Next slide. And then it, next slide. Next slide. It causes Druja, affecting bilaterally. Next slide. And we term it as Kadigraha. We always urge my students, you have to think out of the box. You have to think differently. Next slide. Then, Grudrasi. You know why it is known as Grudrasi? because Gridra means eagle. You start walking like a eagle. Speak Purva Kadiya Prishta Janu Jango Padam Kramat Gridrasti Stambaruk Tode Grinadi Spandade Muhu Vadat Vadakabat. So what I want to say is that here, next slide please. Gridra, next slide. Yeah. Acharya has told Dehasya Ayama Vakrada. You will have a scoliosis and there will be a slighting, you will bend like what our Malayalam film actor Mohanlal does. You will walk like not in a straight way, that is in a bent way you have walking. So these are the different lakshanas of Kadigraha which we come across in our text. It can be in Amavada, Katyamvada, in Pakvashagadavada it is Prushta Kadigraham. Next slide. Next slide. And Gudagadavada, it's also that Kadigraha has been told. Vadaja Arsha, Kukshi Vasti Shulam has been told. Sarvavada Vradavada means Prishtaruk has been told. All these areas where there you can see reference of Kadigraha. Next slide. There is another concept called Jadavada, usually seen in elderly, where the people get low back ache. Jadavada, that means in age, there is abnormality to old age and usually affecting the vertebral column. And it is because of the depletion of dhadus, usually after the age of 60. And we people are the good person or people who are ready to get all those. Next slide. So what a patient coming with this, what are you going to do? You have to go for a blood test. Complete blood count, ESR, rheumatoid arthritis, HLA. Then X-ray, lumbar and cervical spine AP lateral, CT scan. MRI is the gold standard in the investigation of spinal problem. Next slide. See, you can see here, there is the gap has been eroded. Next slide. This is a normal spine of the adult where you can see all this. Next slide. See, the space has been eroded. I have kept an arrow. You can see the first lakshana of Vada means Karsha Ushna Kamatva. That means the disc become black, you can see it here, and then dehydrated. So that is how we have to start explaining in Ayurvedic way. Next slide. Next slide. See, this is what? Disc is just like a Kerala parota, where there is a concentric circles of this, and you can see, you can just identify a disc. If you keep a bullseye in top of it, this is exactly what a disc is. Next slide. So next time when you start eating a parota, you should think that it is a disc you are going to eat. So this is a stage 1. You can see it is gradually protruding and there is extrusion and sequestration. This is how the herniation of disc has been occurred. Next slide. And there are different names. First is disc degeneration, prolapse, extrusion, and sequestration means the nuclear material is coming out. Next slide. Next slide. Here also you can see different types of, next slide. Next slide. You can see there is a bony spur over that region and narrowing of the disc. So once you get an X-ray of spine, there are 13 things you should see. I will share this slide to you. All this, it is because of time, I won't be able to explain all that. There are 13 points you should see in a spine of any person or X-ray of a spine you see. Next slide. You can see the MRI where there is a dehydration and the disc prolapse all the. Next slide. Next slide. So, coming to ankylosing spondylitis, the chronic systemic inflammatory disease affecting the spine, the sacroiliac joint, pelvis and some peripheral joints, and this has been already told. The patient starts drooping forward. He won't be able to bend forward. Next slide. You can see here a bamboo spine deformity. Can you see that? Can you appreciate that? Bamboo spine deformity? Yes. Next slide. Next slide. Here also you can see bamboo spine deformity. There are various tests to confirm it. First thing you should see is you should go for HLA-B27. That will give you an approximately good idea. But don't think that just because a patient is HLA positive doesn't mean that he is having ankylosing spondylitis. Just because he doesn't have an HLA doesn't mean that he doesn't have. There are certain tests clinically plus hematologically you have to prove it. Next slide. Next slide. Here you can see bony bridging of across the vertebra. Next slide. And the patient complained that he cannot breathe or having a heavy breath. When he starts inspiration, ask him to deep inspiration, the patient get pain because there will be stretching of that muscle leading to this. Next slide. Next slide. This is how the patient, he cannot bend forward properly. Next slide. Next slide. So always examine the his first for lumbar spondylosis. Next slide. Next slide. And just because you don't know the name doesn't mean that you are not a good physician, because all nomenclature is not there in our text. And as Dr. Gomar said, Adhado, Ankylosing spondylitis, Vyakhya, like that, we don't have a chapter like that. So we have to analyze through dosha way. Next slide. And inspection, spinal deformity, palpation, spine, paraspinal muscle, all these areas have to be palpated. Next slide. And tripod sign. Patient is made to lie and sit, and you are trying to lift the leg up. The patient cannot do. He has to keep the both hands back, and that is known as tripod sign. Next slide. And SLR, everybody knows, straight leg raising test. Next slide. And there is cross SLR, LESAG, etc. has also been told. Next slide. This is LESAG or bowstring sign. Next slide. Bragard sign, that's also after performing, you just dorsiflex the angle and there the pain will be increased. Next slide. Femoral stretch. All these tests you can do it clinically, and the amount of confidence you and the patient gain will be enormous. So whether the patient, you make him lie down, try to examine the patient, then you will get more confidence. Next slide. Then which are the myotomes, which is the knee jerk, deep tendon reflex, all this has to be taken care of. Next slide. Then there is a normal walking, toe walking. This is a normal walking. The toe walking and also the foot walking, the patient won't be able to do it. Heel walking and toe walking. Next slide. This is S1, you won't be able to walk on the toes. Next slide. And there will be less sensory loss in L4, L5, S1. This is the areas where there is a loss of sensation. Next slide. Reflexes also. Next slide. So, first thing, I'm going to treatment. That's what I want to concentrate. First thing you have to tell is ask the patient to lie down, because once the patient gets lie down, the disc get plenty of nourishment and all that's been, it will be easily. Next slide. And in Ayurveda, we term it as Vadagopa, Dhadus and Upadhadus. Next slide. Next slide. And what to do? What to do means we have to do Bandhana, bandage, Snegavasti with Danyanda Thailam, Murivanna, Tiktagradam, Gulgulu Tiktagradam, etc. Next slide. And then there are 3 stages. For acute stage, you should do Karaskara Kshiradhara, Dashamula Kshiradhara. And then intermittent traction, 1/10 of the body weight. Then infrared radiation. Then there are certain lay pass, and as usual, all medicines. And for subacute, we should go for Rukshasveda and Panchakarma. For chronic, we go for Panchakarma, internal medicine, and Sarasa Shastika Pindasveda. Next slide. So, as I told you, acute condition, bandage and immobilization. Chronic phase, Vada Vyadhi Chikitsa. Next slide. Next slide. We'll go fast. Yeah. And you can go. We'll go for fast. Yes. Then we have to do daily Virejana. We have to make them undergo daily Virejana. Next slide. And Erenda Vardhamana Prayoga is one of the other things which have got lot of results. Next slide. Then equal quantity of Erenda Thaila and Nirgundi has to be taken. This is a drug of choice for low backache and also for the neck pain. Next. Belaguluchadi Vasti, next slide. Importance of Vasti is also is been told for Grudrasi, next slide. Vaidana Vasti is the one thing which in Kerala we use a lot, next slide. IVDP you go for Yoga Vasti, Grudrasi, Kadi Vasti and Vaidana Vasti. For osteoarthritis, Madhu Dailiga Vasti, Madhu Yashtyadi and Kshira Vasti. For ankylosing spondylitis, Kshira Vasti, Mustadi Rajayabana Vasti, Habushadi Rajayabana Vasti. Lumbar canal stenosis, Matra Vasti and Lekana Vasti. Next slide. And Nasyam is also being prescribed for Griva Graha. Next slide. Uttaravasti is also given for central, due to central disc prolapse. There's a lot of urinary infections and urinary problem. We give Uttaravasti. Next slide. So, to sum up, rest, heat, manipulation, analgesic and mild immobilization. Rest preferably in hard matters, Vadahara drug. The Kashaya which we use is Rasana Saptaga, etc. Next slide, next slide, next slide. This, I will give you this slide for you to refer. Next slide. Rasayana Jilsa is also one of Lashuna Rasayana, Tila Rasayana, Chitra Rasayana are the drugs of choice which we usually do. Next slide. For lumbar canal stenosis, Chitra Rasayana is done. Eranda Vardhamana Praga which we have done. Next slide. Next slide. Next slide. This we already. Next. Now I am talking about the Marma preparation, Marma point manipulation. You can see for Vada Jakapa, Vada Grudrasi and Vada Kabaja Grudrasi. Next slide. And what are the Samprapti Katakas of the one case I am talking? Next slide. Sciatica. Next slide. Next slide. This already we have. See, previous. These are the Marma points which Pada Kshipra Marma, Pada Talakrit Marma, Gulba Marma, Indravasti, Janu Marma, Ani Marma and Urvi Marma. Next slide. And in Tamil Marma we also manipulate Uchi, Churihadi, Choradandagalam, Pushti Marmam and Nangana Purta. Next slide. Next slide. Next. Next. How to apply? Previous. Each marma is simulated 16 to 18 times in the same rhythm of you inhale and exhale by digital pressure of one sitting. The rhythm of stimulation is same as the rhythm of respiration. Next slide. You can see this is Kripra marma. Next slide. This is Talakrit. Next slide. Gulbha marma, Indravasti and next slide. Janu marma and then Snayu. This is also by it's a what's known as Urvi Marma. Next slide. And Urvi Marma is this. And these are the areas where we are trying to manipulate. Next slide. You can see before it was this and after it was that. This is before and after. Next slide. Before it was this and after it was that. Next slide. Before and after. So, I tell you, with the strength of Ayurveda, we will be able to treat almost all disc case also. You can see here a MRI of a disc before treatment and after treatment. Next slide. You can see the small that has been totally gone. Can you ever think that a disc which was earlier there after treatment already receded? Dr. Srival's son and so many people have recorded so many of the patients before and after. Next slide. Here also you can see that this is the first MRI and after 3 weeks of treatment we have taken another MRI and the whole thing has been resolved. Next slide. You can see here after that also there is another MRI. Next. That has totally gone on the other side. Can you appreciate that? Next slide. Next slide. So it is highly impossible to correlate the modern classification of back pain with that of Ayurvedic counterpart. CS? Okay. So we will be able to give a proper cure for cervical spondylosis, lumbar spondylosis and ankylosing spondylitis, provided we think in the most Ayurvedic way. So whether surgery is needed or not, I tell you, I have never come across even one single case where surgery has been done after our treatment. I have been practicing for the past 30-36 years. Not even one single case was there where we means Ayurveda has failed. So I always tell my students, if I can do it, you should be able to do it. There is nothing hidden in this. You come to our hospital, we will show you how to do this treatment. I always welcome my students. Please come. You will be able to, you will get new insights, because whatever I say, you can start from where we stand and start from that place. So thank you. Next slide. Next slide. So Ayurveda is now the first option for this condition. People are swarming around Ayurvedic practitioners. Next slide. Any questions, I'll be able to explain or answer. Next slide. Thank you. And I run a hospital by name Triveni Nursing Home in Trivandrum. It is a 65-bedded, purely Ayurvedic hospital, right in center of Trivandrum, where plenty of normal super specialty hospitals are there. I don't use even a paracetamol in our hospital. So if I can do it, you should be able to do it. So I thank the organizers for inviting me for this. Next speaker is my classmate, Dr. Srivalsan. He will start from where I stop, because he is such a good, interesting speaker, and I welcome Dr.
Thank you. Thank you so much, sir, for your immense knowledge on the topic and evidence-based information. Thank you so much. Now I would like to request Dr. Srivatsa Kerala for the frozen shoulder and CTS topic. We welcome you, sir.
Namaste to all. Dhanvantari Samarabdha Sushruta Yascha Madhyama Asmadacharya Varyantam Vande Guru Parampara. At the outset, my respects to my teachers, Dr. G.S. Raju, Dr. Jay Chandran, Dr. Mohan Lal, and Dr. Chandrasekhar, and all the galaxy of Marma teachers who were there to teach us the Shalyatantra, orthopedics part of the Shalyatantra over there. My regards and respects to the organizers, and thanks to the organizers for having invited me over this to share my experience. And I thank Dr. Suresh Kumar, who has set the tone for today's workshop on Marma and orthopedics, etc., related subjects. I was just asked to talk on CTS and shoulder adhesive capsulitis or frozen shoulder. But now we can, as an Ayurvedic person, we can see that we can take the whole thing into consideration only. So some allied conditions also. So today's time is very less. I had been asked to stop after 20 minutes. So we'll just run across many of the aspects of the common aspects of the subject has been spoken by Dr. Suresh, including the pathology and how to approach the patient and what are the examinations usually done. So it's quite common in all these conditions, musculoskeletal conditions. So I'm not also over-embossing with the Ayurvedic terminologies, which we can surely discuss this one. I will just go through very fast, because I will show you some of the 1 or 2 slides also, which may take 5 minutes. The video presentations 5 to 10 minutes. So we'll go off now. This is a place where I practice. And this is a habit, our habit, thanks to Rashtriya Ayurveda Vidyapith also. Being a guru, I can see Dr. Parvaje sir and all the other galaxy of teachers here, with the most senior one, Dr. Anjanaya Morti also. So we all have the practice of what we learned to be transmitted to the next generation. So that's why we can see that this is my active OPD. During the session itself, some teaching is going on. So now, right into the subject, we have the disorders of the shoulder, common conditions which we are in the current time. Now I can call it Amsa Abhigada, Amsa Marma lesion, Amsa Phalaga lesion, Katchadara lesion, Lohidaksha lesion, Bahvi lesion, or Kurpara lesion, or Indravasti lesion, or the wrist things like Madibandha lesion, Kurcha lesion, Kurcha Shiro lesion, or Chipra lesion, etc. But as a matter of fact, now we have to communicate to the crowd now. So we have disorders of the shoulder, which we usually consider as frozen shoulder periarthritis, supraspinatus tendinitis, recurrent dislocations, painful arc syndrome, supraspinatus calcification, drop arm syndrome, etc. So drop arm syndrome, where we now are going to talk about the conditions which are in these, when we talk about frozen shoulder and CTS, we are going to talk about the conditions under the umbrella of Ababahuga and Vishwaji. So I'm not going to explain over these things because time is a constraint. Now, frozen shoulder, also known as adhesive capsulitis, is a condition causing pain, stiffness, and reduced movement in the shoulder joint. It happens when the tissue surrounding the shoulder joint becomes tight and thick and restricting. You see that when it happens, this is the most mobile joint. And so we know that whenever there is a restriction on the left hand, if you are a right-hander, sometimes you can manage very easily. But if it is on the right hand, you can say that I will be restricted to hold my mic like this, not even move like this. So the day-to-day activities, how much it is getting affected, you will be knowing when we see that this is a picturesque representation of that. Remember one word Dr. Suresh Kumar told, go back to your anatomy, my dear students, go back to your anatomy. We have to learn more kinesiology and biomechanics when we are studying Ayurveda, because we are talking about live anatomy where much of the information is not there in the cadaveric anatomy. When we do the cadaveric anatomic dissection and try to even see the marmas, which is a fallacy, we are not able to understand that whatever the clinical symptoms, signs which are coming, how we are going to manage it. So really we have to go and learn kinesiology and biomechanics when we are going to practice Marma as it is, or in Panchakarma also, or anything rehabilitating the musculoskeletal system. Okay, common stages of progression is frozen shoulder typically progresses through 3 phases over 1 or 2, 3 years. So that's why we see that some of our allopathic friends claim that, no, you don't have to do anything, you have to just give rest. You know that body will do what? To restrict the pain or to control the pain, it will cause stiffness. Now we are at the crossroads where we have to manage the pain so that the stiffness is not happening. So we have to create movement. We have to do the chalana, and then that will cause pain. We have to control the pain, or we have to manage the pain as such. So Ayurveda is the best method, and Marma Chikitsa is the best method, where when you try to rehabilitate, you are causing pain, but we are controlling the pain. You are giving snehana and swedana and then restoring the movement also. So that's what we do. So freezing or the painful stage, very much difficult the patient comes, because it is all of a sudden sometimes. Sometimes there are other factors which are there. Frozen or adhesive stage, less pain but significant stiffness, not able to move at all. Thawing, gradual or thawing stage or recovery stage, gradual improvement range of motion lasting 5 to 24 months. This we have to be aware of, because in what stage the patient comes is very important. Because if you don't know that, then your approach, our plan should be according to the Kala Pariganana, where how much time has elapsed and what is the type of patient, which we will be looking at now. Okay, risk factors. Certain risk factors, age and sex, most common in women, age at 40 to 60, I think all the clinicians will agree. Immobility, and if they are not at all moving, I told that the frozen shoulder condition becomes severe. Systemic diseases, higher risk with diabetes, thyroid issues, Parkinson's and heart disease. Many a time we diagnose their diabetic situation when they come with this complaint. Diagnosis involves a physical examination, checking shoulder movement. So range of movement of the shoulder, everyone be thorough with it, so that you can diagnose properly which are the muscles which are affected. For example, supraspinatus, if it is hurt, then you will not be able to initiate the abduction. Now many a times as Ayurvedic people, I tell you that sometimes we fail in describing what is flexion, what is extension, etc. So be very careful about that when you try to communicate with the modern crowd. Okay, I'm not going to tell much with the signs and symptoms or other things like disorders of the wrist. We directly come into tenosynovitis, carpal tunnel syndrome, de Quervain's disease, repeated stress injuries, wrist drop, deformities, and CTS is sometimes like a repeated stress injury. You can see that I'm not going to read through the conditions as such. Now, as a Marma physician, I take most of these conditions, like Rudrasi also, all spinal conditions, all musculoskeletal conditions may be due to their occupation or their posture, their ergonomics, whatever we call, that contributes for the malalignment of the system. So, no chiropractic and all, osteopathy and all, you know, that it is aligning the spine or the bones to the proper way. So CTS is a work-related disorder, is often caused by such work activities which require repetitive or forceful movements at the wrist and the hand. So this movement, you remember Charlie Chaplin in the, what do you call, the modern times. That's the best example. Bending down the wrist or making the same wrist movements again and again, some occupation requires that. What happens is that the fluid pressure in the tunnel through the thickening of the synovial tissues that lines the tendon in the carpal tunnel and swelling of the membranes around the tendons. So you can see that there is a Kandara Shofa, there is the Shleshaka Kaba there, that consistency of the Shleshaka Kaba becomes different. Then hand-arm vibration, any this thing which is heavy manual works involving hand-arm, vibrating tools, etc., working for long periods in the same position. Very high-risk workers are meat, fish packing industry, assembling of airplanes, automobile workers, musicians who do with the percussion or the other instruments. Cashew peeling is in the big industry in Kerala where this is a repeated movement is done which happens over there. There is a chance for CTS. Okay, mild CTS symptoms affect the hand and sometimes the forearm. They can also ascend up to the shoulder. This is where we can relate it to the Vishwachi, where the kandaras from here are affected and they radiate towards the upper side. You have two types. When it radiates down, you consider all the neck and shoulder symptoms, but when it is radiating up, we consider this one. Pain in your hand, forearm or the wrist that wakens you at night. Ratro jag. It all increases during night. All these muscular snayu vikaras, sandhi vikaras are all shown much during the night. Shaking or moving your fingers might ease the symptom. Whenever it is there, if somebody you see that they are doing this, then you can understand that they are having this problem. Occasional tingling sensation and feeling of pins and needles or crawling ants. These are also purva rupas sometimes exhibited, told by the patient. Now I am going again, not too much symptoms in progressive disease, intermittent numbness, again like this only, occasional pain in forearm. So you see that it is a CTS condition only, it is located over here only in the Manibandha only, but now you get the forearm pain. So that's why as Ayurvedic persons see that Dr. Suresh was talking about the axial skeleton, we are talking about the appendicular skeleton with its addenda. Burning sensation, etc. Relief, shaking or moving, jerking hands. Now less specific symptoms, again you see that it is loss of strength of grip. Sometimes patient is not able to grip. Long-standing symptoms is permanent nerve damage. Only this can be analyzed by, because all the other things will not be detected. Nerve conduction velocity test or any other neurophysiological test will reveal that whether there is any permanent damage. And as far as Marma is concerned also, whenever we are having a simple disruption of the Marma point over the area over there, we call it Marma Upatapa. And whenever it is totally damaged, we call it Marma Upagada. Whenever Upagada is there, revival is difficult. Weakness and atrophy. You can see that the muscles start atrophying. Those which are feeding this one, once they don't work, thenar eminence, etc. will be wasted away. You may accidentally drop your brush while combing or a spoon while eating. That is one thing which brings the patient over also. I'm not able to hold like this. Okay. Now CT is one of the most common causes for absence from work because everything now requires the fimble movements of the hand, the fingers, etc. So when you are not able to do that, that brings the patient to you. Loss of pinch strength, weakness of palm or abduction, moving away from the body like this. And symptoms of CTS often occurs in both hands, but they are usually worse in one hand than the other. So that's why once somebody is having a surgery over in one hand, later after 6 months they again find out this one and they go for the surgery for that. Not all pain in wrist or hand is caused by CTS. Similar symptoms as those of CTS may be found when there is injury to the muscles, ligaments, tendons or bones. That is abhighata janya vigaras can be there at the Manibandha sthana if it is happening. So reference from Varma Shastra, when we are going to Tamil Varma's many of the points are Manibandha Marma is Manibandha Marma only. But the approach in Tamil Varma is for manipulating it, for getting relief also. So I'll just, for the creating interest in you, I'll just, many of you will be exposed also. Neck pain, Manibandha Varmam, Mudichu Varmam, Kakattai Kalam. Neck pain radiating to the upper limb, Mudichu Varmam, Kakattai Kalam, Chavu Varmam, Kauli Varmam. Kauli is our Chipra only. So now few of them I have skipped. Now tennis elbow very commonly, Tida Varmam and Kaimutu Varmam, Kurpara Varmam. Frozen shoulder, Piradari Varmam and Kadirgama Varmam. So these are the Varma points which are manipulated. And mind, I'll tell you one thing, that each Marma point can be manipulated in 12 different ways to get 40 different results. So that much wide is the Tamil Varma Shastra. And it will be always good that Egam Shastram, Madhyanana, Vidyat Shastram is same. When we are having Marma Vijnana, go for Tamil Varma Vijnana also, which is a very big ocean. And it is very, very little you can see that. General principles of Marma treatment are Santvana, Snehana, Jivaniya, Brahmana, Stambhana, Ropana, Vadapittagna, and Balya Rasayana. The importance of Balya Rasayana also has been told, use of Chiravala 101, Dhanvantaram 101, etc. So this is the general principle. Now we don't have time to explain on that. Methods usually used in Kerala Marma Chikitsa, which includes the use of Panchakarma Chikitsa also, apart from the manipulation and Marma massage, etc. are Abhyanga. Abhyanga is the Marma massage. Nadi Marma Abhyanga it is called. Then you have the Pichu and Pichu Bandha, Lepana, Bandhana, Veshtana, Trasana, Sekha or Dara, Nasya, various types of Pindasveda. Various types of Pindasveda. My dear students, you have a lot of new types of, according to the requirement, whether it is for the Snayu, whether it is for the Sandhi, whether it is for the Asti, whether it is for the other structure, Mamsa, you have different types of kiddies being made. So you know that whenever, and according to the karma, whether you want a Shodhana there, whether you want to have a Shamana there, where you want to have a Brahmana over there, then also the addendums in the materials of the put into the pottery differs. Treatment, internal medicines given by oral or other routes, external treatment given locally on the site of Marma injury, psychological and rehabilitative treatments are also advised. See, when I come directly to this one, leaving many of the, what you call, tinal signs, that examination, this examination, etc. Now, my dear students, we feel that we know much about the pathology, less about the treatment. That should not happen. We should be sure about the diagnosis, but as Sir told that you cannot always directly correlate with your principles. So be with your principles and go for the treatment. Internal medicines given by oral routes, external treatment given by locally on the site of Marma injury, psychological and rehabilitative treatments are also advised, because Sattva Avajaya is very important as far as pain management is considered. A patient comes with Ababahuga. If you are sure to tell that, okay, after 1 week of my treatment, you are going to be better, she is going to be better. The Marma Guliga, Aushadha Yogas, usually Marma Guliga, Lagu and Bruhat, Nagara Dileba, Marma Kashaya, Nadi Kashaya, Murivanna, Ashavanna. So Murivanna you would have heard, Ashavanna is to cause Ayavu or movement. Our Ashavanna is that, Ashavanna is a Siddha, what you call, Tamil Varma preparation, Agastya Marma preparation. Some companies have it. Now our own Ashavannas are Chinjadi Taila, Parinada Gairi Chiradi Taila, Kottan Chukadi Taila, whichever having Masha Saindava Sadidam Tailam, Sankocha Vada. Whenever Sankocha is there, to remove the Sankocha, to get Sramsana, whenever it is tight, you have to make it loose. So those things will be useful there. All Kashayas and Taila Yogas mentioned in Vata Roga and Vata Rakta Chikitsa, according to the Avastha, you can use it. Factors determining the treatment is that the patient's build, the strength, whether it is associated with other diseases or Kevala. That is very important. Whenever it is having other comorbidities, then the treatment effect is different. Occupational or not, then location and Vektasthana very clearly where it is locating, where it is Prakatita. For example, the patient may having, now one example I will give that when we study Apabahuga, Amsamula Sthido Vayuhu, we tell that. And whenever we are taught about Amsamula, we point to the axilla. But as far as the Marma Vijnani is concerned, the Amsa is between the neck and the shoulder, that is the Madhyama Bhaga, where you put your finger over here, that is the Amsamula, because you see that the rotator cuff muscles have all originating from there. So you see that proper understanding of the padas and the word, not mixing with the modern terms, will give you better knowledge of that. Selection of treatment depends on accurate diagnosis, structural damage, the grade, duration of symptoms, personality of patient, demand and requirement. My dear students, if you have a shortcut method, okay, you are having a slip and then, okay, Dr. Srivats is going to tell these treatments, it will not work. It depends on the avastha only. If Nagaradi Leba has to put, that avastha should be there. If Pichubanda to be done by Murivanna, that avastha should be there. And that is what you learn by experience or from a teacher. Classification of patients for Ayurvedic treatment based on occurrence. Now, we will classify any musculoskeletal condition with neurological or circulatory defects into 4, where we can see that acute onset, it will be always Bhagna Chikitsa, Marma Bigada Chikitsa and Shofa Chikitsa. If it is a gradual onset, Vada Vyadhi Chikitsa can be started according to the avastha. Gradual development but sudden onset, a combination of above treatments will have to be done, because there will be an acute upon chronic situation. Son, I was quite okay, but since yesterday I am not able to do anything because of the pain and the stiffness. So there the avastha is different, where Agni Karma, Vidya Karma, etc. will be very useful. Recurrent all types of, all the above with Balyas, Thairyagara, Astidadu Chayhara, Rasayana Chikitsa, etc. can be done. And treatment principles of Vada Vyadhi, Bhagna, Marma, Shofa. Now, if you see that, whether this Marma Chikitsa is speaking of Marma Chikitsa or Ayurveda. Marma Chikitsa is a part of Ayurveda. And so all the modalities which are there, like Apadarpana, Alebana, Parishega, Abhyanga, Svedana, Vimlabana, Mardana, Upanahana, Mardana, Vyadhana, Visravana, Snehapana, Virechana, Anchana, traction, Bandhana, Veshtana, Kabadashayana, Snehavasti, Kashayavasti, Agni Karma, etc. can be used. Shamana Aushadhis have to be used. And Astidaduvardhikara Chikitsa, whenever there is a long-term situation where movement is arrested, the regional bones will go for what you call degeneration. So there you will have to see that it is reorganized properly with Astidaduvardhikara Chikitsa. Massage methods are effleurage, petrissage, friction, tapotement, vibration, myofascial trigger point therapy, connective tissue massage. My dear students, again I tell that, we in Kannada you tell that, kayyil benne ittukondu oorella tuppake oduvodu, something like that. Now we are having in our Shastra, in all the methods, the Shashti Upakramas, when you learn the proper Chikitsa methods from the experience, you don't have to run for learning chiropractic. They are all useful. But apart from ours, what is useful you have to take. Okay. So that's why I am telling all this myofascial trigger point release, connective tissue massage, all that you can learn. So now I will show you one of, this was a very, very critical patient, where critical in the sense she was very tight, no movement at all. It is a post-traumatic and very long rest was given. She was not able to, Agni Karma was done in the Amsa Marma, up to Amsafalaga Marma, and then this one. So which gave very good result. So right from the pidary is also important in all these conditions, because it is always a shoulder neck complex. You don't have an isolated shoulder. You don't have an isolated neck. And you also have the pectoralis over there. So this patient day before yesterday came, and I am very surprised also that now question of whether Agni Karma can be done in Marma Chikitsa, in Marma points, Marma areas. This patient got very good relief. She was falling at her feet, that she is now able to do all household chores. So before and after, I am not able to, I am just showing this one simple way of Agni Karma with Kumari Surasa, etc. Now shoulder massage, as it is, you will see that how extensive. Abhyanga is not just painting with oil or just moving your hand out like that. but it has comprehensive movements, which also I can show that this is a sports person who had come with in the vacation massage, they call it. He had a problem, he is a thrower, he is a runner, so he had a problem at the neck shoulder complex. So you can see that how the hands can move, and that's my own hands, including as Suresh sir told that then if the neck and the shoulder are involved, the upper dorsal spine also is involved, which will have a reflection on the lower spine also. Any patient with the cervical spondylosis, he will come with lumbar spondylosis later. So don't treat the spine or any part of the body isolated to that joint only, which is the modern concept. Treat it wholly, treat it fully. You can see that even for the shoulder facilitation, the muscles, then you have all the movements which are given, which are releasing the subscapularis, the suprascapularis, etc. along with that's what I told, that you will have to learn the kinesiology, movement of the body, what ails when, what, etc. Okay. Now this is another bandhanam of the hand, because usually, I think that was not working. Okay, bandhanam of the hand, time is also up. Care of the marma, avada varjanam nityam swastavrattasya anuvartanam utpannarthi vigadanam marmanam paripalanam. So, since we told that this is now we call about lifestyle activity, diseases, etc., etc., and they have already shown the thank you. So, with that, actually for us, everyone, it is Ayurveda is Marma Paripalana. If the three Marmas you are able to do Paripalana properly, there is no need for much of these treatments. But when we are not able to do that, we have to do it. So Marma Vijnana to become a better equipped Vaidya, and that too in musculoskeletal conditions with neurological or circulatory complications. I wish that this talk ignited something on you to inquire something, invest some time on that, involve in that, imbibe the knowledge, and then I wish you all the best. Thank you very much. This is a photo from Dr. Suresh Sir's place where RAV workshop was done. We had great people like Shashi Tarurji and all inaugurating it. And this is my teacher, Dr. G.S. Raju, and that are a few of my students. Thank you very much. Thank you for the occasion.
Thank you. Thank you so much, Dr. Srivatsa sir, for enlightening scientific sessions. And thank you again. Now I would like to request Dr. Vittal Hudar, New Delhi, on the topic gouty arthritis and AVN. Welcome you, sir.
Good morning to all. First of all, I would like to thank the organizers for giving me this opportunity to present my few views in front of the stalwarts of Ayurveda practitioners and all the scholars gathered here. So in the next few minutes, we will understand the gouty arthritis and avascular necrosis of the AVN in Ayurveda purview. So if you see, this is one publication in JAIM where one clinic has been randomly assessed how the patients of osteoarthritis and rheumatoid arthritis and gouty arthritis and many other spinal conditions will come to Ayurveda practice. In general, we can see the trend of approach of these patients for Ayurveda treatments. In allopathy diagnosis concerned, if you see the osteoarthritis is the top one, followed by the rheumatoid arthritis, and then is the gouty arthritis, which we are going to discuss today. And as per the Ayurveda perspective, if you see, the Amavata is diagnosed as the highest, and then Sandhivata is second, and next is the Vatarakta. So this is the trend of patients which are coming to the Ayurveda clinics. So if you see actually the statistics of this osteoarthritis, gouty arthritis and rheumatoid arthritis, the prevalence says that osteoarthritis is highest, gouty arthritis is second, and the rheumatoid arthritis is almost third. You can see the numbers there. So only the thing is the difference little bit, osteoarthritis, Sandhivata, what they are coming in the Ayurvedic diagnosis, Amavata is coming more. So this is because the approach of these prevalent patients approached into Ayurveda is little bit different. Okay, and the diagnosis also. Okay, sometimes we diagnose the same condition of rheumatoid arthritis as Vata Rakta. Sometimes we diagnose that gouty arthritis as Amavata also and Vata Rakta. So this type of differentiations in the diagnosis will make this sort of this. So usually another reason is the gouty arthritis is little bit well managed in the conventional line of treatments, hence the coming to Ayurveda clinics is little bit less as compared to the Sandhivata as well as the Amavata, where the chronic conditions which have a allopathic treatment as a conventional treatment is having a limitations, they will approach to us. That's why the number is more as compared to that. So all of you know that this gout is a deposition of monosodium urate crystals in the tissues, and it depends on the intake of this purine in the diet and the endogenous production of cellular turnover and its excretion by the kidneys and the GIT. So that production taking of purine intake is only 10%, maximum contributes is 90% contributes the compromise in the renal under excretion. That is the main reason for that. You see the etiologies, very nicely it has been explained. So this Vata Vyadhi and Vata Rakta has been together. Almost it is a similar condition of Vata Vyadhi only. Only the Acharyas have explained that it has been separated because it is having some more involvement of the Pitta and Rakta, and as compared to the other Vata Vyadhis, this Vata Rakta represents little bit separately, and the line of treatment changes from that of the Vata Vyadhi, concentrating on the Pitta and Rakta. That's why this has been separated from the chapter of Vata Vyadhi. So otherwise, all you see the Nidanas has been separately mentioned. Apart from the Vata Vyadhi, Vata Rakta Nidanas have been separately mentioned and identified. The Rakta vitiating factors and the Vata vitiating factors have been separately mentioned. And because of the Pitta and Rakta involvement of the Vata, Vata Rakta, Gatavatas, and there is a Avarana pathology is the second one, where Raktavrita Vata and other conditions will present a little bit different presentations. You can see very nicely it has been explained. See the seafood, red meat, such things. It has been explained. See, Lavana Klina Shushka, Ambuj Anupamamsa, Pinyaka Mulakahi. Very nicely explained. Purine rich vegetables and the cereals, Kulatta Masha Nishpava Shakadi Palalakshibihi. So, and the fermented products and the excessive sugar intake, Dadi Aranala Savira Shukta Takra Surasavehi has been explained. And if you see the lifestyle factors, nocturnal sleeplessness and the daytime sleep, that is Divasopna Prajagaraihi, sedentary behavior and the physical activity. So that is Prayashaha Sukumaranam, Mishtana Sukabhojinam, Achankramana Shilanam has been explained. And if you see the constitutional factors, the persons who are inactive, obese, those patients will be Achankramana Shilanam and Pradushte Shonita. So that has been, and Abhigata is also told, which we consider usually for the Nidana for the next, that is AVN. So that we'll see again. So these are the other Vayu Vivruddho. So that is Adhyanam Prayo Bhavatiti Adya Rogaha. So this is the similarities what we can see in a clinical practice definitely matches with that. That is going to help us for the Nidana Parivarjana Chikitsa. So if you see in the allopathic pattern, due to time constraint, I am not going to explain much of that. If you see all those factors as explained in Ayurveda, alcohol intake, all the food and those things, increase in the urine, then the important is the parva sandhis have been affected more, and it has been justified in allopathy also because of the repetitive trauma to the first metatarsophalageal joint, that is the weight bearing points, and the second point is crystallization occurs more readily in the cooler areas, that is the peripheral joints as opposed to the proximal joints, that is big toe, ankle, knees and wrist. All this matches with the lakshanas which have been mentioned, starts with the parva sandhis and later the bigger joints have been explained. That also matches with that. Later it produces go on. If it's untreated, lastly it is going to produce the painful warm swollen joints and the tophy in the tophaceous gout. So that is the advanced stage. Initially starts with, if you see the samprapti of that, again, definitely the involvement of the Shonita Roga, Tatra Shonita Rogaha, Vata Shonita is one of them, it has been explained. And the Vayu Vivruddho Vruddhyena Raktena Avaritaha Patihi Kritsnam Sandushet Raktam Tadneyam Vata Shonitam. So Avaranajanya pathology is another one. And if you see that previous flow chart, you can compare this one, this shloka is very nicely explained. Saukshmyat Sarva Saratvacha Pawana. So Pawana Srijaha, Srija having Drava and Saratva, Gachan Sirayanaihi. Moves throughout the siras parvasu abhihatah kshubdam vakratvad avatishtate. Everything, all the symptoms, pathologies explained are almost matching with this. Sthitam pittadi samsrishtam tastaha srajati vedanaha karoti dukkam teshu eva tasmat prayena sandishu bhavati vedanastataha bhavantihi vedanastata atyartam dussaha nranam. That's a very painful, you can imagine. So these three states are there. Initially the patient comes with a monoarthritis, initially occasional pains. In such a condition, what is the approach? And next, see asymptomatic hypouricemia, occasional pain, acute gouty attacks, and the intercritical period, and the chronic tophaceous gout. These are the stages. Accordingly, this is the diagnostic criteria of gouty arthritis, American College of Rheumatology. So you can see here the clinical presentations, almost as I have explained before, Gambhira Vatarakta and the Uttana Vatarakta. Usually the vascular and skin conditions, if you take out, the Gambhira Vatarakta usually attributes to this type of gouty arthritis and AVN also. Both will be considered as a Gambhira Vatarakta and Asthimajjagata Vata. So these are some of the complications have been explained, almost same as that of the conventional medicine has been explained. These are considered as asadhya, he has told. So this is the treatment approach: lifestyle modification, acute phase management, urate lowering therapy, and alternative agents. So this is the conventional approach. What is our approach? So these are the previous one, these are the gaps in the treatment strategies. That's why the patients come to us. That is the drug intolerance and the adverse effects, and the poor long-term adherence. That they consider as a symptomatic treatment, and again it reoccurs for the permanent solution and other things for the proper understanding. Now the patients are slowly turning to Ayurveda. As sir was telling in the initial slides, the allopathic hospital was full and the Ayurveda hospital was empty. So it's now reversing slowly. Osteoarthritis and rheumatoid arthritis patients and musculoskeletal related patients are approaching to us. Comorbidity constraints and incomplete understanding of risk factors. So these are the treatment strategies in conventional treatment. So the chikitsa has been explained very clearly. Virechaha snehitva adau snehayuktair virechanam. Snehayuktair virechanam has been explained. In Vatavyadi Mrudu Shodhana is explained. Here the snehayukta virechana has been explained. Also the bastis, rukshairva mrudubihi. Basti karmacha has also been explained. Seka abhyanga pradeha. So for Uttana and the Gambhira, according to the condition, the treatment has to be selected. Bahir Alepana Abhyanga, those things, and Gambhira, Vatarakta, the Tikta Kakshira Bastis and other Pitta Rakta Harabhatsis have been explained. So just I want to highlight on this slide. So this is the scenarios, early stage if the patient comes, it will be asymptomatic and occasional pain will be there. In such conditions, usually we will go for these type of Shamana Chikitsa, few of the Kashaya preparations, Gugulu preparations, external applications. We go as for considering the initial phase of the patients. So second is the Pitta Pradhana Vatarakta, where Virechana, we are going to plan. The patient comes with continuous pain rather than monoarthritis occasional. Patient comes with a persistent pain in different joints, persistently presenting, waxing and waning. In such conditions, Virechana is the best line of treatment. And the next stage is the patient comes in the completely involved joints, completely evolved condition, where we need to divide those patients into two categories, where Samavastha is there or not, or only Vatarakta features are there, or Avarana features. Usually Samavastha and Avarana features will go together, where we plan Virechana and the Tikshna Bastis or the Kshara Bastis, whereas in the Vatarakta usually followed by the Pitta and Rakta treatment and followed by purely the Vata line of management, that is Brahmana line of management, or the Matra Bastis, Guglu Tikta Grata Matra Bastis or Anvasana Bastis we plan. In that way you are going to develop the cases. So this is one study which has been done, the case series in scholars. This is a very common condition, all of you are coming across with that. Only the message I want to give is how to differentiate based on the chronicity, based on the involvement of the Sama, Pitta and Rakta and the Vata, how much it is Taratamata of that and the Dhatus involved. Based on that the Shodhana, Shamana and Rasayana needs to be planned. So this is our vascular necrosis. Moving to that. So all of we know the condition. Because of time constraint, I will not going to be explained. So directly we will jumping to this. This is the pathology, how it goes: ischemia, osteocyte necrosis, repair, loss of structural integrity, and collapse. Usually we come across with the patients of AVN of head of the femur. Usually we get those patients. And the treatment in conventional treatment goes vascular interruption, the causes goes the vascular interruption, intravascular occlusion, intravascular coagulation, and primary cell death. And the two again sampraptis we see here, Avarana and Vata Rakta line of management is also taken in the initial conditions of the AVN, initial stages, followed by the later stages of third and fourth stage of AVN. Usually we take them as Gambhira Vata Rakta line of treatment, or rather Asti Majjagata Vata line of treatment. Usually we do this. Always again in this condition also we see the involvement of the Samata is there or not. Whether to go for Rukshana Chikitsa initially followed by the Basti or the local treatments Snehana and Svedana. So these are the common clinical features. All of we know: joint stiffness, instability, muscular atrophy, joint pain, limited range of motions. So usually symptomatic treatment, definitely everyone might have experienced who are sitting into the clinics. Definitely we can increase the range of the movements of such a patient within very quickly, that too within a 1 course or 2 courses of the treatment we can make the patients to walk who are not able to flex the hips. Such a drastic symptomatic improvement we can get, but MRI changes usually is the gold standard to consider or they publish the cases. So that has to be done properly. That takes a little bit more time. Okay, these are some of the investigations which we go for, and this is the classification of AVN grades 1 to 4. Treatment strategies. This is allopathic treatment strategy, and in our condition again in the initial stages, Samavata is there or not, Koshta Shodhana, Tikshna Bastis, Vaitarana Bastis. Vascular occlusion conditions, again Samapitta, Vata Rakta line of management. Stage 3 and 4, Vata predominancy, Sandhi Vata line of treatment or the Asti Majjagata Vata line of treatment, and many things have been explained: Raktavrita Vata and Vata Rakta and Asti Majjagata Vata. These are the differential things. In different stages we need to diagnose this, accordingly plan the treatment. So this is the one case, 27-year-old male, moderate constitution, occasional alcohol. So chief complaints are gradual onset of the right hip joint pain accompanied by burning sensation persisting for 2 years duration, pain aggravated by prolonged standing and ambulation, relief obtained through the rest and the recumbency. So he came with us, physical examination grade 2 it was shown, and it was diagnosed as Vatadika Vata Rakta, Gambhira Vata Rakta, and Astimajja Dhatu involvement was seen, Rakta and Medas involvement was done, and the treatment was done like this: Vata Pradhana, Pitta Madhyama Vita Rakta, Medas, Astimajja, Dushti, Nirama, Avastha ascertained before the Panchakarma interventions. So Virechana, pre-Virechana protocol and post-Virechana protocol, and other internal medications have been planned as usual. So this is the Panchakarma intervention, Dashamulak, Vata, Dhara, Sarvanga, Abhyanga, and the Virechana. So this is the treatment effects before and after the treatment. Stage 3, grade 2, that MRI changes were also seen from grade 3 to grade 2 in this patient, along with the symptomatic stiffness and pain definitely has came down. So this is another case, Kafadika Vata Rakta, Samata was there in this case. So excruciating pain in the right hip joint since 10 months, constant stabbing pain, sleeplessness, malaise, postprandial heartburn and constipation, rashes over the skin, aggravates on standing after long periods of inactivity. So this was been treated with this, Kaishora Gugulu, Vishamustivati, Ayupattikara, Rasnayarandadi Dashmula, and Dhara, Abhyanga, Bashpasveda, and Kala Basti, Anvasana with Nirgundi and Manjistadi, Kshara Basti. When to choose Kshara Basti, when to choose the Kshira Basti, Samata is there, Kshara Basti is we go, Pitta Rakta involvement, and if it is Pitta and not Samata is there, then Kshira Bastis. Otherwise we go for only PTGG Matra Basti in case of Astimajjagata Vata and only Vata Pradhana conditions. Similar understanding as that of Vata Rakta only. So this is the follow-up of that. Range of movements have been explained. So these are few of the areas where we need to explore ourselves for the research purpose. So pathophysiology correlation, both AVN and gout manifest within the clinical framework of Vata Rakta, representing different stages of the disease progression. AVN characteristics, rapid, irreversible, that is Gambhira transformation affecting the deeper tissue layers, Asti and Majja Dhatu. Rakta involvement marks sudden disease initiation, as it has been explained. The Vata predominancy drives rapid progression into Asti and Majja Dhatu. Pitta Prakopa, Vidahi, Nidanas must be strictly avoided in both the conditions. These are the points where Samata Niramata is to be taken care. Niramata Bahya Abhyantara Sneha, post ama management, Tikta Pradhana Aushadhis, ama Basti conditions, and post ama conditions, Rasayana Chikitsa. So likewise, this is just approach with a superficial idea. I hope I conveyed. Thank you.
Thank you so much, sir, for your insightful information on the topic. And now I would like to request Dr. Anjanaya Morti, sir, to address the gathering and cover the topic, whatever the speakers covered, to put your insights on that, sir. Thank you. We welcome you on the stage, sir. Meanwhile, we request all the speakers who have done the presentation, please be on the stage. All the speakers. Meanwhile, Dr. Anjanaya Morti, sir, please address the gathering and on the topic which has been covered. Thank you.
I'm in a dilemma actually. As a chairman, just do as a chairman, give Sastanga Namaskara to the 3 Dhanvantaris and go back and sit on my sofa. This is one part. Second part is, I have accumulated knowledge of 50 years. Be brief, fast, like rocket speed. Rocket speed, whatever I have to speak and get out. So this is not for the benefit of these Dhanvantaris. I need not teach Dhanvantaris. 3 Dhanvantaris are there, I need not teach Dhanvantaris. This is for the people who are assembled here, the young budding doctors who should know, and for picking up that knowledge, they have to spend 50 years. So in 5 or 10 minutes, I'm going to give the knowledge of 50 years. So keep your pens, papers, stop your mobiles, concentrate, otherwise you will miss the rocket. Okay. Basically, everyone who passes out of graduation, I'm master of Panchakarma, he will tell. But they forget Chakradatta. In Chakradatta, they have mentioned in Gridarshi Prakarana, if you don't do proper Niramikarana, if you don't do proper Virechana, if you give Basti, it is less like pouring Amrita over the heap of ash. Kindly underline. If you actually cross the red line dictated by Chakradatta, you are going to meet accident. So don't get accidents. Okay. My teacher in Jamnagar, Dr. Bahadur sir, told me a very simple method. Take Vishitinduka, about 100 grams, fry it in 16 kg of Tilataila. Your oil is ready. Don't go for market preparations. Don't give the secret to the other people. Throw away the Vishitinduka. This oil, if you use for external abhyanga, wonderful effect for pain reduction. This has been told by my teacher. Okay. In Kerala Panchakarma procedures, Amla Kanji has given extraordinary importance. Extraordinary importance. I'm just underlining extraordinary importance. He is telling a person who is having Katishula, if he sits in the tub bath prepared out of Amla Kanji, pain is going to be reduced in Kshana, not 1 minute, not in 1 hour, Kshana. But dictates is follow the procedures of preparation of Amla Kanji as told in the textbooks. In Gadag DJ Medical College, they have prepared one Amla Kanji tank and they are taking the Amla Kanji through the pipe and doing it as Dhara Sweda in Sandhi Shula Amvata conditions. Extraordinarily good results are there. Okay. In Rastarangini, Rajatavasma has been attributed to have Nadi Shulahara properties. So whenever you want to use, kindly don't forget this Rajatavasma. Okay. I'm just finding some interesting points. We by heart Vatasthanani, Kati Vatasthanani. What is the meaning of Kati Vatasthanani? Tatra Sanchiyante Vayuhu. Majority of people come with pain in back. Okay. Then why Manya has not been told? Manya is the Kafasthana, not Vatasthana. But unfortunately, pain also occurs here. Chakradatta tells, in Manyastamba, Rukshasveda is indicated. Underline Rukshasveda. So where Rukshasveda is indicated, when kapha conditions are there in Manyastamba, don't go for Abhyanga, go for Rukshasveda. You will get extraordinarily good results. If you do Abhyanga in a condition fit for Ruksha or opposite, you are going to get failures. So don't do these particular things. These X-rays are foolish man's job. In Britain, when they want to take leave, they apply, I have got backache. Now they have found through various methods to prove whether that person has got backache or not. One research was done in New Delhi. People who had lumbosacral spondylosis are not having pain. Another research, people who are having backache, they don't have spondylosis. It is not compulsory that a person who has backache should have lumbosacral spondylosis. Be aware of this X-rays and other particular things. Okay. Regarding this Manyastamba, a research has been done in Trivandrum Swasthortha department on Vegavaroda Chikitsa. Kshavatu Vegavaroda is causing Manyastamba. Please, whenever the patient is coming to you, you ask him whether he is doing Manyastamba. When a patient of this Katishula Manyastamba comes, I go to his house. I see on what type of chair he sits, what type of table he uses. Ergonomically designed chairs and tables. Natras sir, a very important senior executive from ITCS companies come. I'll cut short. I'm here available for the lunch. I can speak for about 4 hours. I don't want to speak for 4 hours. But in the OPD, how I should get the confidence of the person? In 1 minute, that patient should fall at my feet. 1 minute, not more than 1 minute. He's coming. I don't know who he is. He's my friend. He's telling, he has phoned me by phone. He's my friend. He tells me, I got tired. He comes to me. I don't ask him. I take like this. This is Kshipramarma. I'm pressing like this. Okay. All right. When I press like this, he pinches. Left, he pinches. Okay. And what I'm doing is Kshipramarma Chikitsa, diagnosis and treatment. He's already told by phone that he has got Gridrasi. I tell him, you have got right side Gridrasi. You have got left side Gridrasi. How you will tell, sir, this is my magic, I will tell. Right side Gridrasi person, when I press over the right Kshipra, he pinches his eyes. Okay. I will get you pain relief in 5 minutes. Challenge. I press over the Kshipramarma for 5 minutes, applying coconut oil. 5 minutes, pain disappears. Temporarily. I got a lot of matter. I'll just stop at this level. Thank you.
Thank you so much, sir, for your wonderful information. In fact, we draw inspiration from your energy, from your knowledge, and from everything, sir. Thank you so much. Now, I would like to request Anjanaya Morti, sir, to give a token of appreciation to all our speakers. We request one by one to take a token of appreciation from organizing team. Dr. Vittal Huda, sir. We request Dr. Anjanaya Morti, sir, to give a token of appreciation to all the speakers. Dr. Vittal Huda, sir. Thank you so much for your time and your knowledge and pouring all of us. It was great scientific session. Thank you, sir. Thank you for giving a time and your knowledge on the topic which has been covered wonderfully. Thank you so much, Dr. Vittal Huda, sir. Now I request Dr. Suresh Kumar C, sir, to take a token of appreciation. We request Dr. Anjanaya Morti, sir, to give a token of appreciation. Thank you so much, sir, for taking out a time for all of us on a scientific session. It was really insightful. Thank you for your time. Thank you so much. Thank you for your time, sir. Now I request Dr. Srivatsa, sir, on the stage just to receive our token of appreciation. We request Dr. Anjanaya Morti, sir, to give the token of appreciation. Thank you, sir. Thank you for taking out the time and doing a presentation for all of us. It was very insightful. Thank you so much. Now I request Dr. Shashidhar Kaje, sir, to honor our chairperson, Dr. Anjanaya Morti, sir, for being here and blessing all of us. Thank you so much for being here. Thank you so much, sir, for your time. Meanwhile, we have something exciting coming up now. So please arrange 3 chairs on the stage. Now we are going to announce prestigious award Ayurveda Vishwaratna to 3 of our phenomenal speakers. We request volunteers to keep 3 chairs on the stage, and we request Dr. Srinivas Banigoli, sir, and Dr. Anjanaya Morti, sir, to felicitate this award to our distinguished speaker. Congratulations, sir. Dr. Suresh Kumar Thiruvananthapuram, congratulations for getting an award as prestigious Ayurveda Vishwaratna. And Dr. Srivatsa, sir, Dr. Srivatsa from Kerala, congratulations, sir, for getting a prestigious Ayurveda Vishwaratna award. And Dr. Ram Manohar P. Kollam, congratulations, sir, for getting a prestigious Ayurveda Vishwaratna award. We welcome you on the stage, sir. With a thundering round of applause, the prestigious award Ayurveda Vishwaratna to Suresh Kumar C. Dr. Suresh Kumar C. from Thiruvananthapuram for the service in the field of Ayurveda. We are so thankful for the wonderful scientific session and your contribution to Ayurveda and to all of us. Thank you so much, sir. Ayurveda Vishwaratna, Dr. Suresh Kumar C. Thank you, sir. Thank you so much for your time. Thank you, Dr. Anjanaya Morti, sir, and Dr. Srinivas Banigoli for felicitating the award. Now I request Dr. Ram Manohar P. Kollam for getting an award of Ayurveda Vishwaratna. A thundering round of applause. Thank you, sir, for contributing to the science and to all of us. Thank you so much. Dr. Ram Manohar P. Kollam has been awarded as Ayurveda Vishwaratna. Thank you so much, Dr. Srinivas Banigoli, sir, and Dr. Anjanaya Morti, sir, for felicitating the award. Thank you, sir. And now I request Dr. Srivatsa, sir, Kerala, to receive a prestigious Ayurveda Vishwaratna award. Congratulations, sir, for your contribution in the field of Ayurveda and to all of us. We respect you and we request Dr. Anjanaya Morti, sir, and Dr. Srinivasa Banigoli, sir, to felicitate the award, prestigious award, Ayurveda Vishwaratna, Dr. Srivatsa from Kerala. A thundering round of applause. Thank you, sir. Thank you for all of your contribution to a great science and to all of us. It's all of our blessings that we are able to witness this prestigious award-giving ceremony here in Charaka Sabha Bhavana. And thank you for being here, and thank you Dr. Srinivas Banigoli sir and Dr. Anjanaya Morti sir for felicitating Ayurveda Vishwaratna Award to these wonderful speakers, these wonderful Ayurveda practitioners, Dr. Suresh Kumar C, Dr. Srivatsa from Kerala, and Dr. Ram Manohar P from Kollam. Congratulations again. Thank you. Soon we are starting our second session, Shamana session. And the speakers and the topics are Dr. Shri Nagesh K.A. The topic is Chikungunya and Dengue fever. Dr. Ram Manohar P. Kollam. The topic is rheumatoid and viral arthritis. Dr. Ravishankar Perwaje Puttur. The topic CVA. And our esteemed chairperson is Dr. G.B. Patil Gadag. So soon we are starting our session. Please hold on to your seat. The exciting scientific session is going to start. Our Shamana session now. Please hold on to your seat. We are starting our Shamana session in 2 to 3 minutes. Puttur, and our chairperson is Dr. G.B. Patil Gadag. Now we are starting the session, so I request Dr. G.B. Patil Gadag as our chairperson. We welcome you, sir. Please come on the stage. Dr. G.B. Patil is a distinguished professional whose work has made a significant impact across the clinical practice, academics, research, and leadership and service in Ayurveda. He served as a principal in Gadag College for more than 20 years and different capacities at RGUHS Bangalore as Dean of Ayurvedic Faculty and Chairman. And we welcome you, sir, for this session as a chairperson. Now I request Dr. Nagesh K.A. for the topic he's going to cover is Chikungunya. I welcome you on the stage, sir. Dr. Nagesh K.A., we welcome you on the stage, sir. Dr. Nagesh K.A., he's a doctor, MD and PhD, and guided many students on the scientific sessions. He has presented many scientific sessions, presently running a clinic in Uttarahalli, and he's a professor in Sri Sri Ayurveda College, Bengaluru. We welcome you, sir. Now I request Dr. Ram Manohar P. Kollam on the stage for the next topic, rheumatoid and arthritis. Please come on the stage, sir. Dr. Ram Manohar P. is a distinguished professional whose work has made a significant impact across clinical practice and research in Ayurveda. He is a respected scholar and research leader in Ayurveda and integrative health. We request to take the seat, sir. Now I request Dr. Ravi Shankar Perwaje, sir. Please come on the stage, sir. Again, Dr. Ravi Shankar Perwaje is also a distinguished professional who has given a significant on the subject Ayurveda and has MD from BHU and running a successful Panchakarma center. And we welcome you, sir. And now we are going to soon start our session. Dr. Shri Nagesh K.A. is going to start the scientific session on the topic Chikungunya and Dengue fever. Over to you, Dr. Shri Nagesh K.A., sir. Yes.
Shri Gurubhyo Namaha. Myself, Dr. Shri Nagesh. Just wanted to present you how Ayurveda fraternity could deal with the viral fevers like Chikungunya and Dengue fever. It is not dengue, it should be called as Dengue fever. So the title is Beyond the Bite, the Chikungunya and Dengue. It is about the two types of most, it was like debilitating fevers which had made a bigger impact in health scenario in the last century, also in this century as well. And we had it in our science, how to treat it, how to plan it. And most of the people did not have that, maybe the awareness towards how to manage the viral fevers in Ayurveda. Most probably it was like due to the lack of awareness or like a general mindset that anything indigenous is something like a second priority. So it was not about the second priority. We actually don't know about it, that it can be managed in Ayurveda. That's why today's topic we have tried to make it so. The Chikungunya is the one which was first reported in 1952 and as an epidemic in Tanzania, Africa. And later in India it was first reported in 1963 at Kolkata and then disappeared for a longer duration with re-emergence in the year 2005 and 6. We were the witnesses for the re-emergence of chikungunya in 2005 and 6. Then a lot of there are a lot of discussions regarding that. There are a lot of patients suffering suddenly because of the outbreak of chikungunya all of a sudden. And since then, even now also, now in this year 2025 also, that prevalence of that chikungunya, we could see it in India, Bangladesh, America as well as Africa. And most of these countries had suffered in the last decade as well. And most of these cases were treated generally by the IV fluids and general symptomatic management, as we all know. And most of the people went for the allopathy. Most of the Ayurveda doctors also, they tried to treat it through the lens of allopathy, which was actually wanted to bring you to your notice that it can be managed well in Ayurveda as well. Dengue, it should be pronounced as. It is not a dengue fever. It is a dengue actually. So major outbreak was in 1780s in Southeast Asia, documented at Madras, but outbreak we could see again in the Calcutta in 1963 and 64 and affecting almost 100 to 400 millions annually in tropical and subtropical countries in Asia, Africa and Western Pacific areas. Dengue was reported to be described in ancient Chinese texts. This is what is recorded. I wanted to bring it to your notice that in ancient text in 2nd century it was mentioned, whereas in Ayurveda it was not with the same name, because we cannot find with the same name, but we could identify with different presentations. We can join the points and we can understand how it could be understandable in Ayurveda. So in Ayurveda we can understand with Dvandva dosha what I could understand when we had the patients at clinic and we had treated it with Ayurveda medicines. We could find dominance of 2 doshas than 3 doshas. Of course, it could worsen with the help of 3 doshas also, leading to the complications. Historically, the chikungunya was treated symptomatically for like fever and pain, like analgesics and antipyretics it was given, and rest and fluid, and there were mosquito prevention like fumigations and nets and all those things were advised. And there is no specific antiviral as such made for this chikungunya. Even now also it is more of a supportive care and it is symptomatic management supported by the advanced diagnostic tools like RT-PCR tests and all. Now dengue fever also was managed largely by symptomatic management, rest and the hydration. And in currently no specific antiviral drug or improving we have the medicines like improving the platelets, fluids and supportive care and vector control. These things we are actually managing the dengue fever presently. Similarities, why we should understand the similarities between dengue fever as well as chikungunya? It is because it is actually overlapping symptoms we have. Overlapping symptoms like high fever, body ache and severe headache, like arthralgia as well as the rashes what we could see. They are all common between chikungunya and the dengue fever. And it is spread by the mosquito. And dissimilarities between chikungunya and dengue fever. This is also because we need to differentiate. When the two these viral fevers outbroke together at the same time when it was, then it was a challenge at times that we could not differentiate. Many times it was like, okay, chikungunya if it was, then it was still fine. If it was a dengue fever, how to manage? Because it is a life-threatening many times. Because dengue fever leads to a bleeding disorder and there is great difficulty in handling that bleeding, and it is patient may die also. So that's why we need to have that idea about the dissimilarities between the chikungunya and dengue. Chikungunya is the one which is debilitating mostly and long-lasting joint pain. Even now also patient come with the joint pain, we first prioritize this question that whether you had any suffering previously with this chikungunya. Because the persons who are suffering from joint pain, many of them had a history of outbreak of chikungunya and still they are suffering from. So the one who took Ayurveda treatment for your notice, at that time, even after the main control of the chikungunya infection, the fever was brought down, and later on, when the treatment was continued with Ayurveda principles like Abhyanga, Snehapana, Virechana, so just like a post-fever treatment, how we do, if that was followed, we did not see in such cases with chronic joint pain, because many patients, they said that when they had taken the treatment in Ayurveda, they did not have the joint pain as a complications later on. So this is what we could understand. Dengue is characterized by the severe pain behind the eye, so which is very striking dissimilarity with chikungunya. We need to understand that, and also bleeding is a cardinal feature here in dengue fever, and it is about loss of platelets also. A sudden drop of platelets from lakhs together, it comes down, and all of a sudden patient comes with around 60,000, 80,000 platelets count they come with. So at that time it will be really challenging for us to handle at that time. Days of recovery and post-fever complications. Chikungunya, again, as you all know, that it is a long-lasting severe joint pain. It is the complication, mainly stiffness and rarely leading to encephalitis, GB syndrome, as well as myocarditis, uveitis, and organ damage, like joint damages also we could see. So mainly it is affecting the joints, that we all know that. And the dengue fever is the one which leads to post-dengue fatigue syndrome, PDFS we call it as. And it includes extreme fatigue, joint and muscle pain, hair loss, and loss of appetite. So these are the main features, but it could lead to long-term complications like depression, arrhythmias, neurological deficits, almost including all symptoms, including death also. But recovery, when it is properly managed, within 1 to 2 weeks, it brings down the acute phase, but the complications may continue to exist. That is what we need to handle here. Whether Ayurveda has anything to offer with respect to chikungunya and dengue fever. So Ayurveda offers treatment, because it is not a fanaticism to say that everything is in Ayurveda. We have everything in Ayurveda. We generally speak about that. It is not just about claiming that it is there, because hundreds of Ayurveda doctors have successfully treated and got success in both the cases of chikungunya as well as dengue fever. Not only that, even COVID-19 also we had that experience of treating it very well, and with least complications we could see that. And here Ayurveda has got the treatment just like any other fever we do not handle. There are some specific understandings which I am going to explain it today. So under the heading of Jwara, of course, but it is not a simple Vata Jwara, Pitta Jwara, it is not so. It is a combined situation, we need to handle it. And Ayurveda physicians were successful in treating viral fevers also, we all know that. Descriptions include dosha vikalpa, combinations of dosha. Actually, we need to understand the permutation and combinations of dosha. And understanding the different types of Jwara, actually here, there is a very subtle difference between the different types of viral fevers. It is not easy to differentiate. As far as doshas are concerned, we have that combinations of dosha vikalpa, where it makes it difficult to diagnose which dosha has caused what. Because we have that concept of Vikriti Vishama Samaveta, where it is not easy to understand how drug acts as well as in a combination, and how a dosha acts in a combination. Like Samudaya Prabhava we call it as. So Avayava Prabhava we can understand what Vata can do. Whereas in Samudaya Prabhava, how in a combinations it can act, it is not easy to understand. So we need to join the link between the references and try to understand it. And because it comes under the common factor called as Jwara, we need to understand that applicable Samprapti is a general one. So Samanya Samprapti of Jwara is applicable here also. Severe headache in Jwara, loss of sleep, arthralgia. These are the symptoms what we can see in both the cases mostly. And we have it in Sushruta Uttara Tantra regarding the Swapnanasha, Shiroroja, Parvabheda. We need to understand the dominance of doshas here, because these things are scattered across the Samhita, and we need to bring those references together and try to understand it under one platform. It is not easy to join the points here, that I am giving one, like how we can join it, I am trying to explain it here. association with any external factors through Aedes mosquitoes, whether that is explained in Ayurveda, because the questions definitely would come in any platform where if we are telling that everything is mentioned in Ayurveda, it is explained in viral fevers are explained in Ayurveda, then where is that reference? Where is the mosquito reference? Where is the vector reference? Where is that references of the modes of transmission? Of course, they are all there. We need to understand them. Here in Sushruta Uttara Tantra as well, that Agantoscha Anubandho hi Prayasho Vishamajvara. In Vishamajvara, we know that there are two different patterns of Jvara. Vishamajvara is the one pattern and Sannipada Jvara is another pattern. So, dosha movement is in a different pathway. We have it here. Like in the Rasava Srotas, when it is moving through, approaching and reaching out to different dhatu, it is the Vishamajvara which is causing. Whereas Uttarottara dhatu, when it is reaching, then we call it as the Dhatugata Jvara. And based on the number of doshas involved, we identify it as a Sannipataja. So here, Agantoscha Anubandho hi Prayasha Vishamajvara. In Vishamajvara, generally, there will be an association with Agantu factor. And Agantu means what? Again, Agantu means Bhutadi. Bhutadi, again, you don't start asking the question whether these are something hypothetical. No, it is not so, because Bhutadi means it is something living creatures they are speaking about. It is not something like devils, demons, or some supernatural, unnatural things. It is not so. It is something about the living beings they are talking about. And observable association with living and subtle microscopic creatures are described with the help of Bhutadi. So Agantu means it is the association with the Bhutadis actually. Different modes of association. Whether that Aedes mosquito, whether that factor is mentioned, they are described under the Visha context, but there the symptoms are limited only till the skin. So the further association is linked here. In Charaka Chikitsa we get it, Visha Vriksha Anila Sparsha Tatha Anyahi Visha Sambhavaihi. So the one highlighted one is due to the mosquito bite, it could be, that is in the Visha Chikitsa reference. So the Visha which enters inside, so that is leading to the association with the dosha and further leading to these complications. So it could be the virus load which it could be brought. Whether any concept of virus or microorganism, this is very famous reference, everyone knows this perhaps. So in Chakrapani we get it, Jvaras Tripadas Trishiraha Ityadyukta Prani Visheshasya Vigneyaha. So the reference about Trishira and Tripada, when it is said, they are describing something about the physical nature of some structure, some microorganism. Perhaps they could able to understand or recognize the structure of that microorganism. So exactly we cannot tell which virus it tallies with, but there are different viruses. Perhaps they could able to recognize that there is something called a physical structure microorganism present. And here in Chakrapani commentary, it is mentioning, it is Prani Vishesha it is mentioned. When it is mentioned the Prani Vishesha, then it is something which is a living creature they are talking about. It is not something like it is like Preta, Pishacha, such type of things. Okay, they have a different understanding. Preta also has got a different meaning. Don't understand what you understand in Kannada. It is not so. And which has prana, that is, there is something living creature which is causing this one. So having Tripada Trishira, we could not elicit exactly which creature they are talking about, but there is something observable factor we could see that they had a vision about observing and recognizing there is some creature which is a living one. This is not something hypothetical, this is observed only. Whether these creatures may be microscopic, may be virus, may be bacteria, whatever. So they cannot affect anything without the association of the dosha. That dosha, so it has to associate, like Jvara Prapnoti Vata Deho Yavanna Dushyate. Until and unless the dosha is associated, we do not get that symptoms of our outbreak of the Jvara. Even if it is Agantu, it has to attain the Nijatva one after one or the other time it has to attain. So once it takes the entry into the body, then it has to associate with the dosha, and then there should be an outbreak of the jvara. So despite the factors coming from outside, they are inevitable to include the dosha. Whether do we have a reference about myalgia, bleeding, rashes, loss of appetite? Yes. Everything is there, definitely. See, we get it, arochakau, pitika, nishtivana, rakta nishtivana, pindikodveshtana, arochaka, akunchana, all these references we get it in our references like agantu, that is dhatugata jvara lakshanas, we get it. And how and when these symptoms are developed? When it is in rasagata or meda, then the symptoms like loss of appetite, we get it in a patient. Whereas when it is raktagata, it starts bleeding, patient starts bleeding. When it is mamsagata, the person gets myalgia. When it reaches asti, patients start developing arthralgia. So symptoms are actually relatable. So this dosha association, not only with like external factors, then where and when it reaches which organ or which location, which dhatu, based on that the symptoms start developing. That is what is understandable here. In Dvandvaja Jvara Lakshanas also, we get to see that Shiroruk, that severe headache what the patient gets in these conditions, this is also, it is a Dvandvaja Jvara Lakshana. Parvanam Bhedo, Aruchihi, Parvanam Ruk, Shirograha, these symptoms are actually scattered, indicating that the different types of presentation of the dosha. It is not just, it is named as one jvara and it is developing these symptoms. It is not so. If it is having a definite pattern, we can get the definite pattern. Otherwise, it can be scattered, and we need to understand by joining those points together. Probability of tridosha leading to the symptoms. Of course, not only two doshas like vata pitta and vata kapha symptoms. It is not just that. We have that sannipata jvara lakshanas also, where rakta pitta kapha shtivo lolanam shirasu atiruk kothana mandalana. That skin rashes or skin changes, even the boils also when the patients start developing. This is when all the three doshas get involved in that and they start developing the symptoms. Which dosha is responsible for Rakta Dushti? Again, here it is about the dominance, because Prayo Raktam Pradoshiyan it is mentioned. That is the Vata dosha which is dominantly doing. Because when it is spreading from one person to another, it is not a direct spread, it is through mosquito of course, but the rapidity how it produces. Dengue fever produces a very rapid symptoms. Even chikungunya also, it is like outbreak is like something like it comes up within a day. So it doesn't take a weeks together of time for its outbreak. So that rapidity is understandable with the feature of that Vata dosha. Why post-fever complications occur? Because of that subtlety of the dosha. Of course, again the culprit is Vata dosha, which takes the dosha into deeper dhatu. Rasadishu eva liyate sukshmaha. So sukshma srotas it deeper when it gets and settles in, then the person starts developing that emaciation, discoloration, malaise, debility and other complications. Even if it is reaching to different levels of dhatu, different organs, different srotases, accordingly the symptoms would continue, because doshas were not completely dissolved, doshas were not completely solved, doshapaka did not happen properly, and they were not expelled also when it is conventionally treated. When you are treating through Ayurveda, it is mentioned in Ayurveda also that at end of the Jvara Chikitsa, we need to give a Virechana. So when you are giving it, it expels out the dosha, which is actually when it is in the koshta, it expels it. General principle of treatment. Now I am coming to the treatment principle, where how you can apply in this chikungunya as well as dengue. So there is no specific one disease or one jvara mentioned with the name of dengue as well as chikungunya. It is relatable with the help of the dosha, as we discussed earlier. Here, the general principle in samsarga and sannipata roga, where it is vardhane nekadoshasya kshapane nochitasya va kapasthananupurvya va sannipata jvaram jayat. So here, Vardhanena Ekadosha means we are not increasing the dosha. It is about among the combination of the dosha, which are the dominant dosha we are treating, despite it could increase the third least increased dosha also, but still we have to treat the dominant doshas. Thus, the another third dosha will enhance, but still it is manageable later. And reduction of the increased dosha. Vardhanena Ekadosha Kshapanena Uchritasya va. That means Uchrita dosha we are reducing it, and then Kapasthanano Purvyava. Generally it is understandable, it is Amashya Samutta. Amashya Samutta, it is like Kapasthana, Pittasthana, both are Amashya. But here in this condition, in Jwara, it is Amashya Samutta means it is not Kapasthana priorly, it is a Pittasthana. But here he is specifying that Vamana should be the priority. And initially Vamana we are supposed to give, then move ahead with the rest of the treatments. General principles again. So wherever, whichever treatment is, principles are applicable, like Deepana, Pachana, Lagu Ahara, and it is like Hitapeya, Yathasvam Pachana hi Krita. The suitability we have to identify and we have to suggest it here. Moreover, the next level is to identify the dominant dosha further and then suggest whether Langana has to be done. Yavagu, Langana includes Dashavida Langana, it can include the dosha Shodhana also. Yavagu, Kashaya, Pachana, Hridya. Hridya means one the patient would like to have such type of things should be planned, which are Jwaragna. So these are the things which we need to basically set. Later we have to go for the medicines. Then set the Pathya further, like it can be Langhana or it can be Yavagu, Kashaya, Pachana or Hridya as we did. Then Dadima, Amalaki, Mudga, Patola, Nimba. Based on the dosha combinations, we have to set the Pathya. Then start the medicines. That means initially it is the general principle has to be adopted despite the type of Jwara. Then medicine parallel we have to start. Few examples I have quoted here like Guduchi Paniya, which is very common, we use it, as well as the Musta Paniya also. Musta Paniya, if it is having the most abdominal symptoms, like if we have it, we prefer that Musta. Otherwise, Guduchi Paniya, when we give it, it at least prevents the movement of dosha into the deeper dhatu, at least. Deeper and deeper it would prevent, and for there only the Jwaragna action we could see, because initially that Kashaya we cannot give, Paniya is still preferable. And there are other like Kirata Tiktam, Amrita, Draksha, Amalaka, Shati. So, and Vishama Jwaragna Kashayas as explained in Charaka Samhita, we need to give it here before after that setting up the Pathya as well as some general principle, then we need to come to the specific line of treatments. And Shodhana should be done based on the dosha dominance generally. Some of the medicines useful which we tried during the clinical practice. In Amavastha of Chikungunya, it is Tribona Kirti Rasa and Rasa Sindhura combination, and Niramavastha and Swarana Vasanta Malati Rasa plus Rasa Sindhura. In Niramavastha, Mrityunjaya Rasa, and Jwarankusha Rasa, and in dengue fever, Kamaduga Rasa, Pravala Pishti, Mukta Pishti, and Sanjeevani Vati. So Sanjeevani Vati is the one when it was given along with like other medicines which I will tell you here, like definitely papaya based medicine which is quite common. Truly it works. When it was given along with Sanjeevani Vati, it worked wonders. Even within a day, more than 80,000 platelets we could see. Of course, we have to prescribe based on the severity as well. So, in one severe case where 2 TID it was given, Sanjeevani Vati. Otherwise, 1 TID or 2 BD it was given. And papaya leaf based, some combinations are available now also. And we have that plenty of medicines available in the market. So Guduchi Paniya, Guduchi Sattva, Vatsanaba based, Lata Karanja based, and Shunti is the one which brings down the Shotha. And Abhyanga Gritapana as per usual protocol. So outcome of Ayurveda treatment, no long lasting pain, no deformities in joints, no bleeding, no debility or exhaustion, no organ damage, and early improvement in the platelet counts. All these we could see in the treatment. Take home points. Ayurveda has the treatment for Chikungunya and Dengue fever. Ayurveda offers better outcome for viral fevers without complications. Treatment is customized and decided based on the response and observable symptoms. And combination of Rasaushadhi with Kashtoshadhi offer early and effective recovery. Thank you.
Thank you so much, sir, Dr. Sri Nagesh K. for the scientific session on the topic Chikungunya and Dengue fever. Thank you so much. Now I would like to request Dr. Ram Manohar P. Kollam, sir, on the stage to cover the scientific session on the topic rheumatoid and viral arthritis. We welcome you, sir.
Om Shri Gurubhyo Namaha. A very good morning to all of you. I am so honored to be present here today morning and share my thoughts on the role of Ayurveda in rheumatoid arthritis and viral arthritis. So I'm just waiting for the slides to come on. So I'd like to give a little background considering the limited time that has available for this talk. I have kept my slides very brief. So I'm not quoting any shloka. I may, just quote some shlokas in the course of my talk. I wanted to convey only few things so that there will be some impression. Basically, I am talking here today in the light of my own research experience in the field of rheumatoid arthritis. So it may contradict some widely held beliefs. I don't intend to kind of oppose any thought process that is already there in the field, but I'm just sharing some of my experiences so that you can consider these alternative ways of looking at this disease. So one of the things that I would like to really state at the outset is this equation, one-to-one equation of Ayurvedic diagnosis with certain modern diagnosis we found to be very limited and restrictive. Like for example, saying that Amavata is rheumatoid arthritis or Vatarekta is gouty arthritis. This doesn't actually work clinically. For example, in our experience, we found that Vatarekta exhibits features that combine the presentations of Amavata as well as Vatarekta. In fact, that is our experience in our NIH-funded clinical trial. We found that in Amavata also, when we consider the concept of Rekta Dushti, we are getting better results. So, which means that, see, in Charak, I once discussed with Srinivas Acharya sir. I asked him, this is a problem. In Kerala especially, we are approaching rheumatoid arthritis through the lens of Vatarekta. And Vatarekta is a whole spectrum of conditions. It's not just gouty arthritis or just, even psoriatic arthritis comes within the purview of Vatarekta because Bhavanti Kushtasamam in the Pura Rupa, the link with skin manifestations, all this is mentioned. So instead of this one-to-one understanding, we did a study where the Ayurvedic physicians were allowed to assess the patient purely on an Ayurvedic basis. There was no forced, insistence on diagnosing in a particular Ayurvedic way. So the patients were included on the basis of modern diagnosis. So they have to fulfill the rheumatoid arthritis criteria. But for Ayurvedic treatment, we had the freedom to decide whatever diagnosis we want to give. So some would be classical Amavata, some would be with Rekta Dushti, some would be more Rekta Dushti oriented. So that freedom we had. And I want to share this produced a result. What I want to tell at the outset is, so many studies on rheumatoid arthritis has happened in the world. Formal studies. I'm not talking about practice. And in all of that, only modest results have been found in clinical trials. So two reasons are there. One is the diagnostic limitation. You are force-fitting rheumatoid arthritis into one Ayurvedic category, which greatly restricts the scope of your treatment. So you have to treat all patients from this narrow lens of an Ayurvedic diagnosis. Second thing, you are not allowing the full treatment to be administered in your clinical trial. You take one herb or one treatment. So to solve this problem, we got funding from National Institutes of Health, United States, which is one of the apex bodies of research in the world. And in collaboration with a very eminent rheumatologist in UCLA, the University of California, Los Angeles, we were able to design a study where we addressed all these problems. So the allopathy doctors would make sure all the patients are rheumatoid arthritis. Ayurvedic physicians had the freedom to diagnose in their own way and give the treatment according to their diagnosis, not just with one medicine, but whatever medicines we want to give to each patient, we can give. So in this light of this experience, I would like to share some of my thoughts here today and how we can approach this. So the key proposition is that rheumatoid arthritis is not just adequately explained by Amavata alone. That is the first point that I want to make. So the Ayurveda, rheumatoid arthritis, when we clinically assess rheumatoid arthritis, it does not map exactly to Amavata or any one condition described in the Ayurvedic text. I will try to tell some issues here. When you say the manifestation of Amavata, Yugabat Kubida Vandas Trigasandhi Praveshago. It is said that Amavata manifests in the beginning in the Trigasandhis, which is actually the lumbar or which is axial skeleton. So there is a basic difference between axial skeleton and the appendicular skeleton. So a disease that manifests first in the axial skeleton is considered in Ayurveda as Amavata. Whereas Vata Rakta is that spectrum of disease which manifests in the appendicular skeleton. For example, Padayor Moola Mastaya Kadajit Hastayoravi Akhoriva Visham Kurdham Kritsnam Deham Pradhavati. So it remains in the peripheral joints, especially the smaller joints, and if you look at the ACR ULAR 2010 criteria, they give more weightage to the smaller joints in the hands and feet. And one more thing is, rheumatoid arthritis is symmetrical arthritis, which means if you have one joint on your right side, it will mirror also on your left side. And this is exactly, see, when you study Sanskrit very carefully, if you just translate, Padayor Moolam, they have mentioned symmetrical arthritis. Kadajit Hastayoravi. Tasya Sthanam Karau Padau. Even Charaka, he uses the dual, Dvivachanam. Tasya Sthanam Karau Padau Angulya Sarva Sandhaya. So this movement from appendicular skeleton to axial skeleton as opposed to, so in my experience, I have treated ankylosing spondylitis, many of these spectrum of rheumatoid diseases, and Amavata typically corresponds to ankylosing spondylitis. Axial skeleton being affected with Kurvato Gatra Matyartham Stabdham, making your body stiff, which you see in actually ankylosing spondylitis, bamboo spine and all that. But if you ask the principles of Amavata, whether it is helpful in treating rheumatoid arthritis, yes. Because when you do Amavata Chikitsa in rheumatoid arthritis, you are getting benefit. But if you look at the whole spectrum, if you don't supplement it with Rakta Dushti, Rakta Prasadana treatment also, the results are sometimes not sustaining in the long run. This is my experience. And on that light, I am making some observations. So we have Ama, which is metabolic immunological dysregulation, Vata Prakopa, pain, stiffness, progression, and also Rakta Dushti, which is why Kerala physicians, when they use Vata Rakta treatment, they are getting benefits. There was one patient of mine whom I treated many years ago from Delhi, was associated with the ministry, one officer's aunt, who had very severe rheumatoid arthritis. So because I was involved in this prestigious study, they invited me, and actually I went out of a lot of fear because it was he was an allopathic doctor who challenged me to treat his aunt. And when I went to his home, I found the patient was in a wheelchair, not able to move. Even the slightest movement is causing untold pain. She cannot even stand up. And she had a venous ulcer in her feet. So they were based in the US, they came to India. And she was not willing to take allopathic medicine. So the disease was progressing fast. So when I saw the patient, I asked them, see, for every system there is a limitation. You cannot expect magic with Ayurveda. Actually, I was not very confident, but at their insistence, I agreed to treat the patient. So the first thing I told them was, I don't know how much, so one of the inconvenience was a venous ulcer. So I'm just sharing an experience. That venous ulcer was causing discomfort. I said, I'll try to treat that first. The venous ulcer part, I was not getting that good result at that time. Later I learned that Rakta, Moksha and other, Vrana Chikitsa alone will not work in venous ulcer. We have to correct. So I was not so confident of treating the venous ulcer. I said, we will try some treatment for rheumatoid arthritis. If she responds only, I will take it up further, since they insisted. And we started treatment. So I remember I gave even Amrudotaram Kashayam, Rasna, Panchakam, Sakra, some combination like that. And you won't believe it, in about 3 weeks, the first thing that happened was that a venous ulcer healed. So they came and called me and said, sir, there is improvement. Her venous ulcer is healing after so many years for the first time. So I got shocked. I didn't do any treatment for the venous ulcer. So I asked them, did you try something else? Did you do any other treatment? No. So I couldn't even understand how that happened. And then suddenly I remembered a shloka from Vadaratha Chikitsidam that is Rakta Margan Nihantyashu Shakha Santhishu Maruta Pravishya Anyonyam Avarya Vedanabir Haratyasun. So Rakta Margan Nihanti, the blood circulation is affected in Vadarakta Samprapti. So that is how the joint manifestations are happening. So when you do typical Vadarakta Chikitsa, the Rakta Margas are getting improved. So the blood circulation probably improved. So now after that what I did, whenever a venous ulcer come, I do Vrana Chikitsa plus Vadarakta Chikitsa combination. Because the Vadarakta Samprapti is coming in that Vrana there. So Vadarakta is a Samprapti, it is not a disease. In so many conditions, you think that Vadarakta Samprapti through the clinical manifestation, you will get results. So this is the main point I want to make. Don't reduce our Sampraptis to single diseases. You don't know where the Vadarakta Samprapti manifestation can help. I can tell you some other examples also. Once my son had a severe fever. It is not going down. So first we try, I was not at home. So my wife, Amrudotaram, Amrudarishtam, Vettumaran, Gudika, nothing is happening. The fever is not coming down. It's going up. So I said, okay, now we will go to Crosinadi management. We have to reduce. Paracetamol also not working. So we went to the doctors. They said, we have to wait for some more time. Just give paracetamol. We cannot see any focus of infection. Let's see how it evolves. So they did the test. There was nothing. So after one travel like this, I went home in the night. And when I tried to examine him, he was going on blabbering. Suddenly I remembered a shloka from Jwara Nidana. Jrimbhadi vaktum cha chaladsa pittad. So when you have Vata Paitiga Jwara, ati vaktum. So that one thing made me think that now let me give Drakshadi Kashayam. Nobody will give Drakshadi Kashayam usually in fevers. We are giving strong Kabhara medicines and we started Drakshadi Kashayam. And within 3-4 doses, the fever came down. It's a first-hand experience, where even Crossin did not. So if we are very specific according to the avastha, so our Shastras are giving us a thought process. We have to clinically correlate it. And sometimes bringing a modern diagnosis in between is completely fixing our thought. The same Drakshadi Kashayam had an experience with a Madatiya patient. So there also, when I was treating, I got the idea that we have to give Drakshadi Kashayam, Vata Pitta, because Drakshadi is said, it is indicated, Jwara Madatayam Chardim, so specifically Madataya is mentioned. So we made this bottled Kashayam and started giving, not responding. So then I and my colleague, we discussed a lot. We were convinced that Drakshadi is the correct medicine, but why it is not working? So then we again read the Shastra, Phanto Himo va Drakshadir. So we have to give Drakshadi as a Phanda or Hima, not as a Kashayam. Because when you do Kashayam, its Pitta Shamagatva gets reduced. When you give it as Shita, so I still remember, it was in the first few years after I finished my course, we collected all the herbs of Drakshadi, kept it overnight, made it into Shita Kashayam and administered, and within few days, dramatic results were seen. Another area where I want to highlight the Samprapti importance is a patient with severe spasm in the intestines, passing mucus. And so, at the first thing was he was in so much pain, we thought maybe we have to give some antispasmodic. But at that time I had strong Ayurveda spirit, didn't want to give up. So again I remembered one sloka which my teacher always used to say in Pravahika. Vayu ashe satailehi bimbishi navatishtade. Ko nishtanan pranadi koštashuli nandarbahis taila baro edisyat. So normally in such a condition, we will never think of giving a taila. But what I want to say is when you are clear about the avastha, and when you give the correct medicine at the right time, the results are dramatic. If I had given the Anvandaram, Vayu, nothing is working. But Maharaja Prasaranyadi Tailam, just few drops and the spasm got relieved. Another one, last thing before I quickly rush through the slides. So Ayurveda Chikitsa is an algorithm. It's Avastha Vishishta Chikitsa. Avastha Vidhanameva Chikitsa. Not simply giving medicine. So for that the study of Samprapti is very important. Gridam tu pitte bhyadige lihed vadadhige pibed. When pitta is dominating, we must make the patient lick the ghee, not drink it. Vadadhige pibed. Leadham nirvavayet pittam. So again an experience, one of my seniors when they were treating patient with severe inflammation in the gut, Dadimadi Gridam was administered. And after the first administration, the patient condition aggravated. They had a big discussion and finally they decided, one of the seniors, he said, it's not the medicine is the problem, it's the way we have administered it. Gridam tu pitte bhadige lihed. So ask him to just lick the medicine instead. So these small things make a big difference. When we come to clinical trials assessment, we are converting all Ayurvedic medicines into tablets and swallowing it, thinking that the same result will come. So this is what I want to highlight here. So we have to consider all these things. So hence RA is not just Amavada. It is Amavada plus Vada Rekta. Sampraptis you can see. I'm not saying they are equal diseases. So case by case, even in modern medicine, all RAs are not similar. They have 0 positive, 0 negative, multiple presentations are there. Actually, I would say in commentary of Ashtanga Hridayam or Charaga, I think, Chakrabarti has mentioned more than 70 types of Vada Rekta are there, but Vistara Bhayad we are not mentioning it. So if we look at even modern clinical presentations, looking it through the lens of doshic variation, we might be able to create so many subdivisions. This is what we learned from our clinical trial. So now there is rheumatoid and viral arthritis. So one of the things is normally viral arthritis is self-limiting, post-viral arthritis, except for those induced by this notorious virus like Chikungunya. They are seen to persist for a long time. So rheumatoid arthritis, so this is again a big challenge for me. I cannot jump between modern diagnosis and Ayurvedic diagnosis. So this is a challenge now to first discuss the modern diagnosis. Post-viral is a big bucket term. So many types of viruses, problems are there. If you look at it through an Ayurvedic lens, you will get a totally different picture. I will come to that. So we know that rheumatoid arthritis is diagnosed based on ACR EULAR 2010 criteria. I'm not reading all that. It's a combination of clinical presentation, acute phase reactants, X-ray images, erosion of the joint. That is the key thing that differentiates rheumatoid arthritis from other inflammatory diseases, and that erosion is very fast progressing. Viral arthritis is usually with RF and anti-CCP negative. ESR CRP is transiently elevated and usually resolves within 2 to 3 months. If it persists, then we have to. So I've read a lot about this. Modern doctors are of the opinion that viruses like Chikungunya, they may trigger rheumatoid arthritis. So a viral triggered rheumatoid arthritis, and a post-viral arthritis need to be differentiated. So that is why you need a workup from modern point of view also to don't consider all post-viral arthritis as rheumatoid arthritis. So this is the thing, viral arthritis, many viruses can cause this. And this is why I feel in Ayurveda, we may be able to see different clinical presentations. We should look at it through the lens of, so chikungunya is notorious. And please keep in mind, do the RA workup and then only confirm whether it is RA. It doesn't matter whether it came through the viral route. If it is a simple post-viral arthritis, it may resolve. But if it has triggered a rheumatoid arthritis pathology, then it will persist. So this is the quick, differentiation. Rheumatoid arthritis builds up over long-term AMA, and it is very deep-seated. And viral arthritis is acute superficial. So Rakta Dushti is prominent in rheumatoid arthritis. That is my experience. That's why we are not looking at that as a frank Amavata. It is chronic progressive. Viral arthritis is self-limiting. The dosha thing is also, different. So treating viral arthritis aggressively like RA can lead to complications. So this is a modern guidance also, that you should do a proper workup. And as I said in Ayurveda also, looking at the avasthas is the critical thing. Wherever I have succeeded in my practice, it is when these nuanced understanding has been possible, like an avastha vishesha or a dosha vigalpa or understanding a particular samprapti, then the results become suddenly great, manifest. So now here we need, so because we have to look at both parameters, we need an integrated framework. We are calling this as a dual diagnosis framework. So if you want to make a claim that I have treated rheumatoid arthritis, make sure you do a modern workup. Otherwise, say I have treated Amavada or Vadarakta or whatever it is. If you, without a proper RA workup, if you make a claim, modern doctors will not accept. That is why we are making sure that we do the modern workup only for diagnosis, not for treatment. So for diagnosis and for making a scientific statement that we have treated, we will do this. So here you can see, we'll need to do ACR ULR score. Anti-CCP is more sensitive. Rheumatoid factor may be positive or negative in rheumatoid arthritis. It's not a reliable criteria. So we have 0 negative, 0 positive RA. And CRP is better than ESR. One of the problems with ESR is, if you keep the blood for a little long before testing it, the ESR will be misleading. So in our study, we were asked to follow CRP, which is more stable and more reliable. So we have a score called DAS28, Disease Activity Score 28. You can do it with both ESR as well as CRP, but doing it with CRP makes it more reliable. So diagnosis is layered and not binary. We have to look at the various stages: Ama dominant stage, Rakta Dushti dominant stage, and Vata dominant stage. At least 3-4 stages, if you clarify, you will be able to choose the medicines more carefully. So here is what I want to show. This was our NIH funded study. So, a DMARD, I hope everybody is aware, DMARD is disease modifying anti-rheumatic drug, which can reverse certain parameters in rheumatoid arthritis measurably, like ACR criteria 20, 50, 70. You get a 70% improvement when you use a DMARD. You get a disease activity score reduction of more than 1.5 when you use a DMARD. Up to the time we did our study, no Ayurvedic medicine has demonstrated such a comparable effect to DMARD. So we did a OP-based study. Just now, one of our PG scholars doing a work on Charavasti and rheumatoid arthritis, and 2 days ago I was reviewing it, surprised to find dramatic result in 7 to 21 days. A DMARD effect was demonstrated with just Charavasti. When we did our study, we couldn't give Charavasti. It was only Shamana Chikitsa. So Shamana Chikitsa took 9 months to produce this result. With Charavasti, within 21 days, you can produce that result. So when you combine and then follow it up with internal medications. So here what we found, Yeah, you can see here, very quickly I will tell, we had 3 groups. The blue one is modern medicine, the red one is Ayurveda, the grey one is combination. We gave placebo, so everybody thought that they got a combination. So this is ACR 20% improvement, 50% improvement, 70% improvement. 6 months, what happened was 20% improvement, Ayurveda had lot of people. When it came to 50%, you can see modern medicine is better. And at 70%, Ayurveda was 0. But at 9 months, you can see Ayurveda is topping in all the parameters. So first time, globally, with the involvement of bodies like National Institutes of Health, UCLA, we were able to demonstrate that whole system Ayurvedic treatment can produce results comparable to a DMARD. Over the last 20 years, Dr. Daniel First has been closely associated. He's an eminent rheumatologist, but he got interested in Ayurveda. And now, thanks to the Ministry of Ayush, we are having a multicentric trial involving Amrita, AVP, CCRS units, where we are testing this at the next level. So if this is done and we can, because this was a small pilot study, then we would be able to demonstrate to the world that Ayurveda should be studied as a whole system. And this is what that recent WHO meeting which I attended is also strongly advocating for research methods that are in alignment with traditional medicine. So also I want to say, see, at a time when Europe was trying, so many of us, we will tell that we cannot do this kind of trials because nobody will accept it. So choose one medicine, then only it will be. So in 2012, that is 13 years ago, we were able to create an impact which I never imagined. No, the best journal in the field of rheumatology accepted our paper for publication. This is the first and last time that Annals of Rheumatic Diseases has published a paper on Ayurveda. And the first Excellence in Integrative Medicine Research Award in Europe was awarded for Ayurveda through our study. Excellence in Integrative Medicine Research Award. Third thing, for the first time in the annual meeting of American College of Rheumatology, an Ayurvedic study was discussed. And the fourth thing is that this is the statement of Edzard Ernst. Edzard Ernst is a European, professor of complementary medicine. He has never said anything positive about complementary alternative. He's attacking. He said it's a waste. When we did our study, he asked us, can we write a commentary on your study? And we thought he is going to attack us. But Dr. First said, let them do it, it's science, we will defend. But we were surprised when he said, the study might therefore be used as a blueprint for testing the efficacy. So he recommended our study as a blueprint for future studies on complementary alternative medicine. So what I want to tell is that we have to stick to our fundamentals. If we keep adjusting our system to please the modern researchers, we will never get the recognition. So what we learned here is that when they came, the NIH approached us, they said you have to change your research methods, you have to choose one medicine. We told them one thing very clearly, sir, for centuries we are treating patients in the way we learned. You do whatever research you want, please allow us to continue the treatment in the way we are doing. Please don't tell us to change the treatment for your study. And they agreed. So what I'm saying is it's possible to agree. We have to negotiate. We have to be strong. If I know that my treatment works, why can't I tell this is the way I'm going to treat the patient? You bring in whatever measurements you want to do. And that is how the study was designed. So in that light, what I want to say, what is this thing? This is something we have to highlight. I would say Ayurvedic treatment is an ATA. It means it's an Ayurvedic treatment algorithm. It is not a medicine. And an ATA has several components. There is a decision logic, first thing. The decision logic means what I'm saying, what is the dosha vikalpa, what is the avastha, is it sama or nirama, what is the dosha. So that is the decision logic. What samprapti of the disease is there? Should I consider it as only amavada or amavada plus vadarakta samprapti should also be considered? That is the decision logic. Then we have component interventions. So I think I'll have to conclude. By explaining this, I will conclude. The component interventions could be multiple. It is based on that logic that I am choosing these component interventions. And then they are sequenced. This is very important. What will I give first? So after the Ama Chikitsa is over, I go to the Shamana Chikitsa, then to the Brahmana, then to Rasayana. So the third element of an Ayurvedic intervention is the sequence. And the fourth thing is personalization. I cannot give the same treatment to everyone. So when you bring these four components, we create what is called as a Ayurvedic therapeutic algorithm. So we can create algorithm pathways, and our future studies should be algorithm pathways only. So by explaining the next slide, I will conclude. This is the blueprint of a Ayurvedic treatment algorithm. First one is diagnostic logic. Use all the Ayurvedic concepts to bring your diagnosis. Mark it out very clearly, all the avasthas. It is very much possible. You can debate amongst the clinicians. Second is prioritization rules. First reduce ama, whether you should do so, all those rules are created. Then you decide your ahara, vihara, medicine, shodhana, shamana, yoga, create that plan. Then bring the sequence. If all these conditions are fulfilled, we can say it is an Ayurvedic therapeutic algorithm. And then that alone should be tested. Then what will happen? We will start testing Ayurveda the way it is practiced. Otherwise, all the research we are doing is good only for some stupid publications. It is not going to help our practitioners. It is not going to help our system. So with this, I will conclude. Our madam, all the madams here are very concerned that we should keep time. And that's why I did not make a very big slide presentation. I hope in this short time I was able to convey some important points. Thank you so much for this opportunity.
That was fantastic, sir. That was very insightful scientific information on the topic covered. Thank you so much. Now I'd like to request Dr. Ravisankar Parvaje to present a scientific session on the topic CVA. We welcome you, sir, on the stage.
First of all, I am thankful to the organizers for giving this opportunity to share my experience of treating acute stroke. I am not talking about joints. Already two previous session they have done on joints. Now I am talking about a stroke. First, let us pray. God Dhanvantari, Om Namo Bhagavate Vasudevaya Dhanvantaraye, Amrita Kalashahastaya, Sarvamaya Nashanaya, Trailokya Nathaya, Vishnave Swaha. Then let us pray all our Gurus, Guru Brahma, Guru Vishnu, Guru Deva Maheshwar, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. With the blessings of all Gurus, all Apurva Vidyas and Purva Vidyas, let us think about management of acute stroke. What is acute stroke? Stroke can happen either hemorrhagic or occlusive. Occlusive may be due to thrombosis or embolism. It may present a transient ischemic attack or complete lacunar infarct or infarction anterior middle posterior cerebral artery. Patient is going to, at evaluation occurs, he comes vertically to our hospital. When they go, they become horizontal. This is what happens usually. Prognosis is, in acute state when they come, we have to prognosticate. If large area involved, prognosis is bad. Small area involved, prognosis is good. And old age, prognosis is bad. Younger age, prognosis is better. What happens in stroke? A small area, complete occlusion occurs, either in hemorrhage or infarction. Due to this hypoxia, there will be death of tissue occurs, there will be big area of inflammatory swelling that causes congestion, big area, congestion, edema. When this happens, if you treat such a condition, acute stage, it's very important in acute stage, correctly if you treat, you can reduce this inflammation, congestion decreases, a horizontal patient may become vertical. If you treat wrongly, even they come vertically, he becomes horizontal. So here becomes our treatment should be correct. In Western medicine, usually the presentation is disorientation, unconscious, or coma. They present with convulsions, controlled part of the body weakness, hemiplegia, and they come with death also. Usually there will be increased blood pressure. If a patient goes into shock, there may be decreased blood pressure also. So blood pressure is not the criteria for diagnosis of a stroke. Stroke can be diagnosed only with the CT scanning or MRI scanning. The treatment protocol is told in hemorrhage, there is no specific management. You are managing the situations. Electrolytes imbalance, RT feeding, IV fluids, diuretics. Outcome cannot be predicted, may recover with permanent disability or may not recover. In infarction cases, recently some thrombolytic drugs came. It should be given within 3 to 4 hours of attack. Patient will recover completely with some weakness. But if he comes after 4 hours, there is no specific treatment. Treatment is only blood thinners to prevent further attack and treating the complications and situations. And passive movement after stabilization, physiotherapy, rehabilitation. A stroke means you should not think it occurs only due to hemorrhage or infarction. A stroke-like presentation can occur by infections, by tuberculosis, etc., or septic encephalitis, or a malignant growth, or road traffic accidents. By these conditions also, injury. Also, patient may come with stroke-like signs and symptoms. So that is why, while treating this stroke, you should diagnose specifically what happened to the patient. So that is why we have to, with the 21st century as Vaidyas, we should diagnose specifically what happened. So then only we can treat. This is our modern explanations, treatment, how it can be done in Ayurveda. In Ayurveda, the specific is the sutra. What Charaka says, Hetulinga Vashanam Sasthatara Parayam. Patient comes to us with the signs and symptoms. Linga, we have to understand what is its Hetu. Then for that Hetu and Linga, we have to give Aushadhi. That means Karya, Karana, Chikitsa should be done. In Ayurveda, the logic utilized for Karya, Karana, Vechana is doshas. That is why Sushruta says, Nasti rogo vina doshaha. Without analyzing dosha in a given patient, you should not give treatment. So always you analyze dosha in a given patient, give dosha vyadhi viparita chikitsa. Anuktamapi, even it is not told, you have to do doshanam lingahi vyadhi macharet. In a given vyadhi, you have to see dosha linga, then give dosha vyadhi viparita chikitsa. Already Dr. Raman extensively explained what is the utility of it. It is a very particular thing. All we Ayurvedists should do dosha linga in given vyadhi, give dosha vyadhi viparita chikitsa according to avastha of the vyadhi. Next, please. Then comes Charaka's this great statement. Before giving the treatment, a Vaidya should have Trivida Bodha. Trivida Bodha means, one is Vikara Prakriti, which dosha involved in a given vyadhi. Second one is Adhisthana Vishesha, where is the pathology occurred. Samuthana Vishesha, how pathology has started. These three things Bodha should be there in a given person. That is why Charaka says, Hetu Sthana Vishesha Bhaved Roga Visheshaha. Hetu Vishesha and Sthana Vishesha. Hetu Vishesha, Samuthana Vishesha, Sthana Vishesha, Yatra Sthana Samshaya. These two things we should understand. So let us understand one by one in a stroke. According to Ayurveda, he says, Sthana Vishesha is Pakshagata, one-sided weakness in the body. The Sthana Vishesha for Pakshagata, he says, it occurs when Prakupita Vatadosha gets Samshaya at Thiryagata Damani Urdvadehaga, then Anyasandra Sandhu Vibandha occurs. That means Sthana Samshaya is in Urdvadehaga, Thiryagata Damani Urdvadehaga, not your body. That is Sthana Samshaya. How occurs? Prakupita Dosha. Like that, Akshepaka also can happen. How much how many types of this Pakshagata is there? Usually, we think that Pakshagata is Vataja. But Sushruta says, according to Samuthana Vishesha, it can have Shuddha Vataja, it is Krichya Sadhya, Anya Dosha Samsrishta, that is Sulabha Sadhya, Kshaya Hetuka is Asadhya. Here, Jajata says, Shuddha Vata, difference between Shuddha Vata and Kshaya Hetuka, because by Dhatukshaya only Vata Prakopa occurs. Shuddha Vataja is Viruddhahara Vihara Krita Shuddha Vataja is Krichya Sadhya, whereas Rakta Srutijanya, Ati Srutijanya is Asadhya. Rakta Ati Srutijanya means don't think it is intracerebral hemorrhage. At that time there was no CT scan to see is it intracerebral hemorrhage. Actually it is external bleeding, postpartum bleeding, or war was going on, cutting off the body part, there will be extra bleeding, so that patient goes into state of CVA. Such a thing is asadhya, that's what he says. Even now also, instead of yuddha, road traffic accidents are going on. Only golden hour is there. If extra bleeding happens, patient is going to die. That is asadhya, what Sushruta says. Now coming to, he says, anya dosha samsrishta is sulabha sadhya. How you will understand anya dosha? Anya dosha samsrishta means it becomes, now Pakshagata becomes 5 types. One is keval vataja, another is only kapha samanvita, or only pitta samanvita, or both kapha pitta samanvita, and 5th one is rakta srutijanya. You leave rakta srutijanya because it is asadhya. Sulabha sadhya is pitta samanvita and kapha samanvita. How you can understand what is this? Here Bhava Prakasha says, Daha santapa murchasyu pitta samanvite. When a patient of stroke comes with the murcha or madha or sannyasa, that is pitta samanvita, he says it is sulabha sadhya. When gurutva shaitya shotani, if it is there, it is kapha samanvita. Or both symptoms may be there. If you see in acute stroke, when patient comes, they usually have semi-conscious, unconscious, or coma. They come with the tingling sensation, heaviness, this and this, that means it is pitta kapha samanvita. Sushruta says it is sadhya. Why we should live? We should think according to Ayurveda. So, with this understanding, here Hetu Vishesha is Vata Prakopa. How Vata Prakopa occurs, that we have to understand. Sthana Samshaya is Tiregadam Urdu Dehega. Hetu Vishesha is Vata Dosha Prakopa. Here, Vata Dosha Prakopa can happen, what Sushruta says, Dhatukshayat or Margavarana, then Cha. Dhatukshayat Vata Prakopa, or Margavarana Vata Prakopa, or Cha, Dhatukshaya due to Margavarana. By these things can happen. How we should understand this Samuthana Vishesha before giving the treatment. How Vata Prakopa can happen. Because patient may comes with different scenario. By Ruksha Shita Virdahara, Dhatukshaya occurs, Vata Prakopa, Sansamaya get one Vyadhi. Second one is Kapha, Pitta, Rakta, Mamsa, Meda, Asti, Majja, Shukra, Vittanna, Mutra. All these things do Avarana. Get Vata Prakopa, get Sansamshaya. Any one thing can happen. Here, a Kapha, Pitta, Avrta will be in molecular level. It is Sarvadehika. But Pakshagata is Ekadeshaja. Then comes Rakta, Mamsa, Meda, Asti, Majja, Shukra. These are in tissue level. Whereas Vitra and Mutra is macro level. Here, Raktavarana can happen localized anywhere in the body. Mamsavarana, Medavarana will be particular srotas. Here, Raktavarta, Vata Vyadis are anywhere in the body, Ekadeshaja, but all our body, anywhere it can happen. Sirasna, Sandhi, Asti, Marma, Koshta, anywhere it can happen. Whereas, Kapha Pitta Varta Vyadis, Sarvadehika, like Madhumeha, Dosha Varta Pathothava. Sarva, one hand Madhumeha, no Madhumeha, it's not possible, it's all over. That is a differentiation. To understand Raktavarana, this is, then comes, like this Prakuta gets Sansam, you get different disease. Here it is Marmagata. Then comes a Cha. Cha means Dhatukshay due to Margavarana. Here, initially, Avarana symptoms are more. And after some times, Avarana symptom comes down, Dhatukshay symptom takes over. How we can understand? If you see patients of Pakshagata or Gridrasi, all this, when they come initially, there will be Avarana symptoms. Numbness, heaviness, all this, but there is no degeneration. Dhatukshaya. But after 6 months if he come, there will be degeneration. Who has happened? How it's happened? Because of this avarana, Dhatukshaya happened. So patient may come with 90% avarana, 10% Dhatukshaya, 50% 50 Dhatukshaya, or 10% avarana, 90% Dhatukshaya. Can you give same treatment? It is Pakshagata. Can you give same treatment? It is not possible. That is avastha vashena chikitsam. In which avastha he comes. If he comes in avarana avastha, avaranahara chikitsa, Dhatukshaya avastha, you give brahmana chikitsa. To understand, is pitta samanvita, there will be Dhatrashna Shulam Brahmaha, Shula is Vata symptom, other pitta symptoms, Shaitya Shota Gurutvani, Shula is Vata symptom, other Kapha symptoms are there. In the Rakta Avarana, there will be Daha, earth in between Twakka and Mamsa, Raga, redness, Mandalani Shayatu. That is why I said it is Ekadesha. Mandalani Shayatu cannot happen all over body. Ekadesha, anywhere it can happen. Here, very interesting thing is, what Charaka says, arthi in between Twakka and Mamsa. What do you understand by that? Do you think any patient comes to you and tell, my pain is in between skin and Mamsa? No patient will tell. So instead of that, the word used by Sushruta is Sparshadvesha. Sparshadvesha. Sparshadvesha means tenderness. If you touch, pain is there. A clinician like me, it's very easy. If a patient comes to you, tell any condition, if you touch him, he feels pain, immediately you should think it occurs due to Rakta Avarana Vata Prakopa. The treatment is, you can immediately select Rakta Ama Pachana should be done. It may be Ama Vata, it may be Vata Rakta, it may Sandhyastigata Vata, it may Katyastigata Vata, it may Mamsagata, Marmagata, any, or Koshtagata. Tenderness is there, that occurs due to Rakta Avarana Vata Prakopa. There is no other pathology told in our Grantha where Sparshadesha occurs. Only occurs due to Rakta Avarana Vata Prakopa. So, then this is Daha Arthi Raga. How this can happen? To happen this, there should be Rakta Dushti, because Rakta is a Dhatu, Vayu is a Dosha. Dosha is a Shakti Swarupi Dravyas. How a Dhatu can block movement of Vayu? Because it does not have Shakti. If this Rakta get Dushita by Doshas, that Dushita Rakta can block movement of Vayu. That is very important to understand. So Rakta Dushti should happen, precursor getting Rakta Avarana Vata Prakopa. That is why in Charaka he says, first line is, Rakta Dushti can happen either Vata Swarupa, Pitta, Kapha Swarupa. If Pitta Swarupa Rakta Dushti, Rakta Avarana Vata leading to a disease, it will have Pitta Vata Lakshana. If Kapha Swarupa Rakta Dushti, Rakta Avarana Vata leads to a disease, it will have Kapha Vata Lakshana. If Vata Swarupa Rakta Dushti, Rakta Avarana Vata, it leads to Kevala Vata Lakshana. So here, Rakta Dushti Karanas, he says, if first line is Pitta Swarupa Rakta Dushti Karanas, whereas second and third is Kapha Swarupa Rakta Dushti Karana, fourth and fifth is Vata Swarupa Rakta Dushti Karana, Kale Chana Chardivega Pratigata, and Abhigata is a cause. One is Abhigata, second one is Ahara Vihara. What is third one? Third one, the cause is Raktaja Kribis, Raktadishtan, Praya, Vikaran, Chandin, Tite. Raktadishtan means Kushta, Visarpa, Bidakadin. Bidaka, all Raktaja Vedis, whatever told here, all occurs due to Rakta Avarana Vata Prakopa. Here many Shonitaja Vedis are there. It may happen by Krimis, Raktaja Krimi, Shukshmaha Anamaha. It may be bacteria, it may be virus, it may protozoa, it may fungus. Anything can cause Rakta Dushti, Rakta Avarana Vata Prakopa. To precursor for that, there should be Dosha, Samadosha. When Samadosha Avastha is there, this Krimi will not do anything. When Dosha Vaiparitya occurs by Ahara Vihara or Abhigata, then only Krimi takes over. Once Krimi is taken over, then Krimi Chikitsa should be your primary treatment. Then only you can treat Ama, Pachana, Chikitsa should be done. So it should be, it's very important. In this context, not necessary, I will tell you. So then another thing, Rakta Dushti can happen. Number one is, when Rasa Srotas get Avarana, by Marga Avarana occurs, by Kapha, Dushta Kapha Medasa, then what happens? Avarana occurs, Shesha Dhatu Napyayante, there will be Alpa Prano Bhavata. Alpa Prano Bhavata means hypoxia occurs. When hypoxia occurs, there will be death of the cells. That leads to prameha pidaka, jwara, bagandhara, vata vyadi, vikaranam. All vata vikara can happen. Actually, this is nothing but dushta kapha getting avarana of rasavasota. That's arteries are blocked. Then srotarodha occurs, lead to alpaprana, death of tissues. Then runashota can happen. This, when block occurs, there is death of tissues. That causes raktavanada prakopa. That causes congestion, decreased blood supply. Either it can happen by that coined, this word can be doshaja marma abhigata. One is abhigata. Here by ahara vihara, doshaja marma abhigata. Either it occurs due to margavarana or due to binatti. Rasavasota damaged, ruptured, that is bleeding occurs. 20% of cases occur due to hemorrhage, 80% occur due to block. Either going to get vata vyadis like pakshagata, akshepaka, these things can happen. So there should be precursor, there should be runa, shota should be there. So it is clear now that raktavarta leads to runa shota. It can happen. Tvakmamsa sirasnayu sandhyasti marma koshta. It occurs it shiro marma. Sharvo, shiro, marma. While treating this, if it is abhigata, shalya chikitsa should be done. If it is dosha drishti, dosha marma abhigata, dosha amapachana should be done. If it is krimija, krimi chikitsa should be done. That is why in Charaka he says, by runa shotha, runas upadrava, you get pakshagata and akshepakas can happen. So with this understanding, we can understand rakta dushti happened by krimi, you have to do krimi praktivika chikitsa. If it is abhigata, shalya should be done. If it is by ahara vihara, doshaja maramabhigata, dosha amapachana chikitsa should be done. While treating this treatment aspect, you go, when it is pitta, vata, kapha is involved in a single case, multiple syndromes, multiple symptoms are there. Idam eva pridam, idam nait avadharanam nayukta chikitsayam avastha vidanam hi pradhanam. If you see the pakshagata chikitsa, he says, what he says, prag snehanam svedopandam mruduna shodhanena. Snehana svedana mrudu shodhana. Then astapana anuvasana should be done. Then he says, cha yatha kalam akshepaka chikitsa. That means a patient of stroke, if he comes in akshepaka avastha, what should be your treatment? Is it pakshagata or akshepaka? Your treatment should be akshepaka chikitsa. If you see the acute cases, they come within 1 hour, 2 hours, 3 hours, 4 hours, or 6 hours, they will have, most of the patient will have akshepaka. Akshepaka means don't think there will be gross convulsions. Slight rigid muscles are there. That not flaccid, rigid muscle. That indicates in a state of akshepaka. There will be movement of eyes. When patient comes in that state, don't treat him as pakshagata. Treat him as akshepaka. What is akshepaka chikitsa? He says in akshepaka chikitsa, tatra pragya sneha abhyaktam svinnam avapidena tikshena upakrameta shirashuddhyartham tikshna nasya avapidana nasya should be given. After that, vidarigandhadikvatam mamsarvadiksham acha sarpipana should be done. Nati matram vayu prasarayati. Vayu prasarana to shakas are prevented by giving snehapana. How much sarpi? Acha sarpipana means without mixing anything you should give sarpi. How much sarpi should be given? This question he does not tells there. In a snehanadhyaya, if you see, in unmada, mada, sarpavisha, in these conditions you have to give prabhuta matra of snehana. 24 hours digestion happens. About 8 palas, 300 to 400 ml of grita should be given. Which grita should be given? According to which dosha involved. If it is, usually what I do is, if pitta samanvita is there, pitta involved, pradhana is there, we give mahatiktaga grita. If it is kapha samanvita, you give panchagavya grita. If it is kevala vataja, we usually give kalyanaka grita. Like that, we select the grita, then prabhuta matra. After that, many parisheka abhyanga is told. Like this, sneha vrech anuvasa asthapan, like that you have to give dasharatra uta vega upakrameta. Like that you have to treat him for 7-10 nights. After that, pakshagata chikitsa should be done. So here, he says, it is kevala vataja. For samsargaja, when pitta kapha samsarga, your treatment should be, what should be your treatment? Here he says, jejata samtushte vatrakta chikitsam. You see, vatrakta comes here also. Ram Manohar sir is told Vatrakta is built all rectum. In here also he says Vatrakta Chikitsa should be done because Shoditavarana, Vata Shonitiki Chikitsa. It is Shonitavarana. That is why here we have taken, we should take Raktavarana. If you see Vata Shonitiki Chikitsa, if for Pitta Vatrakta different, Kapha Vatrakta different, for Vata Vatrakta different treatment is when Pitta Vatrakta Chikitsa, if you see, same treatment, he has told all Pitta Prabali, Drakshadi Kashaya, Shatadota Grita Alepa, Shita Parisheka, Shita Alepa, all these things he has told. That you should do. Along with this one, we can conclude semi Mada Murcha Sanyas Akshe Pakshagata. With all these indicates, Dosha Vinishya by Raktadushti by Krimi, Abhigata or Ahar Vihara, then Chikitsa should be done. If a patient comes to us with the Pakshagata, what we do, one-sided weakness, you understand, Tiryagadamani Urdhvajaka indicated, to understand Samuthana Vishesha, we should do CT scanning or MRI scanning. As a 21st century Vaidya, you have to see Samuthana Vishesha, Adhisthana Vishesha, understand. You can understand by CT scanning, is it infarction, hemorrhage, infection, growth or injury? Is it Rakta bleeding occurred or block occurred, infection occurred, Abhigata, Krimi, Dosha Vishamya can be understand. If by Hetu Vishesha you should, and by analyze sign symptoms, Madha Murthanyas indicate Pitta Samanvita, heaviness numbness indicated Kapha Samanvita, and Ekadesha indicates it's Rakta Dushti, pathology. Treatment you can understand by Shita Parishagitale Pitahara Chikisa, Tikshnanasya, Acha Sarpipana, Shunti Swarasa, Narikela Jala, Trifala, Shilajito, Haritaki, Kamadu Vidmukta, Hema Garba Patali, Abra Garba Patali, all these things can be used. If it is by Krimi Chikitsa should be done. If it is by Abhigata, Shalya Chikitsa should be done. This how it can be done, I will show some videos. Another 5 minutes I will show some videos. Okay. Here one patient came with a acute stroke, 70 years person came. He is blind from birth. He had a right-sided stroke, infarction in axillary infarction. What we have to do is Shatadavtagrita Alepa, Sheetala Alepa all over body and Himadhara should be done. It can be done in ICU with giving oxygen also, it can be done easily. The thing is, Sheetala Chikitsa is the primary treatment because Pitta Samanvaya is there. It may be Akshepaka or Pakshagata, it is Pitta Samanvaya. So, Sheetala, Alepa and Tikshnanasya should be given. This is very important understanding. I will say why it is done. Without leaving any part of the body, it should be applied. Shatadavta Grita Alepa. It's a very important thing. If you don't apply it, you will not get the result properly. It may be modern diagnosis should not go for modern treatment. According to Ayurveda, we should understand, give the treatment. In totally, according to Ayurveda, should be treated. So at the same time, Dhara is done by 4 angula above. I usually use Amalaki and Dhanyaka Hima. Amalaki and Dhanyaka Hima. Dhara given for about 20-25 minutes. Okay. You click there. Click there. It will run. Click. This is, after that we apply Manjishtadi Alepa with the Shatadavta for head. Taladharana is done. He is a right hemiplegic. He could not raise his right leg and hand, but left leg and hand he can raise. Right hand, right leg, complete hemiplegic. There is no movement at all. Left leg is there. Now I put the Nasya, Tikshna Nasya. Just after putting the Nasya, you see what is the result, how it happens. About Ashta Bindu Pramana, it comes around 1 to 1.5 ml. Tikshna, Avapidana, Nasya. Put. Just after putting the Nasya, awaken, Prabuddha Samjna, he awakened. Semi-conscious person become awakened. See, who could not raise his right leg, he started to raise immediately. Do you think Ayurveda is slow? Do you think Ayurveda is slow? If you apply correct Siddhanta, Ayurveda is fast, not slow. Just you see now what happens. Sharashuddhi occurs. Awakened, Prabuddha Samjna, he awakened now. See, now he is able to raise his leg properly. You see, that much is, that's a result you get. So here, if you see the BP, even patient comes to 250, 150, it becomes 100, 160 to 100. He is stabilized just after this. Why it happens? Why blood pressure raises after stroke? What happens? There is a death occurs, inflamed cells, there is a big area of congestion. Congestion means decreased blood supply, they don't get food. They start to cry, मम्मी दूध दे दो. उसका मम्मी कौन है? उसका मम्मी है hypothalamus. That stimulates hypothalamus. Hypothalamus in turn stimulates adrenals. Noradrenal is released fast, peripheral resistance increases, heart beats more, BP gushes up. Even a normotensive person. Here, without disturbing his system, you do Shitala Chikisa, Shita Barilepa, all these things. You can say Tamo Avarana goes, that is why. But in modern terms, we can hypothecate how it can happen. By applying Shitala Dhara, Shita Parisheka, Shita Alepa all our body activity decreases. When peripheral activity decreases, nerve activity decreases. When corresponding nerve activity decreases in brain cells thinks that blood supply is sufficient, congested area. So that stimulation of hypothalamus decreases, stimulation of adrenal decreases, slowly patient becomes active. Then you putting the nasya, immediately blood gushes into the brain and patient start to moving his limbs. Like that we do 5 times a day. This nasya is done for, if it is kafajamada, STP Pachamarahingu Saindava is given. If it is with the pitta, ST Pippalikhira, its thickness is reduced. If it is vata, pure kafaja murchavastha, Tikshnasya, Shwasa Gutara, ST Saindava, without Kshira. If it is in Sanyasavastha, give Lashuna Swarat. Nasya is given. After that, this is about 5 times you do. Then Prabhupada you give Gritapana, then you give Shunti Swarasa, then we give Tarpana as Narikela Jala is given. Same patient's video. He is lacunar infarct. After that, after like this 3 days, 4 days we do, when the Pitta Shamana occurs completely, then Kapha comes up, heaviness, numbness. This everything on Mada Murcha. Then we give Ruksha Chikitsa by Agni Alepa, what we all practice Rukshana Alepa. You press there, video. Okay, it is not. We do Rukshana Alepa Chikitsa and Basti. All these things should be done. You see, the patient who could not raise the limb, he is on his legs vertically within 15 days. This is what result you can see. Same person, he is a blind person, you should handle him. This is what you can get the result. Okay, here another patient, a hemorrhagic stroke, came on 4th July with such a big, just after 25 days treatment, where is the hemorrhage? Even gliosis also has not happened. This is what result you can get. You see, completely resolved. That same person, vertical, not horizontal. Within 25 days, he went home. If you say one patient has chance result, and I am showing another intracerebral with the intraventricular extension, such as so big bleed is there. We treated like this, all the treatment is given. Just after 20 days, you see, there is no bleeding. By 19th July, bleeding has gone, resolved. The same patient on her legs, walking. So now this is, you have seen, here is another patient. I am showing another 2 patients I will show, then we conclude. Here, another patient, very interesting patient, came with aneurysm, subarachnoid aneurysm. Question comes, anatomical defect is there. Usually we send for clipping. This patient also advised for clipping because outside the brain. Patient refused because her elder sister had the same thing. They have operated, she was expired. That is why they came for to me. You do whatever treatment, we will not lose 2 lakhs. You do whatever treatment. So I did same treatment. The patient came with this one, came with in a state of semi-conscious state. We did all treatment. At the end, again, we do MR angiogram. There is no aneurysm. Anatomy defect also corrected. A normal angiography, it is MRI, normal angiography you can get. This is what result you get. Another patient, you see same patient vertically went out of the hospital on the OPD. This is what you get the result. Another patient came with this infarction, multiple infarction, had hyponatremia. Patient had 110 sodium, so much. She is completely unconscious when she came to our hospital, almost semi-conscious. We did all the treatment, Himadara, Lepa, all these things. We did the treatment for about 25 days. Now slowly improving. Just after 30 days of treatment, she is on her legs. This is the result what you can get with this concept of Ayurveda. So, it's another patient came with the intracerebral hemorrhage, big hemorrhage is there. Treated all the things. Just after 20 days of treatment, now you see there is no hemorrhage, completely resolved. He went out of the hospital, you see, vertically went out of the hospital. Accordingly, stage of Murcha Chikitsa, Pitta Shamana, Pitta Samana, Akshepaka Chikitsa, Sheetalapanya, Sheetaparisheka, Acha Sarpipana, Jvara Chikitsa, after stabilization. After Pittahara, Kafara Chikitsa, if still disability is there, you will do Vatahara, Chikitsa, Shashtikisha Lebhyanga, Madhura Ganavashadi, Basti, all these should be given. So to conclude, Dosha Vikalpa, after presentation of Vyadhi is very important. So we have to do Dosha Vikalpa in all the Vyadhis, accordingly in different stage. You see, in acute state, there is no time for you. Abhi ek hafte ka dawa de do, baad mein aega dekha jayega, nahi. You have 5 minutes, 10 minutes to decide. Immediately you should decide which dosha, you should give specific treatment. If you give wrong treatment, definitely patient will lose the limbs. You don't have much time. It's very important, that time factor, when a patient is in acute state. So in present era, to succeed in Ayurveda treatment, our treatment should be better than best in modern system of medicine. You understood? Our treatment should be better than best in modern science. Then only people comes to us. So we can give better result in Ayurveda with utilizing modern advanced diagnostic and management equipments and drugs. Sometimes you may need cooperative medicine. Some patient goes into complication like aspiration, pneumonia, all these things. You may need some help from modern physicians. We call it as cooperative medicine or integrated medicine. You can need. Otherwise, no need of modern medicine. So, my advice to the students is Satadhyanam, Vadaha, Paratantravalokanam, Tadvidyachara Sevacha, Muddibedha Karo, Ganaha. Satadhyana Karo, discussion Karo, Paratantra Avalokan Karo, most important, Acharya Seva Karo. Work with the Acharya. Try to understand, practical understanding of theory. Then you can do Ayurveda practice correctly. Thank you very much.
Thank you so much, Dr. Ravi Shankar Perwaje, sir. That was very informative session on the topic covered. Now I request Dr. G.B. Patil, chairperson, to submit up all the scientific session which has happened. We welcome you, sir. And I request all the speakers who have done a scientific session Dr. Sri Nagesh K on the stage, and Dr. Ram Manohar P and Dr. Ravishankar Perwaje on the stage.
With very few words, I conclude the session. Respected speakers, dignitaries, and delegates, all the speakers, Dr. Nagesh K, Dr. Ram Manohar P, Dr. Ravishankar Parwaze are stalwarts and expertise in their specialties, deliberated, very good, informative, innovative, many thoughts regarding understanding and curative aspects of the diseases. Chikungunya, deadly dengue fever, it is not dengue fever, I understood, and rheumatoid arthritis, viral arthritis, cardiovascular accident, especially stroke. I hope it was all very essential for enrichment of our knowledge about the diseases. Especially Dr. Ramanor emphasizes on understanding samprapti. It is to be noted very well. Unless we understand samprapti properly, getting success in the treatment, it is not possible. Friends, I felt very glad and very proud to participate and act as a chairperson in this session. Under this World Ayurveda Summit is organized under the able leadership of Dr. Giridhar Khaze of Prashanti Ayurveda Center. I can recall my memory of participating first World Ayurveda Congress long back before 2002. A person can think big, can only achieve such big things. Dr. Khaze is a very good big thinker. That's why he can accept such challenges of organizing this World Ayurveda Summit in such large scale. We all agree that he is successful in doing it so. My heartfelt congratulations for Dr. Giridhar Khaze and his team for their successful organization of this World Summit. Dear friends, many youngsters, you have participated on these 4 days. You are the forthcoming torch bearers of Ayurveda. You can take away the many messages from here for your development of understanding proper Ayurvedic management of the diseases. Make your sincere efforts. Earlier speaker, while addressing, he was telling, when all these experts can do it, with your sincere efforts, you can also get successes, you can also do it. I wish all success for you all. Lastly, once again, I thank Dr. Giridhar Khaze and his team for inviting me here to participate in this Ayurveda World Summit. I appreciate and congratulate all the speakers also. Thank you one and all. Thank you.
Now I request our chairperson to give a token of appreciation to all our scientific speakers. I would like to call Dr. Shri Nagesh K.A. to take the token of appreciation from our chairperson, Dr. J.B. Patil, sir. Thank you, sir, for your scientific presentation. Thank you, sir, for your scientific presentation. Now I request Dr. Ravishankar Parwaje to take a token of appreciation from us. Thank you, sir, for your scientific presentation. Thank you, Dr. Ravishankar Parwaje, sir. Thank you for your presentation. Thank you, Dr. J.B. Patil, sir, for giving a token of appreciation. Thank you so much for your time, sir. Now I request Dr. Ramohan P. Kollam to take a token of appreciation. Thank you for your time here. Now I have one more happy announcement to make. Dr. Sajitra, wife of Dr. Ram Manohar P, has won the first prize in PG and PhD Scholar paper presentation. Dr. Sajitra, wife of Dr. Ram, thesis presentation on the PG and PhD topic, and she is a PhD scholar presently and senior research person in Amrita School of Ayurveda, Kerala. On behalf of Dr. Sajitra, we want you to take Thank you so much, sir. Now I request Dr. Prasanna N. Rao, sir, to honor our chairperson, Dr. J.B. Patil, sir. We request you to honor our chairperson, Dr. J.B. Patil, sir. Thank you so much for your time. Thank you, Dr. Prasanna N. Rao, sir, for honoring our chairperson, Dr. J.B. Patil. Thank you so much for your time. Thank you, sir. Thank you for being a chairperson for Shamana session. Thank you so much. Thank you, Dr. Prasanna N. Rao, sir, for honoring our chairperson. Thank you for all of your time, which is very precious, and showered your wisdom on all of us. Thank you. Thank you so much. Now we are starting our next session, Pawana session, within another 5 minutes. So our Pawana session we are starting now. The next topic which we are going to cover, the scientific speakers are Dr. Upendra Dikshit, Goa. The topic which is going to cover is cancer. Dr. Madhav Diggavi, Bengaluru, GB calculi and renal calculi. Dr. M. Gopi Krishna Ballari, CLD, liver cirrhosis, and our chairperson is Dr. Prasanna N. Rao. So we are starting the session now. We're starting our Pawana session now. Request all of you please settle down. I request Dr. Prasanna N. Rao, our chairperson, please come on the stage, sir. And Dr. Prasanna N. Rao is a director, STM Ayurveda Institutions, Bangalore, Hasana and Udupi. He is a former principal of STM College of Ayurveda and Hospital, Hassan, served as principal for 31 years, and former CCIM member, brought marked changes in Ayurveda education, and renowned surgeon and treated lakhs of patients with his profound knowledge. We welcome you, sir, as a chairperson. Now we have Dr. Upendra Dikshit Goa. We welcome you, sir. And Dr. Madhav Digavi. We welcome you, sir. And Dr. Gopi Krishna Ballari. We welcome all of you on the stage. Dr. Upendra Dikshit, our first speaker, is a well-known Ayurveda consultant at Ponda, Goa. Since 25 years, he is practicing and an eminent Ayurveda expert at national level. He has been treating emergency cases in Ayurveda and many cancer patients, and is graduate from Pune University, postgraduate in Basic Principle Ayurveda from Gujarat Ayurveda University, Jamnagar, PhD in Ayurveda from Pune University, and he has given more than 150 guest lectures in national and international level. So we welcome you, sir, Dr. Upendra Dikshit, sir. And now our next speaker is Dr. Madhav Digavi, sir. So he has 31 years of experience, and his research experience are Karnataka State Ayush sponsored research on anemia, PG research in Kayachikisa and andrology. He has done a research in male infertility and Uttarabasti. He has done a research in hyperthyroidism, neurology, oncology, autoimmune disorders, cardiology, and we welcome you, sir, for the session. And now we have Dr. Gopi Krishna from Ballari. He is a member of APC Ayush, member of Mercury Conversation in India, Ayush, and his experience in all type of Ayurvedic preparations like Pottali, Kalpas, and he has been an eminent speaker, and we welcome you, sir, for the session. Now, without much delay, I request Dr. Upendra Dikshit, sir, to do the presentation on the topic cancer. Over to you, sir.
We have been following this much before. We really because that was the immediate requirement for us to export the products. Is the predecessor equipment and the practice now which should be created as per the norms and being environment as well. Then the equipment in the area.
Respected Chairperson Prasanna Rao sir, all other dignitaries who are present here and all the delegates. My today's topic is cancer in Ayurvedic perspective. So the question arises that whether cancer is a specific condition of some other diseases described in Ayurveda, or it should be treated as a separate disease. Different Vaidyas are having different opinions about that. But practically we see that both these concepts need to be applied. Sometimes it is a specific condition described in our text. Sometimes totally in different way we have to think, but based on Ayurvedic concepts. In this pen drive. In this pen drive, there is another copy in JPG version. Cancer Ayurvedic Perspective Bangalore, and in that there is one folder. Inside the folder, another folder is there. In that JPG format copy is there, because this is not working properly. Inside the folder, another folder. Cancer Ayurvedic Perspective Bangalore. See, Cancer Ayurvedic Bangalore. And inside this folder, another folder. This folder, and that you run from the first line. JPG format. And make it full screen. This will not work. Okay, you can click. Same, but okay. PPT alignment is not that proper. Okay. We can change from this. No? That issue is due to Windows 10 and 11 version. That's why that alignment is changed. Okay. So if we say that cancer is some condition of the already described disease in our text, the main mention is about arbud. So, but all cancers which we find in practice, they are not arbud, but sometimes they are arbud. And then there is a reference about dvirarbud and adhyarbud also. So might be that is indicative of metastasis. So arbud can be considered. I have compiled opinions of different Vaidyas who are practicing in the field of Ayurveda and who are specialized in cancer treatment. And their opinions I have taken into consideration. So here arbud is described as vatraktasya upadrava. And Vaidya Samir Jamadagni sir from Pune, he gives emphasis on this point that this should be considered while treating cancer. In arbud, they have mentioned that ghattitam chinnam mruditam vyavardate. If the specific part of the body is pressed or bruised or pressure is applied on that or injury takes place, then vruddhi of arbud takes place over there. So what happens due to atilekhan, pidan, gattan, etc. Due to that, what happens? Rakta dushti takes place, sarvadaik shukra and oj vikruti takes place, dhatukshayjanya vat, and specifically achay purvak vat prakop takes place. This is mentioned in Charak Chikitsa Sthan, 30th chapter, 329th shlok. So, doshakshayatmak samprapti also can occur due to this reason. and Ashayapakrsha Gati can take place due to that. And this way also the samprapti of cancer can take place in certain patients. So what I am talking about right now, the important concepts in Ayurveda, I am talking about them in brief. And in the case studies, you will find that the same are applied in practice. So in our text, they have mentioned different types of arbud as per sthan. And nowadays also similar places, similar sites in the body, cancers are observed. Kapalagata Shiro arbud, Mukha arbud, etc. And similarly, at the same sites, cancers are observed in these days. Now, why the patients of cancers are increasing day by day? From Ayurvedic perspective, we can take different concepts in consideration, but one thing is that in Rasayan Adhyay, they have described that Sarve Sharira Dosha Bhavanti Gramya Harat. And what they have described right now here, it's found right now in the society, abundantly people are using these things. Like, for example, Kshar. So in Charak Samhita already they have mentioned that Chinese people use Kshar more. And now also we find that in Chinese food, Kshar are used in more quantity. And people are using that. So like that, whatever is mentioned here, Shushka Shak, etc., they are Virud Dhanya. These days people are using more. So these are becoming the hetu for various diseases. And what they have mentioned about the diseases, which diseases originate due to these causes. Ato nimittam shithili bhavanti mausani. So mausa shaitilya. Now this can be in different aspects, like there may be muscular dystrophy also due to this reason. Vimuchante sandhya, diseases of the joints. Vidayate raktam. Vidaha means pakwa. So in certain types of blood cancers, we find that the blood cells, the destined blood cells which are to be produced, instead of that some intermediate forms are produced. So that may be vidagdhata of rakta, pakwa, and that way the vikruti can take place. Shukram na pravartate, etc. So this is a broad samprapti, and this is applicable for the patients of cancers also. So if we find that there is any abnormal growth, like cancer in the body, then we have to look it in the perspective of Vat, Pitta and Kapha. So what is the role of Vat, Pitta, Kapha in such abnormal growths? So Vikrut Vat performs Sanyog Vibhaga, and Vikrut Sanyog Vibhaga takes place here. And Vyuhan is described by Chakrapani as Vahan, means transportation of the nutrients, and Samrachana, specific arrangements in the dhatus. So in that also abnormalities can take place, and that can be resulting into such kind of abnormal growths. So Vikrut Pitta, and further they have said that Paramanunam Sayoga Vibhaga Vayu Karanam. But there in the commentary they have clarified that not just Vayu, Purva Karma Parinam Gruhit Vayu. So that means Purva Karma, they affect Vayu, Gati of Vayu, and that's why specific derangements in the dhatus occur. So that's why Karma Javadi, also in certain patients of cancer we find Purva Karma. Like for example, one old lady, she had breast cancer and we were treating her because she was not able to undergo as per her age. They decided that they will not undergo any operative or anything. So we were treating her and the growth was reducing. And after some days, she had a fall and she had injury at the same site. And then again it started growing. Again we treated her, again the growth reduced. Again second time she had a fall on the corner of a table and that poked in the same region. And again growth took place. Now, if this is coincidence, how it is happening again and again, same coincidence. So here we have to consider about Purva Karma. Something like that also is observed in patients of cancer. So, Vikrut Pitta, Ayogya Pak and Parinaman Vikruti, due to that abnormal growths can take place. And Vikrut Kapha, because in Kapha it is told that Shleshmana Anugata Vruddhi. So abnormalities of Kapha can result into abnormal growths. So just like I have told, not just Parmanu, but Karma Swabhava Parigruhita Vayu. This is very important. And like I just told, that Shleshmana Anugata Vruddhi. Another important aspect is in Guna of Vat, one Bahuguna is described, and due to that multiplicity, that means multiple divisions can take place, but which qualities hampered due to that. Similar thing can happen in PCOD also. About PCOD, various other concepts also can be applicable, but this is also one of the concepts. Sharirasya abhinirvritti abhivriddhi rasaja bhav. So that's why rasadushti can result into abnormal growths. Tesham kshaya vriddhi shonita nimitte. So rakta is very important, and raktasya jivan karma. Jivan karma, due to that the cells, they survive for a specific lifetime. But vikruti in jivan karma, due to that the cells continue to survive even after their lifetime is over. And that's why abnormal cells continue to exist in the body. So that's why jivan karma vikruti also needs to be considered, and therefore shonit rakta also needs to be considered. Shukra, bayata, which goes, unites with artha and produces garbha. But sarvadhaik shukra, it also produces newer dhatus. Nutan utpatti of dhatus is due to sarvadhaik shukra. So that's why any abnormality in sarvadhaik shukra, then also abnormal growths can take place. And that's why certain Vaidyas, they are using shukra shodhan gana in the treatment of cancers also. So when we are observing the patients of cancer, sapta dhatu and their karma, we have to keep in mind, and accordingly. So just now we talked about jivan karma. Mouse and maid lead to, so if the size is increasing too much, then mouse and maid. If hardness is too much, then asti, because drudatva stiratva is that. So likewise we have to consider. One Vaidya, Ram Singha Gohil, who was staying near Rajkot in a small village, he treated cancer so much successfully that around 60-70 years back, he built one Ayurvedic hospital for the treatment of cancer in that small village. So he wrote one book, Cancer or Ayurveda, and he summarized his experiences. So according to his experiences, various concepts are to be understood to treat cancer. But in that, he told that due to Dhatvagni Mandya, Vikrut Vriddhi takes place. This is very, very much important concept, and this is involved in samprapti of many types of cancers. So we have to act on that Dhatvagni and correct the functions of that Dhatvagni. Then that Dhatu Nirman will be corrected, and therefore abnormal growths also can be controlled. Then we have a concept of Avayav Utpatti in Sushrut Samhita, in Ashtang Sangraha also they have described. So various organs, how they develop, from which Dhatu in the Garbhavastha. That is also very important, not only in cancer, but in many diseases we have to consider that why this specific site is affected in the body, why this specific organ is affected. So which Dhatus are involved. So accordingly, that dosh and medicines acting on that specific Dhatu, if you will give, then therefore that parinaman of that avayav can be improved, and not just functional improvement, but sometimes even anatomical changes also can be achieved by treating in this way. So in cancer also this is very important. So if we have to treat Dhatvagni, then we have to find out specific medicines which act on that specific Dhatvagni. So I have studied Bhavaprakash Nigantu from this angle, and I have prepared a list of all the medicines, every medicine on which specific Dhatvagni or which specific Bhutagni it is acting. I have given here a few examples only. There is a big list of all such medicines, and that helps in our practice. Similarly, just like plant medicines, Rasaushadhi are also need to be considered in that way. So certain specific Rasaushadhi and Rasakalpa, they act on specific Dhatu. That way, if you will consider, then we will be able to quickly make changes in that Dhatu. Abnormal growths can be controlled, but at the same time, normal tissue can be protected. So that's why these are the specific medicines acting on those specific Dhatus. So I'm not going in details of them right now. So just like I told, sometimes in our patients, the diagnosis may be given in the text, specific condition of a disease described in the text. Like certain patients of cancer, their Ayurvedic diagnosis is Rajakshma. Many times Pandu is the diagnosis, and Pandu means because of Agni Mandya, Am Nirmiti Srotorod, Rasadhatvagni Mandya, and therefore the nutrition is not available to the further Dhatus. And because of this Sama Dhatu, that's why Vikrut Vriddhi is taking place. Grahani, Rakta Pitta. So in various cancers related to intestines, Grahani is our diagnosis many times. Rakta Pitta, Kamala, Arbud, Gulma, Shwas, etc. diagnosis can be there. So now I will tell you about some of my experiences about cancer patients. So many patients I have treated. But for a few examples I am going to present, and only one case I will describe in details as per the constraint of the time. So recently 4 patients of diffuse large B-cell lymphoma, all the lymph nodes are completely resolved and more patients are under treatment without any modern treatment, only on Ayurvedic treatment. What we can do with Ayurvedic treatment, different aspects I am doing. Certain patients treated only with Ayurvedic treatment. Certain patients treated with Ayurvedic treatment as adjuvant. So here one 72-year-old lady, initially she had breast cancer history, and then last year, means actually that is 2 years back, she was diagnosed with squamous cell carcinoma. Then again she was diagnosed to have small lymphocytic lymphoma. Then again chronic lymphocytic leukemia. So 3 types of cancers were present in her body at the same time. And that's why the doctors said that we can't do any treatment right now, and her prognosis is very bad. Hardly 2-3 months she can survive. And she was very much weak, emaciated, and all over the body itching. The body had become blackish, and she was not able to eat because of mouth ulcers, mukapak, etc. So in a very bad status she was there. But after Ayurvedic treatment, there was no recurrence of any. These cancers were recurring again and again after treatment. So after our treatment, recurrence was completely stopped, and she, even blood transfusion also was required within 1 or 2 years only twice. Otherwise, she was maintaining the hemoglobin levels also. Initially, her hemoglobin levels were 5 grams. So she survived very well for 2 years. Now, some cases I am telling you in very brief, and one case I will tell you in little details. A 67-year-old patient in 2012, he had come diagnosed as bronchogenic carcinoma. And after diagnosis, he was totally only on Ayurvedic treatment. No modern treatment was given to him. What was the outcome? No metastasis outside the lungs. The original growth, tumor regression was observed. And one very interesting thing was observed, that one lobe of the right lung was collapsed, but that also was resolved. That lobe also started working functionally. So that was also surprising observation. So he survived for 6 years around without any modern treatment, because later on he got fed up that how many years I have to take treatment. So he left the treatment, and after stopping the treatment, after few months, after few years, he died. One 57-year-old person, he was initially diagnosed as CA esophagus, and later on he had metastasis in liver. And after chemotherapy, that lesion will reduce. But again, within 1 or 2 months, it will be again increasing in size. So like that 3 times it happened. So then onwards, he decided to take only Ayurvedic treatment. He stopped all modern treatment. And with our treatment, the growth, whichever was there, that was completely gone. And then after that, symptomatic relief, then no recurrence after Ayurvedic treatment, even after 2 years. After 2 years, he stopped the treatment. Then he survived for 3 more years, and due to some other reason, he died. All these patients, I am having their reports, but here I am not showing all those reports because of lack of time. So one lady patient, she had detected CA ovary and endometrium, both, not metastasis. Both CA cancers were present at a time. And she was operated on 21st November 2017. So instead of chemotherapy or radiotherapy, the patient was fully on Ayurvedic treatment after that. So like that also many patients are there. So instead of chemotherapy or radiotherapy, they are totally on Ayurvedic treatment. And this lady, he got complete symptomatic relief, no recurrence during last 8 years. Now again after 2017, up till now also recurrence has not taken place. So all the patients, I have got their reports, and after observing them for 5-6 years, I am talking about them. Not in a hurry, because people have this habit sometimes, new practitioners, that the growth was 4 centimeters, now is 3.5 centimeters. Immediately on Facebook, they will declare that 3.5 centimeters, the growth has reduced. But we should not hurry, we should observe carefully, even the recurrence is not there, then we can say that the patient is having actually relief. A lady with high-grade papillourethelial carcinoma, after partial resection, she was in April 2002. Since April 2022, she is totally on Ayurvedic treatment. And till that means she was told that after her resection, she was told that this recurs very fast. And that's why within 1 or 2 months, it is expected that it will recur. So you come back. But up till now also, no recurrence is there. And cystoscopy was done recently to confirm that. And that doctor said that 25 years I am practicing, but within these 25 years, I have not seen any case of this type of cancer which has not recurred, and that too without any modern treatment. Now only one case I will tell here about diffuse large B-cell lymphoma. The symptoms were related to skin, that means rasa and mouse related. And she was already diagnosed as having schizophrenia 20 years back. And in 2014, she was diagnosed as high-grade diffuse large B-cell lymphoma stage 4. In 2014, she was diagnosed. And psoriasis already she was having a history of that. Now you can see in her initial report, you can see that all over the body so many lymph nodes are there and very large size lymph nodes are there. You can see, and that's why it was decided that as stage 4. Big list. Big list. All these lymph nodes were present all over her body. So these are her reports. I have already summarized those reports. Initial reports. Then from Ayurvedic point of view, we examined her and diagnosed her. Ayurvedic parikshan is also very important. Talarudai is related to man, nadi for Talarudai. And Angushtamul Parvat, that nadi indicates Sarvadik, Shukra and Oj. So already she was having Unmad, so that's why these were prominent. Rauksha may not be only related to skin. Rauksha can reach to different types of dhatus. In Ojaksha, that is described. Rauksha can be related to different dhatus. So here, it was related to these dhatus. So this was the treatment given for her, considering Rasa Dushti and Mouse Dushti. So that's why Suvarna Malini Vasanta was given to act on Rasa Dhatvagni. And Hirak was given. And since she also had skin problem, that's why Mahatikta Gruta was given. The reason for Rasadushti is improper digestion, usually. So Grahani Daurbalya. So therefore, when Parpati is given, then Agni resides in Grahani. And Parpati is one of the best kalpa to act on Grahani. So when functions of Agni are improved in Grahani, Jatra Agni functions are improved, then it becomes easy to control the functions of Dhatvagnis also. So that's why Panchamrut Parpati was given. In that Tamra, etc., ingredients are also important here. Then Tapyadi Loha. Rasamanikya is also very important medicine in this regard. So this was the treatment. I can explain why all these specific medicines were selected, but in brief, I have told you about that. So symptomatically, she had improvement, and in the further reports, there was improvement. All the blood reports were also normal, and this is her latest report. After 2014, now also she is not having any lymph node, all thorax and abdomen, completely all the lymph nodes are resolved. So she went to Goa Medical College Hospital to take that report. And her brother, that means she is schizophrenic. So doctor asked her brother that stage 4, diffuse large B-cell lymphoma, what treatment you are taking? So they said that we are taking Ayurvedic treatment. Are you idiot? You want to die? You are taking Ayurvedic treatment for this. So they did not say anything. Next day they went to collect the report. And that time they said that doctor, yesterday you were very angry. But last 11 years we are taking the same treatment, Ayurvedic treatment. And my sister is well. And she is doing well, she is healthy. And then the doctor saw reports, all the lymph nodes are completely resolved. Then the doctor's tone was changed, and he said that, can you give address of this doctor? One of my relatives is also having the same problem. So I have told you some important concepts about cancer from Ayurveda, how we can think about cancer. And I have given you one example and few examples of other patients in which how we can apply those concepts in practice. So what was the outcome? 6 cycles of CHOP were advised, but after 3, she started Ayurvedic treatment. Then onwards, no modern treatment, surviving well still since last 11 years. Although she took medicines in between irregularly also. It was a long time period. So still, she is doing well. Another case of diffuse large B-cell lymphoma, which was completely the lymph nodes were resolved. It was published 2 years back in international journal. That case we published. So I thank the organizers for giving me opportunity to present my views in front of you. And I thank you all for patient listening. It's difficult to listen when there is time for lunch, but you are having the hunger for knowledge also. So that's why you listened carefully. So thank you all very much.
Thank you so much, Dr. Upendra Dikshit, sir. That was very informative scientific presentation on the topic cancer. Now, before I call upon the next speaker, I have an announcement to make. We have a thesis and case presentation by awardees. After this Pawana session, after this session, we have a presentation by awardees. We have 6 awardees in each section, case presentation and thesis presentation due to their time, content and topic delivered. So each position is taken by 2 people. So they're going to do a presentation after the session, and case presentation timing should be 6 minutes and thesis presentation timing is 8 minutes. Please be prepared. And the next topic which we are going to cover is, GB calculi and renal calculi by Dr. Madhav Diggavi, sir. So we welcome you, sir.
देववैद्याय विद्महे धन्वन्तरै च धीमहि तन्नो देव प्रचोदयात् रागादिरोगान् सततानुशक्तान् अशेषकाय प्रसृतान् अशेषान् औत्सुक्यमोहारतिदान् जघाना यो पूर्ववैद्याय नमोस्तु तस्मै. With great salutes to Lord Dhanvantari and the veteran, my teachers, with respect to the chairperson, Dr. Prasanna Rao sir, Dr. Bannigold sir, Anjanaya Morti sir, Dr. Ahalya madam, all the dignitaries and my dear students. Today it is a very good opportunity to share few of my clinical experience with Pittashaya Ashmari and Mutrashmari. There are, next slide please. There are different versions with relation to this clinical symptom. When I was a student, the number of cases of gallbladder calculi were less, but Mutrashmari, it's always a Mahagada. The cholelithiasis is such a particular clinical condition when there are the gallbladder juice becomes condensed. It is not actually stone. Pittashaya Ashmari is not exactly stone, but it is a condensed. Condensed Pittashaya secretion causes gallbladder calculus, cholelithiasis. When the Pitta is having a defect in its Dhatvagni, lecithin and other chemical enzymes, they solidify the gallstones. There is a definite pancreozymin or cholecystokinin, metabolism is changed. Gallbladder is a pouch which has got different names. It may be taken as Unduka, it can be taken as Pittashaya. And these cholecystokinin and pancreozymin, they are secreted in the Annavasrutas, and Pittashaya Ashmari is one of the Annavasruto Vikara, it is mainly due to the Medo Dhatu Dushti. The Medo Dhatu Dushti specific samprapti takes place due to this, and the elimination of excess cholesterol is not possible, and that restrained cholesterol in the gallbladder makes it condensed, and that condensation causes gallbladder stones. So the fat soluble vitamins, the pitta srava should motivate, the gallbladder receives the pitta srava and makes it more acidified and then pumps it into the grahani for further saponification of fats. If this is not happening, we can see in the picture, gallbladder wall should be always checked. If the gallbladder wall is thickened, it is cholecystitis. If there is a sludge in the gallbladder, it is due to the solidification process and contamination of the fluids inside the gallbladder. And gallstones are solid mass. So this pathology, if you see, cholecystitis, cholelithiasis, choledocholelithiasis. When there is an infection, usually patients suffer with more problem. When there is no infection, patient will not be in much serious condition. And this cholecystitis causes infection-based pitta kaphajanya sannipataja vyadhi. When there is no pain, it is only pitta kaphajanya granthi, pitta kaphajanya lakshanas. So whenever these gallbladder calculi, if the size of the calculus is bigger than the opening of the bile duct, it is more complicated case. If the stone is unable to pass through the common bile duct, it is very severe surgical clinical condition. Then tatra dhanvantriyanam adhikaraha. I will not touch that. I will talk about only medical management of gallbladder stones, pittashaya ashmaris, which can be treated with only medical line of treatment. So there are cholesterol stones, pigment stones and mixed stones. Cholesterol stones have got a radiating appearance. They are more of Raktavarna. Pigment stones are more of Krishnavarna. Mixed stones of Pandu and Raktavarna. So based on the Varna, we can say that in the center, pigment stones are more of Vata dominant and cholesterol stones are Pitta Rakta dominant and mixed stones are Tri Doshaja, Sannipataja stones. Whenever there is cholesterol, calcium, sulfates, carbonates and proteins, when they are mixed together in the food, so Viruddha Ahara, Asatmya Ahara and all Pramitashana, Adhyashana, Anashana, all these different categories of Ashana Vyadhis will cause gallbladder stones. That's why Nityam Hitahara Vihara Sevi, Hitabuk, Mitabuk. And I congratulate the Kaje Foundation. They have given yesterday's menu I was saying, there is no contraindicated aharas. There are no viruddha aharas. They are going more focusing on satvika aharas. When rajasa tamasa aharas are taken, gallbladder is unable to digest those cholesterol molecules, paneer or any dairy products which are taken excessively for a longer period of time, gallbladder starts getting defects. So patient symptom may be right hypochondriac pain. Patient will have radiating pain from right hypochondrium to the back and patient will have gastritis. Amla pitta lakshana, udavarta lakshana and also patient will have vidagdajirna lakshana and patient will have the lakshanas related to vata pradhana tridosha dushtis. So there will be tip of the shoulder blade, even patient goes to the tip of the shoulder blade plane, you can clinically diagnose patient is having cholecystitis with cholestasis or not, or gallbladder calculi is there or not. Many times gallbladder calculi are painless. Once they are painless, they are in advanced stage. They are triggered by a fatty meal. Whenever patient takes a fat related food more, postprandial pain. Bhojanottara ruja is very significant in this. Some of the patients will have nocturnal pain. Midnight or early in the morning pain starts and patient will have 30 minutes continuous pain. Patient scrolls and later on gradually pain comes down. The frequency of recurrent attacks, there is punaravarta kashula is continuous. So assessment is made by either an X-ray, ultrasound scanning of the abdomen, LFT and pancreatic enzyme. And also patient should have a MRI scan and cholecystography or cholecystography, ERCP or MRCP and PTC, CT scan and MRI. Depending upon clarity of the picture, the radiologists prefer to go for higher level of investigations. The management starts with medical, IV fluids, and anticholinergic drugs, analgesics, surgical managements, and cholecystectomy, they are all there. In urolithiasis, I have taken I have given a topic where Pittashaya Ashmari and Mootrashmari together. So I'll go in brief about urolithiasis. The Pittashaya Ashmari is the fat based or Medo Dhatu based, whereas kidney stones are Mutra Dushti based. In kidney stones, Mutra Dosha is very specific. So kidney stones or Mootrashmaris are due to the Mutra Dushti, whether it is due to Mutra Sangha, Mutra Dosha or Avarana. There will be Mutra infection, recurrent infections. Then there will be kidney stones, pelvic stones, ureter stones, and bladder stones. So there will be different category of urinary stones like calcium stones, struvite stones, uric acid stones, and cystine stones. So the location is very characteristic. The patient can be diagnosed with simple ultrasound scanning or KUB scanning. Tuni and pratituni are two clinical symptoms which require a differential diagnosis in Mootrashmaris. You can see the kidney will have the glomerular filtration rate. It is a calculated rate. When GFR is affected, creatinine is raised, this Mootrashmari is very difficult to treat. And in emergency renal colonic, it is very archaic condition where renal colic is very painful. Patient is crumbling on the bed. Patient requires modern medicine. Whenever patient is having more pain, the patient requires pain relief medicine from modern side. Otherwise, we can do Mutra Vasrotas, Mootrashmaris very well in our treatment. Obstructive uropathy. Whenever there is an obstruction of that Mootrashmari to the Mutra Vasrotas, there will be backward pressure of the Mutra and that will cause hydronephrosis. Then we have to go for surgical intervention. So minimum protocol is USG abdomen, CT, lipid profile, thyroid profile. Parathyroid hormone and thyroid hormones are very important for the Utpatti and Samprapti of Mootrashmari. So pain in the right hypochondrium, pain with vomiting, pain with renal angle, pain radiating to pubis, that is Thuni, pain related to micturition, Mutra Kruchra, pain after the fatty food, pain with urinary tract infection, pain with altered LFT, pain with fever. So many components in Ayurveda is possible. That's why it is a Mahavyadhi. Gallstone is a disorder of Mahasrotas and Raktavasrotas, Pittavasrotas. Kidney stone is a Mahasrotas, Mutravasrotas Vikara. In Pittashaya Ashmari, the Talim Khana Kshar, that is Kokilaksha Kshara, is Agradravya for gallbladder stone. The Kokilaksha Kshara Prayoga and some minimum of Shodhana Ghritas, and for Mootrashaya Ashmaris, Snehapana with Snigdha Taila. For Pittashaya Ashmari, Ghruta Prayogam, Yamaka Sneha Prayogam, and for Mootrashaya Ashmari or Mootrashmari, Snehapana with Taila Prayogam. Taila is Ushnam and Ghruta is Yogavahi. That line of treatment can be taken. And in Pittashaya Ashmari, Pittasthane Kafam, Kafapitta Dushtihi, or Apmaha Bhavata Dushti in Pittasthana and Pittavasroto Mula is the Samprapti. Medo Dushti in Pittavasrotas and Pittavasroto Mula is the Samprapti. So Amla Avastha Paka Vishesha Dosha is observed in gallbladder disorder. Whenever gallbladder pathology with Ashmari is seen, it is Amla Avastha Paka Vikara. Whereas Mootrashmari is, according to Kayachikitsa principle, it is a Katu Avastha Paka Vikara. So if you are able to understand applied physiology, Mootrashaya Vikara and Pittashaya Vikara can be diagnosed as Amla Avastha Paka Vikara and Katu Avastha Paka Vikara, then we are able to treat these cases. So some of the important herbs to be used in Mootrashaya Ashmari or in Ashmari in general is, I prefer Kulatha. Kulatha may be Amla Pitta Janananam Sreshtaha, but Kulatha is one of the wonder drug. It is a ahara as aushadhi. It is a food as a medicine. This Kulatha Yusha and Kulatha Kalpas are very effective. Varuna, Shilajatu, Haritaki Kalpas, Pippali Vardhamana Rasayana, Amalaki, Ballataka Prayogam. Whenever there is a Granthi, Apachi, Arbuda, Avarana, Gulma, Udavarta, we should take Kafa Pradhana Vyadhis with Ballataka as Vyadhi Pratyanika Rasayana. Bhringaraja is very good for gallbladder and liver Rasayana, Gokshura, Guggulu, and then Hingu Trigunataila, Hingu Vachadi Churna, Haridra and Katuki. They are all very effective. In Pittashaya Ashmari, we get in commercial market Lithorin tablet, Pithorin tablet and Bangshil tablets. I also give importance to these commercial preparations, but classically Sharapunka Kshara, Mulika Kshara, Shweta Parpati, Bhringarajasava. One of my best prescription to the patient is Shweta Parpati with Bhringarajasava. Within 24 hours, gallbladder patients will respond. Whereas Samprapti Vigatana may take more than 6 to 8 months time, Ballataka Ksharam, Pana Viraladi Ksharam, Navasagara Lepam, Kulathadi Kashayam. If you apply Navasagara Lepa over the gallbladder, pain comes down. Punarashtaka Kwata, Bhunimbadi Kashayam, Falatrikadi Kashayam, and Bruhatyadi Kashayam. In Rasachikitsa in Ashmari, Rasaushadis are very particular to be used, is Chinchaksharam and also Hajarul Yahud Bhasma. One of the very effective for Rasachikitsa in Ashmari is Hajarul Yahud Bhasma, Mukta Pisti, Shanka Bhasmam, Chinchaksharam, Punarnava Manduram, Gomutra Arkam and Gomutra Ksharam, and Gomutra with any of the Anupana Yogas, Vanga Bhasmam, Rasasinduram, Gandhakarasayanam, Mulakaksharam. Gandhakarasayanam is very effective whenever patient is having cholecystitis with cholelithiasis. Ashmari, and whenever there is infection, then fast acting drugs are Rasasindura, Sorana Parpati, Kajjali, Potali Rasayanas, Gandhaka, Kuchala, Malla Prayogas, Vatsanaba, Kirata Tikta and Ativisha. Whenever we give Ativisha Ghanavati, there will be definite reduction of the cholecystitis and inflammation in case of our cases of gallbladder stones. Some of the kalpas to be kept in mind is the Shardharana Yoga, Lashanadivati, Sanjeevanivati. One of my favorite in government medical college prescription is always Sanjeevanivati, which is available. It is having 2 Vishadravyas, so that is effective. Gugulu Panchapala Chulna from Bhagandara Roga Chikitsa, Gomutra Haritaki. There is no failure for Gomutra Haritaki in Pittashaya Ashmari or Mutrashaya Ashmari. Gokshiradi Gugulu, Punarnamadi Gugulu, Shilajita Gugulu, Panchatikta Gruta Gugulu, Sudarshana Churnam, Sudarshana Kashayam, Sudarshana Phantom, Vangeshwara Rasa, and Suvarna Bhasma. Some of the very easy treatment is Aragyavardhini and Gandhakarasayana becomes one of the promising OPD prescriptions. Aragvadadi Kashayam, Sukumara Kashayam, Varnadi Kashayam, Mahasudarshana Kashayam, Panchatikta Kashayam, Punarnavashtaka Kashayam, based on the Shota, based on the Jora, based on the vomiting, based on the Udavarta, based on the Gulma. The Samprapti Vikatanurupi Chikitsas can be selected. One more trial what I have done is on Tilanala Ksharam. Tilanala Kshara is effective in both cases of Pittashaya Ashmari and Mutrashmari, Falatrikadi Kashayam, Arkalavanam, Narikela Lavanam. When patient is having Amla Pitta Pradhana Lakshanam, Narikela Lavanam, and breaking the stone in case of gallbladder is Kokilakshaksharam. These are very effective Kashaya Kalpanas. Kimshuka Kshara Bhavita Pippali, one of the trial we have done, which is very good Rasayana. Vardhamana Pippali Rasayana should be given when patient comes down with pain in gallbladder colic or renal colic. Vardhamana Pippali Rasayana, which is Pliha Udara Vinashanam, Medyam Brahmanam. Haritaki Rasayana, one of the best Rasayana should be chosen for prevention, curative, prophylaxis of Ashmari Chikitsa is Doshanulomanam, Gulmam, Udavartam, Grahanim, Dosham, Anaham, Arochakam, Udaram, Kamalam, and Shvaitum, Angava Sadanam, Madam, Rudrogam, and Sroto Vibandhanam, Sarvaroga Prashamanim, Balapradam. Whenever stone is blocked, Haritaki Rasayanam, Haritaki suitable Anupanam, Sindutta Sharkara Shunti, Kanamadu Gudai Kramat. This Rutu Haritaki Rasayana can be used with the Haritaki. Shilajitu Rasayanam, Vatapitte, Shleshmapitte, Kafe, Shilajitu Vati or Shilajitu Rasayanam can be given. Aindra Rasayanam, Na Krutya, Na Visham, Na Ruk, Na Gulma, Pliha, Purano, Vishamajwaraha. This Aindra Rasayana is very effective when patient is having Garavisha Prayoganam. Some of the Krutya Prayogas, Abhichara Prayogas, Panchaharitaki Prayoganam, Chavanaprasham. Chavanaprasha is Uro Roga Haram, Mutra, Mushka, Doshan, Apakarshayati, Pawananulonam Kareti. Kulatha is a fantastic drug. Ushnam Katu Kafavata Haram. It is Ashmari Vedanam, Shotagnam, Medaharam, Svedopagam, and Kulatta is one of the drugs in Punarnavadi Taila, Agurvadi Taila, Dashamuladi Gruta, Dhanvantara Gruta, Kola Kulatta the Churna. Whichever Kola Kulatta the Churna is used for Advartana, if you apply as Lepa or the gallbladder area, it is Sarvamayantaka Grutam, Dvi Panchamala the Grutam. This Dvi Kamsa Haritaki, which is told in Shota Roga Adhikara, Kamsa Haritaki reduces the sludge in the gallbladder. And whenever there is hydro ureter, whenever urinary stone is blocking hydroureteronephrosis, then this Kamsa Haritaki Prayoga is effective. And also Patola Muladi Kashayam. it is one of the Shodhana Kashayam should be given for reversal of urinary bladder or gallbladder diseases. And Harita Samhita makes so many Kulatta Prayogas, Kulatta Yusha, and Baladi Kwata, Baladi Taila, Baladi Yoga, Kulatta Adikwata, and even Kulatta is effective in Raja Taila, Kulatta Adi Taila, Bilvadi Grita, and so many Kulatta Prayogas, Sedopaka Mahakashaya. In all these conditions, Kulatta has come. And Kulatta is very effective because of its only side effect Amla Pitta is there. If you are able to manage that, Kulatta becomes one of the promising take-home message that Kulatta is a food, Kulatta is a medicine for Pittashay Ashmari and Mutra Ashmari. Nari Kela Lavana, one of the drug which every Vaidya should manufacture in his OPD level or in household level is Nari Kela Lavanam. This Nari Kela Lavana, Arka Lavana, and these two Lavana Kalpas are also very effective in Ashmari Prayogam. One of the commercial product available is Pitta Rechaka Kwata and Cholenorm product. If the gallbladder stone size is lesser than the common bile duct diameter, these drugs are very effective. Mutrala Kwata with Shweta Parpati is also very common prescription in market. And Nari Kela Lavana and Arka Lavana. If you want to dissolve the Amla Pittam, Gulmagata Rogam or Udavartam, and then renal colic or gallbladder colic, these two Lavana Kalpas are very effective. Sharapunka Akshara, in one of my clinical study, we have noted that fatty liver and early cirrhosis, gallbladder stones, cholecystitis with splenomegaly and hepatomegaly can be treated alone with Sharapunka Aksharam. This clinical trial I will show in the last slide. And one of the Rasayana I do Prayoga for prevention, curative and prophylaxis of any Ashmari, solidification and Mutra Sangha dosha, Pitta Sangha dosha is cytocryal 80. An anti-cancer drug can be used for prevention of gallbladder sludge converting into cancer. Why cholecystectomy is done by modern doctor is gallbladder stone with sludge can convert into cancer. To prevent that, cytocryal 80, one of the drug can be used. There are so many acupressure points. You can do Vidya Karma, Siraveda Karma, and Raktamokshana Karma in this foot position. In the foot, if you do, there is a liver point, stomach point, gallbladder point, and urinary bladder point. Simple Vidya Karma, Siraveda Karma, Raktamokshana Karma can be done in these points. With this one clinical report, I will conclude my talk. You can see one of the patient who was treated with Sharapunka Akshara. Before treatment, patient was having cholelithiasis. The size of the cholelithiasis was 17.3 centimeter liver size, 8.6, 7.6, 7.4. They were actually bigger size. Whenever the gallbladder calculi size is more than 6, there are risks. 3 to 4 mm and 5 to 6 mm gallbladder calculi you are able to treat. And when we treat this case with acute cholecystitis with cholelithiasis, with mild hepatomegaly, with grade 1 fatty liver was there. After treatment with Sharapunka Akshara, cholelithiasis was observed, but no cholecystitis, grade 1 fatty liver was there, liver enlargement decreased, and calculi size came down from 8.6, 7.6, 7.4 to 3 to 4 mm. So with one course of Sharapunka Akshara Prayoga, you are able to reduce 50% size of gallbladder calculi. Mutrashmari Chikitsa is very easy if you manage the pain with modern drugs, and urinary colic if it is managed with analgesics drug. Ayurvedic treatment for Mutrashmari Chikitsa is very easy. When compared to gallbladder calculi, you have to treat, main treatment is Abhyantara Shodhana, Medahara, Pachana, Shotagna, and Pitta Virechanam, Pitta Sravanam. Katuki is one of the Pradhana Rasayana for gallbladder calculi, Panchatikta, Gomutra Haritaki, and Kimshuka Kshara. And you can see that in one course I have given, further study is going on, 6 to 8 months line of treatment is required. This female patient was recently diagnosed as diabetic, hyperlipidemia, obesity, along with that she was having gallbladder calculus. Now patient's diabetes is under control with Phalatrikadi Kashayam, and when patient's obesity is reduced only with oral drug, we have given Pitta Rechaka Kwata with Shweta Parpati, and patient is having Sharapunka Kshara, and Kshara Prayoga is 250 milligram 2 times a day or 250 milligram 3 times a day usually we prescribe. With this, I conclude one of the clinical before and after treatment trial of a patient. With this, I am thankful to Chairperson and all the organizing committee member and Dr. Giridhar Kaje and all his organizing partners for giving me an opportunity. Thank you. Namaste.
Thank you so much, Dr. Madhav Degavi, sir. That was very informative session on the topic which you have covered. Thank you so much. Now I would like to call upon the next speaker, Dr. M. Gopi Krishna Ballari, on the topic CLD and liver cirrhosis. Welcome, sir, and over to you.
Good afternoon to one and all. Shri Gurubhyo Namaha. We're going to start this session, and I'm asked to speak about the chronic liver disease, liver cirrhosis, and eventually the stages manipulates into liver cancer. And that's end stage liver disease, which is making this phenomena to happen. Salutations to the God, because the things look too big, but if you have a potent medicine like that of the Rasa Shastra, the things are highly manipulative. So even though clinically you find the things are too complicated, Bahudoshavastha, by using Alpamatrasya Upyogitvat, Arucher, Aprasangatvat, Kshipramarogyadaitvat, Aushadebhyadiko Rasaha. So that is how the things will go with. So salutations to the God and acknowledgement to the whole team of Dr. Giridhar Kaje and his organizers for inviting me here and getting introduced to the elite crowd. So today we are going to discuss few of the topics related to that of liver pathology, and especially with that of the liver cirrhosis. We are not focusing on any other aspects, only on the liver cirrhosis and what is it we need to go with. This is all, you have a number of references from the Rasa textbook wherein the Acharya asks us, this is the only part of the sacred science, the Rasa Shastra, where Acharya asks you to take up the complicated and asadhya vyadis. Normally, we are being said like, don't take too complicated cases because the patient might die. You might lose the patient and also your consultation fee. But it is the Rasa Shastra where they encourage you to take up even the asadhya and krichara asadhya vyadis so that you can win over the mrityu status of the patient. So this is one such condition wherein we go with. We need to have many of the questions before we enter into this particular topic called as the hepatic complications or hepatic things related to that of the clinical parameters. So on that grounds, let us try to see what is it we can understand or address few of these questions which every one of us usually pop when you are into the clinical perspective. I'm not going to read all of them because it's directly from your brains when you're treating any of the patient related to that of the liver pathologies. So we'll be going like whether these terminologies are being explained in Ayurveda. Yes, absolutely. You have few of the clinical parameters like you have the Kamala, Kumbha Kamala, Halimaka, Admana, Atopa, Ajirna, Gudagudayana, any of these factors wherein it helps us to identify liver is being identified in many of these srotases. One thing. Second thing is liver is also been identified by our acharyas in the name of fibrosis, either in the form of where you have the ekrutodara or plihodara where you have an enlargement, or cirrhosis like a clinical conditions is also been enumerated. And of course, in the complication stage of many of the disorders, ekrutodara is being explained. So this is the reason we'll try to go with how to tackle or how to address the situations related to that of the liver cirrhosis or chronic liver disorders. So the another question comes is, this is related to the Rasava Shrotas, Raktava Shrotas, and also to the Annava Shrotas. Just because of the reason Rasa and Rakta together, Raktava Shrotasa Moolam is Ekrut and Pliha. So Pliha and Ekrut are being involved. Annava Shrotas just because of the reason liver is considered as one of the Koshtanga. So whenever you have the situations of these kinds in your patients or in your clinical purview, you need to tackle these three Shrotases at an outset. So try to focus on them so that the patient condition has been well addressed. So here we have to consider, because it is a Koshtanga, try to give more emphasis on the Parpati Kalpanas, because many times it has been somewhere thought of to give the Parpati Kalpanas only in conditions like acid peptic disorders, something what you name it as a Parinama Shula or Amla Pitta. But really, because it is into the Koshtanga, this is one of the wonderful thing where we give, including the hepatic abscess, where you have the cirrhosis or chronic alcoholic or non-alcoholic liver disease as a complicatory stage where you have a liver abscess like clinical pathologies also. Sarveshwara Parpati is one such Parpati. The reference from the Rasaratna Samuchaya is an excellent choice which can be given in all these patients. So, as I said, it is related to all the multiple shrotases, and few of the common prescriptions which we usually give in the patients, like you have this Arogyavardhini, Tamragarbha, Potali. Of course, I use lots of Potali Kalpanas in my practice. You can take the basmas of the respective kind, or you can definitely choose with the Potali Kalpanas, whatever is been available to you. In end stage cirrhosis or liver disease, we definitely go with the Hemagarbha, and I administer to 8 grams per month. And better is with the Tamra Prayoga or Tamra Garbha. Tamra is one of the almost something like hitting the bullseye in all sorts of the liver disorders, for me being into the Rasa practice. Along with that might be Anupanam. I can choose something as Kumaryasava or something which is almost like can be given right from the stage 1 to the last stage of the cirrhosis formation. We'll go through them. As you can see, normally in all these conditions, might be it is the first stage of the liver complications to set in. The person represents clinically, might be it's a Chaya or Prakopa state. You need to plan up with few of the Rasa medicines at this particular stage. This is all the classical references to increase the Dipana and Pachana, because you know liver is one of the metabolic factory of the body. You need to encourage it by giving the medicines which can do this Dipana and Pachana phenomena. And Rasa Shastra is one such science which can definitely adore a lots of Dipana and Pachana quality because of its Samskaram Gunantaradanam. The way how you have prepared the bhasmas is because you have given multiple putas. By giving Agni Sanikarsha, the Agni Tattva is becoming an essential component in all the bhasmas. That is the reason we need not much take the consideration of the Koshta Agni in treating any sort of patient, including the liver disorders when we are treating with Rasa medicines. Just because of the reason, the Dipana and Pachana quality is always an inbuilt criteria for us. These are the classical references with chapter name, sloka names, and also even the textbooks. The references where Acharya is asking us to prescribe all these things in these clinical criteria. These are Dipana, Pachana, Shrotodushti Chikitsa. Normally these patients with the liver pathology start clinically with Aruchi like clinical presentations. These are the set of drugs indicated as per the various textbooks. Chardi, this is another phenomena. Normally in all these hepatitis cases and all, you find this Chardi also a clinical presentation. Shroto with the Chikitsa, like you have the Shula, you are supposed to give them with these things. Once you set in with administering them with Tamragarbha, Arogyavardhini, like drugs, the patient might not need any other supporting medicines. Might be a bit of Kumaryasava as an Anupanam to some 5 ml or 10 ml once or twice a day. Admana, this is also another presentation in all these stages of liver disorders to address the issues. So you can go with the Rakta Pitta Chikitsa, Rakta Srava Chikitsa, Virechana and Upavasa. This is also one of the criterias can be taken based on the Shrotas. Just because of the reason people suffering from the liver disorders tend to have the bleeding tendencies. Like you have the portal hypertension, esophageal varices, where the patient might have hemoptysis, the patient might have melena. There are so many clinical conditions where it has to be addressed with. Promisingly to speak about, they definitely have a tremendous response in administering with the drugs of these kinds. Very commonly, I use in my patients with the esophageal varices because of the complications of the cirrhosis or the liver parenchymal disease. In the patients with the portal hypertension as well, in many times is the Pravala. Pravala Pishti or Pravala Garbha Pottali along with Arogyavardhini and Punarnavadi Mandura is an excellent choice to balance the patients to a very significant level, and they do respond very well in most of these conditions. To arrest the bleeding, the patient has already had a varicose and it is started to bleed because of the perforation or rupture of the esophageal varices or because strong melena. We immediately start them with Chandrakala rasa, but normally what I do in my clinical practice is I take Chandrakala rasa, convert it into Pottali form and give it to the patient. It's up to you people, because more and more Gandhakajarana, deep will be the penetration of the drug. That is the reason why I convert Chandrakala rasa into Pottali Kalpana and then I administer it to my patient, which has a promising response in all such complicatory bleeding tendencies. Might be you shelter it under the topic called as Raktapitta. Anyway, classical textbook gives you lots of references. Once it is said to have the having any of the ischemic changes in the gut, or you have a portal hypertension in the gut where it is having lots of variations, or the portal hypertension is not into the response, we are also giving Basma Bastis, where we are using Gairika Basti is being given to the patient with any of the Thailas or any of the Kashayam, whatever you find it is appropriate for that particular patient. We do give even Pravala Garbha Pottali as a Picha Basti. We give them Gairika Basti just to see that all these intestinal bleeding tendencies are being arrested, because the textbook asked us to prescribe it in this particular way. This is a reference from Rasaratna Samuchaya, 3rd chapter. Similarly, bleeding from the various zones of the body, we have the references from the textbook of Rasa Shastra to explain like what all to be prescribed to these patients. Rakta Vriddhikara, Raktagna set of drugs, Yakrut Rogahara, Kamala and Kumbhakamala. I am not going to read all of them because they are directly from the textbook, so please refer it from the text. Plihagna, associated many times, Plihodara Vinashanam, few of the formulations. This is one such case where we had this end-stage liver disease, liver parenchymal disease in the form of hepatic coma. Cirrhosis as already set in, and this particular patient was given enema with the basmas, like the Hemagarbha and Tamragarbha was given in the form of an enema to the patient. The patient was being declared almost on the deathbed. And see the report of the same patient within a small period of 15 days, the patient liver is also rejuvenated and the result says the liver is absolutely normal. The patient is alive. This patient is alive even today. This is a case report of a patient where we had almost 5 years ago. And this patient is alive even today, having a very good response with the liver parenchymal disease or cirrhosis. This is on hepatic coma because of excess of cirrhosis changes. Hepatitis, normally all the cirrhosis changes, whatever we have, or liver parenchymal disease, what we have, it is primarily because of the hepatitis. Might be hepatitis C or B, which is very commonly seen in India. And here, this is also a case report of a patient before and after treatment, because normally they don't respond. This is something like the virus never go away. It is always together. But even here, Tamragarbha Pottali with Kumar Yasava for a pretty long time had a very good response to the patient with hepatitis B who was a carrier. It's not an acute condition, it was a carrier. So for that particular patient had a good response here. This is during the Rasapujana of the Sarveshwar Parpati, which is commonly given in such liver abscess or end-stage liver diseases or cirrhotic conditions. So Kamala Chikitsa to go with, because there are few of the budding Vaidyas to go stage by stage, we have Vyadi Pratyanikam Snehanam and Santarpanam, Mukhyoshadhi, Lohabasma and its prakaras, Vataja, Pittaja and Kafaja conditions, they are also directly from the textbook. So these are the various prescriptions Acharyas have asked us to prescribe in various conditions related to that of Yakrut Rogas or Kamala-like conditions. These are also different stages or different forms of the clinical purview, wherein we are supposed to prescribe them with few of the prescriptions directly from the textbook. Patyopatya and Rogochitam based on the clinical criteria. Abhishendahara, this is a very significant component for us, because many times the cirrhosis, what happens is it swells and it blocks many of the channels, especially the inferior vena cava, and especially the blood vessels which is into the liver and coming out of the liver, which causes this portal hypertension and esophageal varices. This is the reason why the person will die, not because of a liver disease, but because of the congestive cardiac failure. This is a complication of cirrhosis. So in those conditions, to remove those blocks from the channels, Abhishyandahara, Karavira and Vatsanabha has been indicated by the textbook of Rasatarangini. This is the reason why we are giving them with these drugs, which gives a very good response in the patient suffering from Shroto, Avaroda or Abhishyanda. In these clinical parameters like the hepatic cirrhosis, where it cause might be you take it as a hepatomegaly, or ekrutodara, wherein it is congesting or it is blocking the channels of or the blood vessels of the patient's body. Agnimandyahara, patient's appetite is usually poor in disorders related to this. So these are the various conditions: Halimaka, Kamala, Kumbhakamala, Pandu. Because Pandu and Kamala we take together, that's the reason why most of the times Punarnavadi Mandura and Arogyavardhini is given together to these patients. Plihagna, Plihodar Vinashanam, Udarapida, wherever you have the patients with the Udara, there we are prescribing them with these drugs. Yakrudrogahara, Tamra, of course, I'll say this is a divine drug. Tamra is a divine drug to be given in all the Yakrut conditions, which gives an extensive response to the patient. And we need is hardly 4 grams per month. Very, very small dosage. We are giving hardly 1 gram per week. So cirrhosis, what we call it as, it is just a scarring or a fibrotic changes. And when you find these patients of these kinds, this is all the stages of the illness where it is easily indicated, and the formulations which we usually give here are the Tamragarbha, Arogyavardhini and Ekrit Plihari Loha. This is also another combination which can be given in these patients where they respond really tremendously, including the ascites changes, because sometimes what happens even in cancer patients, they have their primary or secondaries in liver, they have a clinical presentation as cirrhosis associated with ascites also. In those patients also this prescription will definitely work with. This is a most important phenomenon to us to understand the stages of this liver cirrhosis. We have where we have the no varices and ascites, what we have already said, Arogyavardhini with Punarnavadi Mandura is sufficient. Where we have the stage 2, where we have the varices, but there is no ascites in stage 2, where it is a compensatory cirrhosis. Arogyavardhini and Punarnava is definitely useful, but one thing we have to add here is we need to start up with the Tamragarbha here. We don't have choice like allow the patient to go to the stage 3. Prior to that, you are supposed to prescribe them with Tamragarbha so that the patient is back to the normal at the earliest. Don't take risk of the patient in this particular stage. The stage 3 where the patient is having ascites and varicose veins. Here we start even with the Pravalagarbha, Tamragarbha to the patient, and the reason for the ascites is to be analyzed. If it is alcoholic liver disease, then it is a separate phenomena where we give the Vishagna set of drugs. Where it is non-alcoholic liver disease, if it is drug-induced, then we need a Vishagna Dravya. In case if it is because of the hepatitis, like clinical conditions as a history of the patient, then the protocol is only Tamragarbha and Kumaryasava. But for addressing the ascites, Punarnavasava or Punarnavadi Mandura is an excellent choice. Along with that, we are giving to the patient Anupanam as a Nilgiri Thailam. Nilgiri is one such drug which gives an excellent response in healing the ascites or the fluid in the abdomen, which is given in small dosage form diluted in water, and it is made to the patient to drink. But one problem you have is the patient will have mild gastric irritation by administration of Nilgiri. So in case if the patient is able to compensate with it, or you are able to balance it by giving him with some drugs like Pravala Panchamruta, etc., this is an excellent choice. The stage 4 is where you have the bleeding and ascites, which is a complicatory stage. Here, what I said already, the same phenomena as the Chandrakala Rasa, Hemagarbha, Tamragarbha, Kumaryasava, Arogyavardhini and Punarnavadi Mandura are the prescriptions to be given here. We had patients in all the 4 stages. All the 4 stages patients had very good response, being managed only with the medicines at the OPD level. I just run up a clinic. I don't have even IPD practice. But still I'm able to maintain the patients very well with no IP support. So this is very much possible and which is very much needed for we people. The very first stage what we see in case of the stage 1 as a steatosis, where I said Rajata, Pravala and Trifala is also a combination which we usually give in these patients. The stage 2 or the scarring where it is being observed in the liver, where we go for the Loha Basma or Loha Garbha and Pravala Garbha. Similarly for the cirrhosis, Tamra Garbha, and stage 4 is Hiranya Garbha and Tamra Garbha or being prescribed through. This is the stages of the cirrhosis, what you can see with in the patient. Clinical presentation of the patients suffering with the cirrhosis. Vranaropana and Vranagna is very much needed where you have for the healing because it's a fibrotic organ. Fibrosis occur very quickly, but it is a friable organ, so it can rejuvenate faster. But you need a supporting drug like this to be prescribed for encouraging its healing properties. In case if it is neglected, the patient will have more clinical complications of these kinds in respect to male and the females. These are other conditions which is very rare in India, but still these are the other conditions where we have cirrhosis. The patient might land up into cirrhosis because of this. There are few metabolic disorders, there are few autoimmune conditions, there are few other criterias. As you can see, autoimmune hepatitis, congestive heart failure, rare diseases like amyloidosis, even they can present clinically as cirrhosis, but the treatment is the same. Portal hypertension, as I already said, very commonly seen in these patients, where we give Pravala, which is very significant. These are the blood investigations which can be given in all the patients suffering from these disorders. The routine investigations. There are few of the sonological investigations and of course biopsy. This is also quite important for us to treat with these patients suffering from it. This is a case report of end-stage liver disease being treated with Ayurvedic managements. This is the eventual reports of the patient. The patient is survived. This is another case with CA liver parenchyma since 2 to 3 months. These are the reports of the patients treated as CA liver. Thank you. Thank you very much.
Thank you so much, sir. That was very informative scientific session. Thank you again. Now I would like to request Dr. Prasannayan Rao, sir, to sum it up and give insight. And I request all the speakers on the stage, Dr. Upendra Dikshit sir and Dr. Madhav Diggavi and Dr. M. Gopi Krishna on the stage. And over to you, sir.
Yes, I understand many of you feel hungry after having Rasaushadhi, right? I don't know. Actually, I was not supposed to chair this session. And I was asked to chair this session. I found all three speakers, the topic what they spoke are very close to my heart. The first one, the cancer. Now, throughout my post-graduation, I did work on the same, and even after post-graduation, about 5 years, I worked in the cancer department, worked on Agni Karma and different levels. Upendra Dikshit, Dr. Upendra Dikshit's the diagnosis and the selection of the medicine, anti-cancer medicines was really appropriate, and I feel it's a big gift for the budding doctors. You know, Ayurveda today, if you make money, and this is only, I think, by these 4 or 5 diseases. One is the liver, another is the cancer, third is the stones, right? Let it be in the urinary tract or the gallbladder. People come to us, it's not Ayurveda medicine is cheaper, but they do come to avoid the surgical approach. And all these 4 diseases, the speakers has shown that it can be managed well with the Ayurveda approach and not necessarily surgery. Dear friends, I had a record. I used to do gallbladder surgery in 8 minutes. In 8 minutes, and 8 surgery per day, and that was my record. Now I treat. That's the 3rd or 4th decade of our practice, and now I realize the gallbladder stones can be treated with a simple medical treatment. What I found in gallbladder stone management, I had been given a gift by Professor Changani, who dedicated his life for Ayurveda, who managed, we call it as Kshar Amla. And this is a concentration, rather saturation of Bida Lavana, Spatika Lavana and Saindava Lavana in lemon juice. And about 15 ml of this Kshar Amla given for about say 45 days, it helps a lot, and it saved many of the patients from surgery. And stone of urinary calculus, akriyayam dhruvam mrityu kriyayam samshaya bhavet tasmad aprachya ishwaram sadhukarina. So it is a deadly disease. It's one of Mahagada, and Ayurveda has great experience. People come to Ayurveda especially for urinary calculus. There are so many examples. Urinary calculus also can be dissolved. Simple, you make a test in the laboratory or at home also. You take a strong decoction of manjeshta and put a stone which is around you. After some time, the stone starts dissolving. So, such prayoga you have to do in the life. This speakers has shown to you, right? You can do such practice. Many of urinary calculus can be easily dissolved, right, by using tamarind juice. Tamarind juice. I have a pathya. I usually prescribe a pathya. Weekly 2 days tamarind juice. Weekly 2 days kulata rasam, and weekly 2 days ashgard juice, and 1 day sugarcane juice. That's Sunday. So many of the higher officers like IAS people has tried this. So this all 4 disorders which has been selected for this session are really wonderful, and speakers has given a lot of tips for you. I hope you have taken the tips and make your practice. Thanks to Dr. Giridhar Kaje for such kind of summit. It's not easy. I have organized so many programs. I understand it, but I thank all of you, right? All of you, you have come from different parts for the call of Dr. Kaje. Thank you very much for the opportunity.
Thank you so much, sir. That was very much insightful. Now we request you to give a token of appreciation to all our scientific speakers. Dr. Upendra Dikshit, sir, thank you for your time. Please take a token of appreciation from Dr. Prasanna Rao, sir. Thank you for your time. Thank you for your valuable knowledge you showed on us. And I request Thank you, sir. Now I request Dr. Prasanna Rao, sir, to give a token of appreciation to Dr. Madhav Diggavi, sir. Thank you for your time and sharing a knowledge with all of us. Thank you, sir. Now I request Dr. M. Gopi Krishna, sir, to take a token of appreciation from Dr. Prasanna Rao. Thank you, sir, for your valuable time. Now I request Dr. Anjanaya Morti, sir, to honor our chairperson, Dr. Prasanna Rao, sir. Thank you, sir, for your valuable time with all of us, and all of us are enlightened. Thank you, Dr. Anjanaya Morti, sir, for honoring our chairperson, Dr. Prasanna Rao, sir. Thank you so much. With this, we have finished our Pawana session. We completed our Pawana session. Thank you, all of you, all the scientific speakers and chairperson, and Dr. Anjanaya Morti, sir, and all of us. All of you, thank you once again. Now we have a quick break on the lunch, and later we are having a case and thesis presentation by awardees, and we request you to come back by finishing the lunch quickly. So we are going to have a session at 3:30. We will have a case presentation and thesis presentation by awardees. Thank you.
Natural causes considered for AUB. Importance of analyzing Shonita Dushti Nidana in Asrakdara. So as we all know, the Shonita is formed by following proper dietary habits, lifestyle, physical and mental activity. If not, the Rakta is going to become Dushta Rakta, leading to different Rakta Pradoshaja Vyadi, and in that Asrakdara is one of them. So Asrakdara will be having different types of presentations like increase in amount, increase in duration, or shortening of interval, or irregularly irregular bleeding. So Asrakdara can be defined as a condition with severe excessive bleeding accompanied with or without menstrual cycle. So as Sushruta in Sharira 2nd chapter says, Tadeva ati prasangena pravrata anrata vapi asrakdaram vijaniyat. So this whole concept has been analyzed under 3 headings: Samuthana Vishesha, Vikara Prakriti and Adhishthanantarani. So before analyzing the Samuthana Vishesha, Chakrapani clarifies that Shonita itself is not the independent cause for Asrakdara. Shonita is just a ashraya for the Tridosha. So it cannot be an independent factor for the manifestation of any Vikara. So in Samuthana Vishesha, when we analyze Charaka Sutra 24th chapter Shonita Dushti Nidana, they have classified it under dietary habits, psychological factors and behavioral patterns. Adhishthanantarani, according to the Charaka Chikitsa 30th chapter, Charaka says, Vata Prakopaka Nidana. When Vata undergoes Prakopa, the Shonita, the Rakta, is going to displace into the Garbhashaya Gatasira. And from there, this Rakta is going to move into the Rajovahasira, where it is going to form as a Raja. And it is excessively eliminated out because of the Vata Prakopaka Nidana. So, Garbhashaya Gatasira and Rajovahasira can be considered as Adhishthanantarani. Vikara Prakriti, so we know excessive menstrual bleeding is called as Pradara, but when the same thing happens out of the menstrual cycle, that can be considered as Asrakdara. So because of this, the systemic features can be seen as Daurbalya, Brahma, Murcha, Tama, Trisha, Daha, Pralapa and other Vata Prakopaka Vikaras. Objectives of my study: critical study of Shonita Dushti Nidana described in classical text, and also to evaluate Shonita Dushti Nidana in Asrakdara. Source of data: patients attending OPD and IPD were collected for the study. Method of collection: a special proforma was prepared with all the questionnaires, including Ayurveda and allied sciences, and laboratory investigations, hemogram, ESR, BTCT, USG if required were collected. Study design: it was just an observational study with 36 enrollment, non-randomized allocation with descriptive statistics. Inclusion criteria: patients were collected between 12 to 50 years of age, having Pratyatma Lakshana of Asrakdara, including abnormal uterine bleeding with localized pathology such as endometrial hyperplasia, fibroid uterus, pelvic inflammatory disease, endometriosis, adenomyosis, HPO axis disturbance, metropathia hemorrhagica, endometrial malignancies, genital infection and coagulation pathology. Patients with HIV, hepatic failure, renal failure and bleeding due to pregnancy were excluded. Assessment criteria: signs and symptoms of Asrakdara and Nidana of Raktadushti in patients. Duration of the study: so this was an observational study, so patients were kept under observation and clinical observation till the completion of the study. Assessment was done based on the Nidana assessment through the questionnaire, and for this the Likert scale was used, and here often and always considered as Ati Yoga of Nidana. This is the pictorial blood assessment chart score analyzed to see the menorrhagia. Scoring were given for the pads, tampons and clots, and the total score more than 100 was considered as menorrhagia. Observation: most of the patients were between 11 to 50 years of age, belonging to Anupadesha maximum. Age of menarche maximum between 12 to 14 years. Bleeding days in the menstrual cycle maximum 11 to 20 days. Consistency of the bleeding watery with mild clots. Samuthana Vishesha: maximum patients didn't had any unhealthy condition in Sharat Ritu. Ahara Janidana: oftenly Ati Katu and Lavana Ahara Sevana, oftenly Guru and Snigdha Ahara Sevana, always Masha, Oftenly, Jalaja Anupa Bila Prasaha Mamsa Sevana, very rarely Pindalu, sometime Mulaka and Harita, never Madhya Sura Savira, rarely Dadhi Amla Mastu, never Shukta, rarely Tilataila, never Upaklina, Puti Bhakshana or Ajirana Bhojana. Oftenly, Divaswapna was identified as a Nidana, rarely Krodha, never Chardivega Pratighata, never Adhyashana, sometimes Krishara and rarely Payasa, oftenly Viruddha Ahara as an important factor, no Abhighata was observed, and maximum patient had Granthi and Adivhamsa as Nidana for the Asrakdara. Vikara Prakriti and Adhishtanantarani, Varna of the Asrak was assessed, maximum patients had Pishitodaka. Gandha, Matsya Gandhi, Guna, Fenila, followed by Snigdha, Sheetala, Bahala, Tantumat, Sasravi, Shleshmalam. Vega, Vegasravi and Brasha Vega was observed. Vataja Lakshana, Kati Vedana and Shroni Vedana, Pittaja Lakshana, Trishna, Kafaja Lakshana, Arochaka, no Sanifataja Lakshana was observed. Vedana, Saruja, Skandana, Mamsa Peshi, Sadrisha, temperature of flow was Sheeta. Dusha Dushti, maximum had Rasa, Rakta, followed by Artava Dushti. The dosha vitiation observed was Kafavata vitiation in this study. So this is the color template developed by me. So what I did was, the dravyas explained for Asrakdara were collected and its meaning was collected from different dictionaries like Monier Williams, Shabda Kalpadroma. Later, those dravyas, color was extracted into water based on the Sharangadhara reference, Bhagi Anuktetu Samyam. So the particular dravya mentioned for the dosha Asrakdara, it was taken, kept in the water for 10 minutes, smashed, and after that the color whatever extracted into water, that was taken in the petri dish. Its photo was taken with a DSLR camera under standard LED light focus in a constant angle, and then its RGB code was noted. Then this RGB code was mixed with the actual red color RGB code using Microsoft PowerPoint program. So this is the template prepared. This has been evaluated under very small target population of 10 and it has been face validated by the experts. So this is for the Pittaja Asrakdara, Neela, Pita, Asita, Harita, Shava. Varna of Pittaja Asrakdara, Grahadumanjanodaka, Gomutraba. Kafaja Asrakdara, Pandu, Gairikodaka, Kovidara, Pushpodaka. So discussion based on Samuthana Vishesha. So as we already know, maximum had Katu Amla Lavana Guru Ahara Sevana, Divaswapna, Viruddha Ahara as Samuthana Vishesha. Vikara Prakriti, maximum we had Vata dominancy, Kapha dominancy. In case of Lakshana, Vata Jashula, Pitta Jatrishna, Kapha Jarochaka, Vedana Saruja, Dushya, Rasarakta and Artava, and maximum patients had Dosha Vitiation, Kapha Vata. So I want to conclude my topic by saying that, so in this study, maximum amount of Shonita Dushti Nidanas have been observed under Asrakdara. Recommendations for the further study can be continued with the further evaluation of Shukra component of Stri, assessment of Janma Bala Nidana in Asrakdara, maximum analysis with a larger population and enhanced investigatory assessment. Thank you.
Thank you, Dr. Silvania Fernandez. Next, I call Dr. Kirtana, PhD scholar, All India Institute of Ayurveda, for her presentation.
Good evening, everyone. Myself, Dr. Kirtana Prasannan, first year PhD scholar in the Department of Shalakya Tantra, All India Institute of Ayurveda, New Delhi. Today here I am before you to present my PG dissertation work, which has been submitted under Banaras Hindu University in August 2024. So my topic was an observational study to determine the association between Deha Prakriti and myopia. I was guided by Professor Manoj Kumar, Professor and Head, Department of Shalakya Tantra, Faculty of Ayurveda, IMS, BHU. And this study has been conducted in collaboration with Dr. Bhavna Prasher, Senior Principal Scientist, as well as the Head of the Genomics Unit, Institute of Genomics and Integrative Biology, CSIR, New Delhi, as well as Professor Deepak Mishra, Professor, Regional Institute of Ophthalmology, IMS, BHU. So, myopia. Myopia is a global crisis nowadays, and currently 2.5 billion people across the globe is currently affected with myopia, with a very high prevalence in Asian countries, where it has now reached like epidemic proportion. And it is also projected that by 2050, almost 5 billion people across the globe will be affected by myopia, including 1 billion high myopes who will be under a risk of vision-threatening complications. And as of now, there is no permanent standardized treatment protocol for this vision-threatening phenomena, and that makes the eyes of the entire world focus on the therapeutic as well as preventive benefits of Ayurveda. So, a brief explanation about the concept of Prakriti. As everyone knows, it is the Ayurvedic concept of individual constitution, and it encompasses the physical, physiological, as well as the psychological dimensions. Specific diseases, we are all well aware that specific diseases show high prevalence in certain Prakriti types, enabling early identification of the health risk, thereby aiding preventive intervention. Prakriti also enables personalized preventive measures through tailored diet, lifestyle, and environmental recommendations. So, coming to the aim of my study, it was to determine the association between this particular Deha Prakriti and the occurrence and severity of myopia. Myopia, I think, as we all know, it is nearsightedness or short sight. The study population, my subjects were enrolled from the Shalakya Tantra and Ophthalmology OPDs of Sir Sundarlal Hospital, IMS BHU, and also from various faculties of Banaras Hindu University. My study population encompassed subjects between the age group of 18 to 25 years, and these subjects were divided into two groups. The case group, that is the myopia group, with subjects with a refractive error of less than 3 diopters, and the second group is the control group, where I enrolled emmetropic subjects, that is the subjects without any refractive error, like the people with normal vision, and also the subjects with a spherical equivalent of less than minus 0.5 diopter, greater than minus 0.5 diopter. For further analysis, the subjects in this myopic group, my subjects, the 104 subjects in the myopic group were classified into these following subdivisions based on the IMI, that is the International Myopia Institute proposed classification into the non-pathologic myopia, low myopia, high myopia, and pathologic myopia. So my sample size, a minimum sample size of 100 in each myopia and control group were proposed, but we enrolled a total of 208 subjects, that is 104 in the myopic group as well as 104 in the control group. My inclusion criteria were moderate to high myopia, that is less than minus 3 diopters, as well as emmetropic subjects, and the subjects with a spherical equivalent of refraction of greater than minus 0.5 diopter and above. And exclusion criteria, unwilling participants, ocular conditions other than myopia, and also ocular conditions which presented changes with ocular morphology. And, the data collection. For the data collection, we collaborated with the IGIB CSIR, the Genomic Unit, headed by Dr. Bhavna Prasher. They have developed the main Prakriti questionnaire, and it included the comprehensive assessment areas of family history of disease, anatomical features, physiological functions, physical activities, strength at different levels, as well as the psychological functions. The data analysis, like using this questionnaire, based on these questionnaire responses, we processed the random forest machine learning algorithm. Basically, we run the random forest machine learning algorithm on these questionnaire responses, and the data were generated, and the output were in the form of scores. Actually, here we attempted to quantify the proportion of doshas. We tried to get in probability scores for the individual doshas. Likewise, we try to quantify the doshas. And coming to my objective parameters, that is the ocular examination criteria, the visual acuity including using ETDRS charts, subjective refraction, axial length, as well as the fundoscopy. Fundoscopy means the examination of the retina of the subjects. So these were the statistical tests that were used. For Pearson's chi-square test for demographic data, Mann-Whitney test for the comparison of the median Prakriti scores of Vata, Pitta, Kapha between the myopic and the control group, and the correlation of the axial length. For the correlation of the axial length, we use Pearson as well as Spearman's rho constant based on the distribution of the data. Wherever the data followed normal distribution, we run the Pearson correlation, and for non-normal distribution of data, we use the Spearman's test. So these were my observation. This is the socio-demographic distribution of my subjects. These were all kept at the baseline. Actually, I ran the stratified randomization approach we had. So the age, gender, things were kept at the baseline. And in the socio-demographic distribution, there was one statistically significant result which literally correlated with the prevalence of myopia. That is, there is a statistically significant difference in the places where the subject grew up. As we can see, there was a significant difference, like most of the subjects in the myopia group had an urban upbringing, which directly correlates with the prevalence of the disease. And initially, based on the prevalence of the individual doshas, based on the scores of the individual doshas, we classified the subjects based on the 7 Prakriti types, but there was no significant difference in the Prakriti distribution of the subjects in either of the groups. So we decided to run a further analysis based on the individual scores for each doshas. There we got some significant results, like high myopic group had a higher number of cases with extreme Vata scores. And so these were my results. There were by comparing the myopic group and control group as a whole, there were no significant difference in the scores of Vata and Kapha in the myopic groups and the control groups, and the median Pitta scores were significantly low. So we further subclassified the groups, and among the low myopic and control group, the median scores of Vata, Pitta and Kapha did not vary significantly. When we compared the high myopic with the control group, the median scores of Vata, Pitta and Kapha varied significantly. Median Vata and Kapha scores were significantly high in high myopia, and also the median Pitta scores were significantly low, indicative of poor metabolic activity. And in the pathologic myopia group versus control group, the difference between pathologic myopia as well as high myopia is that in high myopia, there might be no changes in the ocular fundus, that is retina. In the pathologic myopic group, we used to get degenerative changes in the retina with severe visual impairment. So the median Vata scores were very significantly high in the pathologic myopia group compared to the control group, and it was like nearly double that of the control group. And the median Pitta scores were significantly low in the pathologic myopia group, and the median Kapha scores were also low, but it was not statistically significant. In the non-pathologic myopia and the control group, there was no significant difference between the scores of Vata and Kapha as compared to the control group. So this was the correlation, this was the analysis based on the scores, and the next analysis we run was based on the axial length. Axial length is the anteroposterior length of the eyeball. So it is usually increased in myopic subjects. Myopia is associated with the elongation of the eyeball. Axial length of the eye varied with the proportion of Vata, Pitta and Kapha Prakriti scores in the myopia and control groups. And from both of the eyes of the subjects, eye with the increased axial length was considered for evaluation. And the Pearson and Spearman correlation tests were run on that. So this was the myopia group. This was my correlation scatter plot showing the correlation analysis. In the myopia group, we can see a positive correlation. That means as the Vata scores increase, the axial length also increases. And this is the control score where we can see a negative correlation. And in the high myopia group, correlation between axial length and axial length and the Prakriti score was very high. And in the non-pathologic myopia group, there was no significant correlation. And this is the overall results of my observation. Like, as we can see, in the high myopia and pathologic myopia group, the Vata levels were significantly high and the Pitta levels were significantly low. As well as in the pathologic myopia group, subjects were 61.5% of the subjects had higher Vata scores, as well as 25, minimum axial length were greater than 25.5 mm in all these pathologic myopic subjects, which is quite very high. And my key findings were subjects with severe degenerative changes had a very high axial length and also a very high Vata scores. And based on the correlation analysis of the axial length, it was observed that there was a positive correlation with Vata and Kapha doshas, as well as a negative correlation with Pitta dosha. But in high myopic group, we got a very statistically significant positive correlation between the axial length and Vata. In the pathologic myopia group, although we got a very positive, positive correlation with Vata dosha, it was not statistically significant because this correlation analysis always owed to the sample size. And here in my case, the sample size were low, so we didn't even, despite of having very high scores for Vata, statistically significant correlation with the axial length was not obtained. And these were my conclusion. Deha Prakriti, it is positively correlated with myopia occurrence, suggesting that constitutional characteristics influence the myopia susceptibility. Elevated Vata, higher Vata scores associated with increased risk of pathologic myopia indicates the role of Vata in degenerative changes associated with myopia. And lower Pitta scores linked to pathologic myopia implies the metabolic insufficiency, which also contributes to the progression of myopia. And in the low myopic group, there was no significant difference between the Vata or Pitta scores between the low myopia and immetropia, that is the person without any refractive errors, suggesting that this pathologic myopia and low myopia are maybe different entities constitutionally, that is by Prakriti wise. So Prakriti assessment may guide myopia prevention and management strategies. This is a very baseline study, and we have to build further preventive and therapeutic measures based on these informations. So by integrating Prakriti screening into healthcare practices, it might be possible to create more personalized kind of approaches which are potentially will be more effective in preventive healthcare strategies. Identifying Prakriti and adopting appropriate preventive measures which could prevent the aggravation of Vata and balances Pitta during the very early stages of life could prevent the further progression of myopia as well as delay the degenerative changes, delay or retard the degenerative changes. As effective treatment options are still unavailable and disease progression severely impacts the quality of life, adopting effective preventive strategies based on the Prakriti of an individual could be a significant contribution towards Ayurveda and towards the management of this very highly prevalent refractive error. My study also had a few limitations. These were my limitations, the most important limitation was the sample representation because most of my subjects were students from Banaras Hindu University, which didn't represent the ideal Indian population, as well as the correlation analysis, like I mentioned earlier. No statistically significant correlation between Vata and axial length and pathologic myopia were obtained despite of the higher levels of Vata in the pathologic myopic group because correlation analysis is an output of the sample size. So larger sample size is needed as correlation strength depend on the adequate sample size, and future studies requires diverse population and also larger cohorts. So this was all about my study, and I'd like to thank Professor Manoj Kumar, my mentor, as well as Professor Manjusha Rajagopala ma'am for giving me this opportunity. Thank you.
Thank you, Dr. Kirtana. Next, second place for thesis presentation has been declared a tie with Dr. Sahana and Dr. Manasa for their outstanding thesis work. Now I call upon Dr. Manasa M., Assistant Professor at Sri Sri College of Ayurvedic Science and Research, Bengaluru, to present her thesis.
Good afternoon to one and all present here. Myself, Dr. Mansa M., Department of Kaya Chikitsa, Assistant Professor, Sri Sri College of Ayurvedic Science and Research, Chief Consultant at Ayurnidhi Panchakarma and Wellness Center, JP Nagar, here before you all to present my thesis presentation of post-graduation on insomnia. My title goes as Efficacy of Mamsyadigana capsule and Saraswata Arishta in the management of insomnia disorder, a randomized controlled clinical trial. These are my contents. Under the guidance of Basvaraj R. Tubaki sir from KLE Ayurveda Medical College, Belgavi, and co-guide Dr. Ashwini Padmashali ma'am from USM KLE International, Belgavi Hospital. Coming to the introduction, these days, Ahara, Nidra and Brahmacharya amongst the Trayopastamba, we need to take care that Nidra is one of the prime factor for maintaining Sharirika as well as Manasika Sadvrita, amongst which these days, because of the lifestyle, we are having a bad impact on it. So this becomes the need for the study. Introduction in a gist, sleep is a universal behavior necessary for survival, being one among the Trayopastamba. And these days, for the patient of insomnia, hypnotics used in insomnia has certain side effects. So to avoid them, we need a Ayurveda management protocol. Coming to the need for the study, in present era, because of the stressful lifestyle, many people suffer from one or the other psychosomatic illness. Among that, insomnia is the most common health problem which affects the functions of central nervous system and even other systems. So hence, because of this, 1 out of every 20 Indian who suffers from sleep disorder is in the need of alternative system of management. The chronicity of the disease and the long-term requirement of medication and alternative management with a good safety and efficacy profile is required in the field of sleep disorders. So coming to the review of literature, we all know what is Nidra, defined as Yadatu manasi klante karmatmanaha klamanvitaha vishayebhyo nivartante tadasvapati manavaha. So, human sleep is defined as a state in which conscious awareness of the external world is lost, replaced either by an internally generated world of thoughts, feelings and hallucination, or at other times, a true absence of consciousness. So, when the mind is in the state of fatigue, the faculties become inactive and they retire from their respective objects. As a result, the person sleeps. So, this is a need. Coming to the definition of insomnia, it is something which is defined as wherein there is a problem of initiating and maintaining sleep, and anidra or nidra nasha is an imbalance in tarpaka kapha, sadhaka pitta and pranavayu. Coming to my aim and objectives, aim is to evaluate the efficacy of Mamsyadigana capsule and Saraswata Arishta in anidra, considering it as insomnia disorder. My objectives goes as to evaluate the effect of Mamsyadigana capsule and Saraswata Arishta in qualitative and quantitative sleep profile, daytime sleepiness, anxiety and depressive states in patient of anidra, and also to assess its efficacy over zolpidem in anidra. Coming to the research question, does Mamsyadigana capsule 500 mg thrice a day and Saraswata Arishta 10 ml thrice a day administered was effective in treating anidra for a period of 30 days, with null hypothesis and alternative hypothesis being comparable or not comparable. Coming to the materials and methods, the study was done for a period of 18 months with intervention period being 30 days and baseline 15th and 30th day were the study which was done at KLE Ayurveda Hospital. Coming to group A, it consisting of Mamsyadigana capsule and Saraswata Arishta given for 30 days, 500 mg thrice a day, and group B consisted of tablet zolpidem 10 mg once a day at bedtime. Coming to the diagnostic criteria, it belonged to DSM-V diagnostic criteria, with inclusion criteria being individuals between the age group of 20 to 70 years having insomnia of minimum 3-month duration of either sex and insomnia severity index being greater than 7. The exclusion criteria involve if the person is suffering from any other psychosomatic illnesses to be excluded, and if in case they are on any other medications with a long-term drug dependency. Coming to the consort chart, total number of participants were 50. Excluded were 4 because 3 did not meet the inclusion criteria and 1 had declined to participate. The assessment criteria involved, primary assessment criteria being insomnia severity index, secondary assessment criteria being sleep diary, which is a detailed sleep recording of 15 days each, 3 times. PSQI is Pittsburgh Sleep Quality Index, which included the quality of sleep and the patterns of sleep and its study. And ESS is Epworth Sleepiness Scale, wherein specifically daytime sleepiness was recorded. And DAS included the Depression and Anxiety Stress Scale. SF36 is the Quality of Life Scale, which again consisting of questionnaire of 36 questions, and UKU Side Effect Scale. Coming to the drug procurement, everything was done in KLE pharmacy. Firstly, the raw drug were prepared. Mamsadi Kwata was prepared. After that, it was boiled repeatedly to obtain gunna. After drying the gunna, the capsule was filled. And this, along with Saraswata Arishta, was given for Group A. And Group B, we had given tablet Zolpidem. So these are my authentication reports and analytical reports. Coming to the observation, age-wise distribution of the patients. Highest incidence 64% is seen in the age of 60 to 70. Coming to the gender-wise distribution of the patients. In the present trial, the number of females, 76% is higher than the number of males. Coming to the religion-wise, 96% is recorded among Hindus. Social status, 80% are from the middle class. Height-wise, no significant change. Weight-wise, again, there was no significant change. Coming to BMI, there was no significant change. Coming to systolic blood pressure, no significant change. Diastolic blood pressure, p-value had significant change in diastolic blood pressure. Coming to my results, so we had considered the tests by within the group and between the group by independent sample t-test and pair t-test. So in insomnia severity index, we can see p-value has been marked where it is showing significant changes. The same applies in Pittsburgh Sleep Quality Index, Epworth Sleepiness Scale, Depression Score, Depression Anxiety Stress Score, Depression Anxiety Stress Score, DAS Total Score. So coming to the quality of life, here we have 8 parameters of domain under quality of life to be assessed, amongst which the first one was physical functioning. Then we have role of limitations due to physical health, role of limitations due to emotional problems, energy and fatigue being assessed, then emotional well-being, social functioning, pain, general health, and habitual sleep efficiency. Sleep diary is a complete detailed recording of 15 days, 3 times done in 1 month. Number of naps, number of intermittent awakening was also assessed, and duration of longest nap in minutes followed by sleep latency was assessed. Habitual sleep duration was also assessed, and this is a chart showing what parameters were comparable and which showed a significant change with the p-value. So these are the parameters of quality of life, and here all these parameters wherein we can see which is showing significant change are being marked with a 3 star. Coming to the UKU side effect scale, with respect to group B, we observed total of 5 patients having side effect wherein they were addicted to the Zolpidem and they had the drug dependency, but in Ayurveda intervention they did not face any kind of drug dependency or drug addiction. Coming to the discussion on the results showed that the parameters were comparable in ISI, ESS, DAS scale, also sleep diary parameters except intermittent awakening. Diastolic blood pressure is significant in group A than group B. Intermittent awakening from sleep diary scale showed group A better than group B. Mamsadi Gana capsule with Saraswata Arishta worked on a similar scale as that of Zolpidem in inducing sleep and showed good safety profile with mild daytime sleepiness and drowsiness as observed against the Zolpidem intervention. Coming to the discussion on parameters, ISI was comparable between the group and within the group both significant. PSQI was comparable between the group, within the group both significant. ESS, the sleepiness scale, comparable between the group and within the group, both groups are significant. Same applies for DAS scale. Sleep diary, wherein between the groups significant, for intermittent awakening, only one parameter out of 5, rest all parameters were considered to be comparable. Coming to quality of life SF36, here between the group comparable for all the 8 parameters, within the group both were significant. Emotional well-being was significant in group B than group A. Discussion on probable mode of action of the Mamsyadi Gana capsule. Mamsyadi Gana capsule consisted of Jatamamsi, Ashwagandha and Parasika Yavani, for which the Gana was prepared. All of these proved to have the sedative properties. Is a hypotensive, and being a hypotensive it induced sleep, and it had anti-stress properties. Coming to anxiety scale as well, Jatamamsi had sedative property, antidepressant property, which helped in inducing good quality of sleep. The same as a whole, Quata exhibited antidepressant property by preventing the interaction between the receptors. Jatamamsi actually acted as an antidepressant and had an antidepressant effect. Discussion on probable mode of action of Saraswata Arishta. Saraswata Arishta mainly showed that it had a neuroprotective and memory enhancing properties because of the specific herbs like Shatavari, Brahmi, Ashwagandha, which are present, which indirectly contributed to better sleep. Also, symptoms of Rajonivritti subsided specifically. Saraswata Arishta by Snigdha Guna acts against the Ruksha Guna of Vata Dosha and pacifies it. Also, it acts as a best Rasayana in Shamana medicine, having Nidra Janana action. Coming to mode of action of Zolpidem, it belonged to the class of sedative hypnotics, which are known to induce and maintain good sleep, and it was considered here. Coming to the conclusion, Ayurveda intervention showed better improvement in intermittent awakening. Both interventions produced significant improvement in within the group, including the parameters. But Zolpidem had showed adverse side effects which was there. Coming to the strength, it is a randomized controlled clinical study. No study in Ayurveda with Ayurveda medication compared with modern therapeutic drug Zolpidem had been done before with insomnia, DSM-V criteria. Comparison with gold standard, Zolpidem becomes the strength of the study. Weakness is that it had a smaller sample size with few of the lack of objective parameters. Further scope included that it can be a multicentric study with a bigger sample size, and sleep assessment can be done through polysomnography, actigraphy and EEG with a longer duration, including the endocrinal assessment. These are my references. So I published the article on the same in JAIM under the reference and guidance by my guide, Dr. Basvaraj sir. This is again before going in specific, we had done with only Mamsyadi Gana capsule, after which the Saraswata Arishta was added and the further study was been done. I would like to thank my guide, Kaili College, and also currently Shri Shri College of Ayurveda. Thank you. These are my annexures supporting my study.
Thank you, Dr. Manasa.
Thank you.
I now invite Dr. Sahana Shankari, Associate Professor, SDM College of Ayurveda, Udupi, to present her thesis.
Respected dignitaries, dear delegates, students, and all the general public who have gathered here. Chakshurunmilitam yena tasmai Shri Gurave Namaha. Offering my salutations to the great Guru who opened my eyes and gave me an opportunity to conduct my PhD study in Banaras Hindu University. Giving my salutes to Professor B.M. Singh sir. I take this opportunity to present my PhD thesis work an experimental and clinical study on Swarna Prashana to assess its safety, antimicrobial activity, and its role in immunogenicity enhancing effect after BCG vaccine. Many of the findings were done for the first time, and I take this opportunity to present the same before you. So what are the challenges that we are having? Coming to the introduction, these days our children are suffering from a lot of infectious disorders, and TB is one among the top 10 leading causes of death in India. And the only preventive measure that we have is the BCG, and it is also not claimed to have 100% protection against the tuberculosis. So why I am telling this? I'll be telling later. Then there is drug resistance to the antibiotics, which the children are consuming repeatedly, and there is a lowering of the general immunity in the children. At the same time, we are living in the world of bioterrorism. So any bomb is not required. An organism can kill a nation by affecting the young population of a country. And non-infectious disorders are having their own burden on the pediatric population. And hence, it's a need of the hour to find out some newer solutions to tackle all these problems, to increase the productivity of the nation. And during this juncture, we have a concept of Swarna Prashana. Masat parama medhavi vyadibhihi nacha drishyate shadbhir masaihi shrutadaraha Swarna Prashanat bhavet. Ayushyam mangalam punyam vrishyam varnyam grahapaham masat parama medhavi vyadibhir nacha drishyate. So, the term grahapaham is being mentioned over here, and that itself became a point for us to dig deeper. That is, what is the meaning of this grahapaha? The word graha explanation goes to almost the similar presentations of microorganisms in today's era. So we try to find out, is the Swarna is having any antimicrobial activity? So for that, I'll be coming to the research gap. That is but for this famous popular Swarna Prashana concept, what we lack is the properties of the Swarna Bhasma leading to the different changes in the pharmacological action and safety profile of this Swarna Prashana in the vulnerable population of children, and what is its biological action inside the body. So the main aim of the study was postulated to do the physicochemical analysis in the part 1, antimicrobial study part 2, acute oral toxicity study, that is as per the OECD, that is the international guideline 423, and part 3, that is the cytokine study in the animal model, and part 5, that is a clinical study as a pilot study with a small population group. So what were the findings? So the drug characterization of Swarna Prashana, mainly we did the scanning electron microscopy. So as we can see, the beautiful structure of the gold nanoparticles when they were subjected for scanning electron microscopy. So they were arranged in heterogeneous distribution with rough surfaces, and spherical ball-like structures were present in the scanning electron microscopy. Next, we went to the further deeper analysis through transition electron microscopy, where the same particles upon the treatment, they looked like they were arranged in the polycrystalline nature, and they were incinerated gold nanoparticles, and the histogram, as this graph suggests, that they were belonging to different particle size, and the range, the particle size range from 18 to 11. Okay, so 18 nanometers to 3 nanometers were the range of the particles. So none of the particles were of same size, they were of different sizes. So this is the XRD report of the same Swarna Bhasma, and it showed gold peaks, the pure gold peaks in the Swarna Bhasma. And these were the average particle size, that is 27 nanometers. Then we came into the XPS, that is X-ray photoelectron spectroscopy, which revealed the presence of carbon and then the silver, and then oxygen. Carbon, silver, oxygen, and majorly the gold. So that where the their percentage was also revealed, that is majorly, that is a AU, that is atomic percentage was also seen. That is a carbon, oxygen, gold and silver were present in the Swarnabhasma sample, which was basically procured from the Dabur company. Then coming to the EDAX report, and this report showed the presence of the gold, oxygen and carbon in the same sample of Swarnabhasma. And this is the first time fingerprint of the Swarnaprashana as a whole drug, that we can see the final, the morphological change in the drug structure after getting a FTIR spectra of the Swarnaprashana. That is the red line that is seen over there. It is the Swarnaprashana which is done for the first time. We don't have a Google information regarding the FTIR report of the Swarnaprashana, and it showed that the so many the functional groups like carboxylic, alkyl halide, alkenes, aromatics, alkenes, ketones, carboxylic groups, these were the functional groups attached to the Swarnabhasma. So from this, we can get a preliminary idea of what biological action they can have in future in the cellular level. So the result showed that the single Swarnabhasma had only amines, whereas the rest of the functional groups belong to the fats, carbohydrates and amino acids. So finally, this could be the hypothesis, that is a result hypothesis was drawn. So the first picture shows the agglomerated particles of the Swarna, nanoparticles. When they were triturated with ghee and honey, the particles got evenly distributed and separated, and final biologically active and functional molecule was formed, that is gold nanoparticle at the center, surrounded by the lipids and carbohydrates. This becomes much more biologically acceptable and has more biological action. So that was the result of the drug investigation. Then coming to the antimicrobial study, here we had taken 2 gram-negative and gram-positive bacteria, namely Staphylococcus, Enterococcus faecalis, Pseudomonas aeruginosa and E. coli. Through broad dilution method, we had seen whether the antimicrobial activity of the Swarnabhasma is there or not, because Acharya said grahapaha. So there could be something. When we trace the modern literature, in the modern literature, the synthetically prepared gold nanoparticles had antimicrobial effect. So we thought, why not the Swarnabhasma, which is also having the nanoparticles, why not it show antimicrobial activity? And to our surprise, so we could see the exact dose at which there were no more bacterial growth in the Petri dish where the bacteria were given a feed with the agar. I'm talking very simply over here, not going very technical. So at the dose of 312 micrograms per ml, we can see the complete clearance in the well, whereas in the other picture, at the dose of 1250 microgram per ml, we don't see any bacterial growth in the Petri dish. So we could find out exactly at what dose there was complete bacterial killing. It is not enough that we only sedate the bacteria. If we sedate them, again they will regrow. So that's why we need what is the exact dose at which bacteria are completely killed. So that dose we could find out here. That's the first time it has been done. So in this picture we can see that the first yellow the box is showing the healthy Pseudomonas bacteria, notorious bacteria affecting the children, causing lot of NICU infections, nosocomial infections. So now after it is being treated with the Swarnabhasma, as you can see the bacteria, its morphology has been changed and it is completely dead. Its entire cell membrane is been broken, cellular matrix has come out and it is completely dead. So similarly, the same action was seen with Enterococcus faecalis, Staphylococcus aureus and E. coli. And their picture were also drawn. So as you can see, the first line in the top is the healthy bacteria and the next row, in the below row, as you can see the last picture, there the cell cytoplasm has completely come out and the bacteria is no more viable now. So that is the effect of Swarnabhasma showing its antimicrobial activity on the most notorious bacteria which cause infections in children. So this is a postulate that was drawn. The healthy bacteria, upon the Swarna particle attachment over the cell membrane, the membrane is being disrupted and they enter inside the cellular cytoplasm. It comes out and that it causes the death. So the doses were also calculated. This helps in considering how much dose of the Swarna Bhasma has to be taken to get the antimicrobial activity. Then coming to the toxicity, acute toxicity study. So as we know that on Swarna Prashana, every Pushya Nakshatra, we are practicing the Swarna Prashana. Everybody is telling that it is highly toxic, it is toxic to the liver and the kidney. So we wanted to see at different levels whether it is causing, in a single dose, whether it is causing any toxicity. So we gave the dose at different level, that is first group with only ghee and honey, second group with the 5 mg of Swarna Bhasma with ghee and honey, third group with the 50 mg of Swarna Prashana, and fourth group with 300 and 500 mg of Swarna Bhasma with ghee and honey. And then I will be presenting what will be the result. So this is an animal model. So as you can see, we went on increasing the dose of the Swarna Bhasma in the Swarna Prashana when it is mixed with simple ghee and honey, and this was given to the rats. And we went for the blood investigation, that is a CBC, LFT and RFT. In the CBC, there was no much significant difference. Majorly, what we focused was the alkaline phosphatase and total protein, albumin, globulin, SGOT, SGPT and bilirubin, total bilirubin and direct and indirect. No statistically significant changes were seen even at the very higher dose of 300 to 500 mg of Swarna Bhasma with the ghee and honey. And also we had taken the histopathological reports of these animals who were given a single dose of Swarna Bhasma. So the liver, the heart, lungs, intestine, liver, spleen, kidney, brain and the ovaries were taken and their histopathological changes were seen, and there was no much significant changes were there. So whatever minimal changes were there, that is normally seen in the group which was given only with ghee and honey, that's also there. So it was not a significant observation as commented by the pathologists from the Indian Medical Sciences, Banaras Hindu University. So that's how we concluded that even at the that is as per the OECD guideline, even with a single animal we can do the testing. That is we can take this as a preliminary study and we can go further to extend the study and give it in a scientific manner to the present world. Then this is a very interesting study of cytokine studies. So here we had given group 1 with only ghee and honey, group 2 with the BCG, group 3 with BCG and ghee and honey, group 4 with BCG with Swarna Prashana, that is Swarna Bhasma, ghee and honey. And we saw what is the immunogenicity of the BCG vaccine in different groups. This is an animal model, again done after taking the institutional ethical clearance from the Banaras Hindu University. So the rats number was 4. And this is the BCG and this is the Swarna Prashana that we had given. These were the animals which were fed with the different ghee and honey combinations. This is how we had given the rats the different doses of the different group. And this is the observation that we did. We saw some of the very few markers of the BCG vaccine like TNF alpha, IL-1 beta and IL-6 and IL-4. IL-1 beta and IL-4 had significantly raised in BCG with the Swarna Prashana group. That shows that Swarna Prashana has its role in enhancing the immunogenicity of the BCG vaccine, which is done for the first time. And it can be a future scope for us to try it with other vaccines also. Then coming to the clinical study, here also with the different doses of Swarna Bhasma, we had given that is 5 mg, 10 mg and 15 mg for one continuous month, and then we had seen the LFT, RFT and LFT, RFT changes. No significant changes were seen even after giving the Swarna Prashana for the continuous 1 month. So these were the different parameters like sitting with support, standing with support, etc. Walking with support. Even here, this is a pilot study. Gross motor function of the children who had developmental delay, we had given different doses of Swarna Prashana, pincer grasp, and building the tower of 8, manual function testing, speech delay. Also we had seen eating and drooling habit of the children, language development, hemoglobin percentage, and all these things majorly the LFT and RFT was concentrated. So in that we did not get any statistically significant result. In fact, there was no change in the LFT RFT. So for 1 continuous month, the Swarna Prashana could be safely administered in children. Even up to the dose of 15 mg, there was no creatinine change, urea change in pediatric population. So as a conclusion, so this study has given lot many scope for the further study to come up with the much more population size and give it to the public with the much more scientific approach. So these were the few articles that were published in the Annals of Ayurveda and IJRAP. And thank you for giving the opportunity for me to present my work during my PhD thesis, and also all the animals and the patients who cooperated, and all my family members and my teachers, my institution for this study.
Thank you, Dr. Sahana, for your presentation. Now, before going ahead with the third awardee presentation, we are going for the prize distribution. Prize distribution of thesis presentation and case presentation. So please be ready. After that, we can have a presentation, thesis presentation and case presentation. Now we are having a prize distribution. For thesis presentation and case presentation, let me again call upon all the winners. Dr.
Silvinia Fernandez. Once we'll call all the names, please be ready. Dr. Silvinia Fernandez, Dr. Kirtana, Dr. Sahana, Dr. Manasayam, Dr. Pooja PK, Dr. Kavya Shri, and case presentation winners, Dr. Ranjana Aras KL, Dr. Varani S. Bayuri, Dr. Rajneesh V. Giri, Dr. Sukanya Busari, Dr. Fariha, Dr. Chandu Metri, and all the motivational award winners, Dr. Mamata Shri, Dr. Suketa Kumari, Dr. Saujanya, Dr. Geeta, Dr. Vatsala, Dr. Harita TN, Dr. Monica Singh, and case presentation motivational award winners, Dr. Subhabrata Sarkar, Dr. Kaveri NY, Dr. B. Shivani Shetty, Dr. Bhagyashri Desai, Dr. Sharada M, Dr. Suchitra, Dr. Kavya Kadapi. Please be ready near the stage.
We have our dignitaries, Dr. K.C. Ballal, Dr. Jayaprakash Narayan, Dr. Anup Thakkar, and Dr. Rajgopal to present a prize distribution to our thesis presentation and case presentation. So all the winners, please be ready. The first prize has been shared by Dr. Silvia Fernandez and Dr. Kirtana in the thesis presentation. And the second prize has been shared by Dr. Sahana and Dr. Manasa. And third prize has been shared by Dr. Pooja Peke and Dr. Kavya Shri. So please be ready. You're going to get presented with your prizes. Right now, let me invite all our dignitaries to present the prizes. Dr. K.C. Ballad and Dr. Anup Thakkar and Dr. Jayaprakash Narayan and Dr. Rajgopal. Please come on the stage, sir. We request you to please come on the stage so that with the ending round of applause, we request all our dignitaries come on the stage so that they can present a prize distribution to all the participants. Our dignitaries, Dr. K.C. Ballal, Dr. Basanarumat Rajshekar, and Dr. Anup Thakkar. Dr. Anup Thakkar and Dr. Jayaprakash Narayan. Now we call out the winners in the thesis presentation, Dr. Silvia Fernandez and Dr. Kirtana. We welcome you on the stage for receiving the prizes. With a thundering round of applause, the first prize goes to Dr. Silvia Fernandez and Dr. Kirtana. Thesis presentation, Assistant Professor in Munial College of Ayurveda, Manipal. And she's a PhD. Dr. Kirtana is PhD scholar, All India Institute of Ayurveda. Congratulations to both of you for sharing a first prize in thesis presentation. We request all our dignitaries to hand on the present gift to our participants who won the first prize. Now the second prize winners are Dr. Sahana, Associate Professor in SDM College, Udupi, and Dr. Manasa, Assistant Professor in Sri Sri College of Ayurvedic Science and Research, Bengaluru. We request Dr. Sahana and Dr. Manasa on the stage to receive the second prize in the thesis presentation. Congratulations to both of you. Now I call upon the third prize winners, Dr. Pooja PK, Assistant Professor in Bapuji Ayurvedic Medical College, and Dr. Kavya Shri, PhD Scholar, Kahe Shri BMK Ayurveda Medical College, Belagavi. For third prize, I request you to come on the stage and receive the prize from our dignitaries, Dr. Pooja PK and Dr. Kavya Shri. We also have a motivational prizes for the thesis presentation. We request all the other 7 participants to come on the stage. Dr. Mamata Shri, Dr. Suketa Kumar, Dr. Saujanya, Dr. Geeta, Dr. Vatsala, Dr. Harita TN, and Dr. Monica Singh. We request all the 7 participants to come on the stage to receive motivational prizes for your presentation. Now for the motivational prize for the thesis, Dr. Mamata Shri, Dr. Suket Kumar, Dr. Saujanya, Dr. Geeta, Dr. Vatsala, Dr. Harita TN, Dr. Monica Singh. We request all the participants to come one by one and receive the prizes. Congratulations to all of you. Big round of applause to all the motivational participants. They have done their best participation in thesis presentation. Dr. Mamata Shri, Dr. Suket Kumar, Dr. Saujanya, Dr. Geeta, Dr. Vatsala, Dr. Harita T and Dr. Monica Singh. A big round of applause to all the motivational prize winners. Now I would like to call upon a winners of case presentation. The winners of case presentation, first prize has been shared by Dr. Ranjana Uras KL and Dr. Varuni S. Bairi. Dr. Ranjana Uras KL, Sri College of Ayurveda, Bangalore, and Dr. Varuni S. Bairi, Munial Institute of Ayurveda. And we request our dignitaries, please hand over the prize to our first prize winners of case presentation, Dr. Ranjana Uras and Dr. Varuni S. Bairi. A big round of applause to all the winners. Now we have a winners for case presentation. The first prize has been shared by Dr. Ranjana Uras KL and Dr. Varuni S. Bairi. We have a case presentation winners who is going to receive prizes from you. Thank you, dignitaries, for handing over the prizes to all our winners. The first prize, Dr. Ranjani Uras KL and Dr. Varuni S. Bairi. Dr. Ranjani Uras KL from Sri College of Ayurveda, Bangalore. Dr. Varuni S. Bairi, Munial Institute of Ayurveda, Munial. Congratulations. A big round of applause to both the first winners of case presentation. Congratulations. Dr. Varuni S. Bairi. Second prize winners be ready. Dr. Rajneesh Vigiri, SEM College, Udupi, and Dr. Sukanya Baire. And Dr. Sukanya, second place, JSS Ayurvedic Medical College, Mysore. The second prize has been shared by two participants, Dr. Rajneesh Vigiri and Dr. Sukanya Pusari. We request our dignitaries to give the prize to both of our second winners. A big round of applause again to the winners, Dr. Rajneesh Vigiri and Dr. Sukanya Pusari. The third prize, Dr. Farina, STM, Bangalore, and Dr. Chandu Metri, Associate Professor in Sri Krishna Ayurvedic Medical College, Sankeshwar. We request the third prize winners, Dr. Farina and Dr. Chandu Metri, to come on the stage and receive the third prize for your case presentation. Fariha and Dr. Fariha and Dr. Chandru Metri. Congratulations to both of you on winning the third prize in case presentation. A big round of applause to the winners. Now we have a motivational prize for the case presentation. Dr. Subhatra Sarkar, Dr. Kaveri NY, and Dr. B. Shivani Shetty, Dr. Bhagyasri Desai, Dr. Sharada M, Dr. Suchitra, and Dr. Kavya Kadapi. All of you, please come on the stage and get the motivation prize for the case presentation. And I request all the doctors again, Dr. Subhadrata Sarkar, Dr. Kaveri NY, Dr. B. Shivani Shetty, Dr. Bhagyasri Desai, Dr. Sharada M, Dr. Suchitra, and Dr. Kavya. We request all of you to receive the prize from our dignitaries. A big round of applause to the winners. Now we'll have a photo session with all the winners, with the dignitaries. All the prize winners, be near the stage only so that we can have a photo session together. All the case presentation winners, please be near the stage so that we can have a group photo session together. Please be near the first prize, second prize, and third prize winners. Please be near the stage so that we can have a case presentation, photo session of the case presentation winners together. After this, soon we are going to start our next session, that is Jivana session. So after this, after the Jivana session, we are going to have a remaining case presentation and thesis presentation awardees. Now I request all the prize winners of case presentation, after receiving the motivation prizes, I request all the case presentation awardees to come near the stage and take group photo with the dignitaries. Congratulations to all of you. A big round of applause to all the winners. All the case presentation winners, please be near the stage so that you can take a group photo with the dignitaries. Congratulations. All the prize winners, please come near the stage so that you can take a group photo with our dignitaries. Thank you for your time and doing a prize distribution to all the winners. A big round of applause to all the case presentation winners. Now after this we are continuing a thesis presentation. The third prize winners are going to present a thesis presentation. Please be ready. Dr. Pooja PK and Dr. Pooja PK and Dr. Kaveshri, please be ready. After this, after the dignitaries. Thank you all the dignitaries for giving a prize distribution to our thesis and case presentation winners. Thank you. Thank you for your time. Now we are going to start our thesis presentation. Third prize winners are going to do the thesis presentation, Dr. Pooja PK and Dr. Kavyashri. Now I would like to call upon Dr. Pooja PK to come for the thesis presentation. Please be ready. Thank you, sir. Thank you so much for your time, for giving a prize distribution to our thesis and case presentation winners. Thank you for your time. Now I call upon Dr. Pooja PK to do the presentation. Over to you.
Good evening, all of you present over here. Myself, Dr. Pooja PK, Assistant Professor, Department of Panchakarma from Bapuji Ayurveda College, Chellakere, Chitradurga district. My thesis presentation topic is Advancement of Upanaha Sveda as instant Upanaha mix and its effect in the management of Katigraha under the guidance of Dr. Muralidhar P. Pujar sir, the Professor, Department of Panchakarma from SDM College, Hassan. These are the contents of my slide. Research question, whether the advanced Upanaha Sveda as instant Upanaha mix is effective in the management of Katigraha. The hypothesis, research hypothesis is instant Upanaha mix is effective in the management of Katigraha. Null hypothesis is instant Upanaha mix is not effective in the management of Katigraha. The two main objectives of my study is advancement of Upanaha Sveda as instant Upanaha mix and effect of Upanaha Sveda in the management of Katigraha. Need for the study, as everyone know, low back pain is major disease that everyone facing in everyone's life. The symptoms of low back pain are similar to the signs and symptoms of Katigraha. Upanaha Sveda is the treatment modality that is adopted for Katigraha. And the one more need for the study is step by step preparing Upanaha is more time consuming, approximately 15 to 20 minutes. Quantity and ratios of drugs while preparing Upanaha each time will vary and it may affect its efficacy. For minimizing the time taken for its preparation without compromising its effect and to make it convenient, cost effective for the patient, here as an effort has been made to develop as Upanaha in the form of instant Upanaha mix. I have conducted 3 pilot studies. Trial 1, prepared Upanaha paste, I have added carbopol powder, and trial 2, prepared Upanaha paste, I added carbopol gel. Then trial 3, Upanaha churna, added carbopol gel. Among all the 3 trials, I preferred trial 2 because I got homogeneous mixture, where trial 1 and trial 3 I didn't got homogeneous mixture. So methodology under 3 headings: pharmaceutical study, analytical study and interventional study. Coming to the pharmaceutical study, collection of drugs, authentication of drugs, preparation of instant Upanaha. These are the drugs that I have taken for the study: Rasna, Atasi, Kushta, Devadaru, Haridra, Danyamla, Chincha Rasa, Nimbu Rasa, Murchita Tilataila and Saindavala. Collection of drugs were done from Anamaya Herbals and Chemfest Pharmacy, and these were the attachments regarding that. Authentication was done from Dravyaguna department SDM College, Hassan, and preparation was done in teaching pharmacy, SDM College, Hassan. This is the authentication certificate. These are the ingredients that I have taken in quantity wise. Preparation of instant Upanaha mix under 3 heading: Purva Karma, Pradhana Karma and Paschat Karma. In Purva Karma, I prepared Chincha Rasa, Nimbu Rasa and Carbopol gel preparation. In the Pradhana Karma, preparation of instant Upanaha, and in Paschat Karma, packing and labeling was done. Preparation of Chincha Rasa. I have taken 12 kgs of Chincha and added with 24 liters of water. I got 20 liters of Chincha Rasa. The yield was 55.5%. Then extraction of Nimbu Rasa. 50 medium-sized lemons were taken. I obtained 1.1 liter of lemon juice. After filtering, I got 1000 ml. Then preparation of carbopol gel. I took 1 kg of carbopol powder added with 18 liters of Danyamla and Chincha Rasa. I was about to get 20,400 grams of the mixture, while I got only 15,500 grams. The total yield was 75.9%. The Pradhana Karma, that is preparation of the instant Upanaha mix. First step, Tilataila was added around 1.2 liters and sorted for 3 minutes. And after step 2, I added 10 kgs of Saindalavana and sorted for 10 minutes. Step 3, after that, I added all the churnas like Atasi, Devadaru, Rasna, Kushta, Haridra. Then subsequently, I added Dravadravas like Danyamla, Chincha rasa, Nimbu rasa and mixed it properly to a homogeneous mixture. Step 5, after post cooling, like that is next day, I added 15.5 kgs of prepared carbopol gel to the mixture. Step 6 was the obtained mixture again heated for 5 hours in lower flame. Step 7, on post cooling I added PEG 400 100 grams, 327 methyl paraben which is a preservative and 600 ml of lemongrass. And Paschat Karma packing was done with using aluminium silver foil pouches. Totally I have prepared 258 packets measuring 200 grams of instant Panaha mix. This is the permission was taken to keep my research medicine in the dispensary. Totally I took 61,728 grams of all the materials where I obtained 51.84 grams of total Upanaha mixture. The yield was 82.7%. Discussion on preparation of instant Upanaha mix. Chincha rasa was obtained by adding soaking chincha in water overnight and it was extracted. 3% of carbopol is used to formulate the gel. After adding carbopol gel, it makes the liquid too much liquid in state. So, which may be because carbopol is unstable in salt containing formula. Hence, mixture was heated till required semi-solid consistency attained. Then estimation of expiry date based on pilot study, I estimated it as 25 months. According to Drug and Cosmetic Act 1940, Rule 161B, Ayurvedic formulation shelf life list, the shelf life of Lepa and Malahara is 3 years, which can also be considered. These are the cost estimation. Total cost for the preparation of instant Upanaha mix is 16,091 rupees. I prepared 258 packets which cost 62 rupees per packet. Analytical studies like organoleptic characters, pH and loss on drying was conducted, and it was conducted in teaching pharmacy, SDM College Hassan. Organoleptic characters, colors was brownish yellow with characteristic odor which is semi-solid paste. pH was 3.16, loss on drying was 54.5%. Discussion on analytical study, loss on drying was 54.5, which suggests that the formulation is having high moisture content, hence this does not need addition of liquid prior to the application at the site. So pH was 3.16, which is acidic in nature. The acidic mantle is key to skin's protective barrier. So interventional study, it is a open label single arm interventional study. It was done in place of the study was STM College Hassan. Source of participants were taken from OPD and IPD, Department of Panchakarma, SDM College Hassan. Method of sampling is convenient sampling method. These were the CTRI number and ethical committee clearance. 34 were screened. Among them, 31 were included, 1 was dropout and 30 were completed. So these were the diagnostic criteria: pain in low back, tenderness over lumbar region, stiffness, restricted movements of spine. Low back pain and tenderness over lumbar region is necessary diagnostic criteria that participant must fulfill. These are the inclusion and exclusion criteria. Assessment criteria, subjective parameters like Katishula was assessed by Oswestry low back pain score. Objective parameters like Stamba, Kriyahani, Sparsha, Sattva was assessed by Scobus test, flexion and tenderness scoring respectively. Assessment of Svedana was done daily basis with the help of Samyak Svinna Lakshanas. Intervention: 30 diagnosed case of Katigraha were intervened with instant Upanaha mix. Total duration of the study was 15 days. The treatment given for 7 days. And assessment was done on first day before treatment and 7th day and 15th day after treatment. Then operative procedures were recorded in the following steps like Purva Karma, Pradhana Karma and Paschat Karma. In Purva Karma, skin sensitivity test was done. and after that application, that is Thanika Abhyanga was done. In Pradhana Karma, the packet containing Upanaha Sweda is kept in hot water for 5 minutes, and then it is applied over the lumbosacral region with measuring of 2.5 mm thickness. Then it is covered with banana leaf, and bandage was done with roller bandage, cotton roller bandage. Paschat Karma, advise the participant to remove the Upanaha mixture after 6 hours. These are the observation on Samyak Svinna Lakshana. Almost all Samyak Svinna Lakshanas like Sita Uparama, Shula Uparama, Stamba Nigraha, Gaurava Nigraha were attained on 5th day, whereas Roga Prashamana was attained on 6th and 7th day. Observation and discussion on result. Collected data were tabulated and analyzed using appropriate statistical data with for ordinal data, Fredman test and Wilcoxon rank test. Fredman test for tenderness, flexion, SCOBA test and Oswestry low back pain score showed highly significant observation, and Wilcoxon rank test shows significant result from day 1 to day 7, where it is non-significant from day 1 to day 7 to day 15. But clinically it was observed that carry-on effect was observed in the follow-up interval from day 7 to day 15 with reduction in pain score from moderate to minimum. Coming to the conclusion, Upanaha mix is cost effective, convenient for the participant, and it found benefit in managing Katigraha. It shows significant improvement in parameters like Katishula, Sparsha, Sattva, Stamba and Kriyahani. No adverse reactions were found during the study. Research hypothesis is thus accepted. Limitations of the study: difficulty to maintain 2.5 mm of thickness throughout the procedure. Leakage of Upanaha paste makes the participant discomfort. Scope of future studies. Studies can be conducted to find out its effectiveness in other disease conditions. Acknowledgement. I would like to thank Dr. Muralidhar P. Pujar sir, my guide, Professor, Department of Panchakarma. I also thank HOD Ashwin Kumar sir, Department of Panchakarma, Lois sir, assistant professors like Associate Professor Sitaramu MS sir and Shamim Banu ma'am, and also I thank Dr. Govind Sharma sir, Associate Professor, Department of RSBK Department, who supported for preparation of my study. Thank you.
Thank you, Dr. Pooja PK. Now I call upon Dr. Kavyashree, PhD scholar, Kahesh Shri BMK Ayurveda Mahavidyalaya, Belgavi, for the presentation.
Case presentation winners, you also be ready. So you're going to have a presentation after the thesis presentation winners.
Good afternoon, one and all present here. Myself, Dr. Kavyashree. Today I am here for my thesis presentation at 2nd World Ayurveda Summit. Coming to the title of the study, it starts with Efficacy of Jatamansi Arka and Sarpagandha Ganavati in Major Depressive Disorder, a randomized control trial. Here comes the ethical clearance number and CTRI number. These are the author details. Coming to introduction, major depressive disorder is a most prevalent mental disorder where WHO has stated it's supposed to rank first by 2030. In Ayurveda, this could be correlated with Kapaja Unmada. Coming to the pharmacotherapy, escitalopram is the gold standard medicine which is clinically practiced presently. And in Ayurveda, Sarpagandha Ganavati and Jatamansi Arka, the classical medicines are selected for further study. Coming to the review of literature, in the contemporary medicine, the pathogenesis of major depressive disorder goes like this. There will be a mesolimbic dopamine system alteration, further leading to downregulation of dopamine system, further leading to reduced GABA level in the prefrontal cortex, leading to abnormal behavior, further leading to depression manifestation. The management is advised both pharmacological and non-pharmacological techniques. Coming to Ayurveda, whatever the anatomical and functional dysfunction were noted previously could be manifested in the form of Ashtavibramsha Lakshana in Ayurveda. And the same manovikaras, where the major depressive disorder could be correlated with Kapaja Unmada, and mild to moderate depressive condition could be correlated with Avasada or Vishada. Based on this context, Jatamansi Arka from Arka Prakasha and Sarpagandha Ganavati from Siddha Yoga Sangraha were selected for further study. These are the previous research works done. Coming to need for the study, as per the recent evidences, it was found that 3.8% of world population and 45.7 million Indian population are suffering from major depressive disorder, leading to the manifestation of suicidal tendencies, and it is going to afflict various components of a person, may it be mental health, physical health, social well-being, etc. So that paved the way for the need for the study, where the affordability coming to the unfavorable circumstances like poverty, then risk factor being contributing for the major disorders again, and then adverse effects where it could range from a simple dryness of mouth up to cardiovascular events, and sometimes even death led to the understanding of study further, leading to aim where planned for an Ayurvedic approach, looking for or evaluating for a better outcome in patient. Coming to the aim and objectives, evaluate the efficacy of Jatamansi Arka and Sarpagandha Ganavati in major depressive disorder. With respect to objectives, to evaluate this efficacy with respect to depression score, that is Madras score, with respect to quality of life, that is WHO quality of life BREF, and then with respect to sleep profile, that is Pittsburgh Sleep Quality Index. This is the research question and hypothesis. Coming to materials and methods, sample source were selected from IPD and OPD sectors of hospital, procurement of drugs, collection, authentication, preparation.
Science and Research, Bangalore, to present her case. Next, Dr. Varuni S. Bayari, please be ready.
Good evening to one and all present here. Myself, Dr. Anjana, Assistant Professor, Department of Shalya Tantra from Sri Sri College of Ayurvedic Science and Research. Also, I head a center, that is Chirayu Arogya Dhama. I'm a chief consultant there. Today, I'm going to present a case. So, this is on the topic, Ayurvedic intervention in chronic hidradenitis suppurativa, achieving sustained remission, a case report. So hidradenitis suppurativa is due to abnormality of the apocrine sweat glands of the body. Most commonly it is seen in the axilla, groin and in the perineum. So it is characterized by the development of recurrent abscesses which may resolve or discharge spontaneously, forming chronic discharging sinuses. Management includes antibiotic therapies and radical surgical excision of the affected area followed by skin graft, which is found to be expensive, and it has also seen to have increased chances of recurrence. So hence there is a possibility of alternative therapies or intervention which would be safe and cost effective for the management of hidradenitis suppurativa. So clinically, hidradenitis suppurativa could be correlated with the concepts of Nadi Vrana, which is mentioned in our classics. Acharya Sushruta in Sushruta Samhita Chikitsa Sthana 18th chapter, that is Visarpanadi Stanaroga Chikitsadhyaya, he has mentioned the application of Kshara Sutra as one among the management for Nadi Vrana. So Kshara Sutra application involves multiple actions such as Chedana, Bedana, Lekana, Shodhana, Ropana, which aids in removing the unhealthy granulation tissues from the tract and also helps in complete healing. So this is a case wherein a 30-year-old female presented to our OPD with the complaint of swelling associated with pain and burning sensation and pus discharge in the bilateral armpits on and off, and also she had multiple small abscesses which was present on the groin and nose as well. So this was seen occasionally. Coming to the history of past illness, patient was a diagnosed case of hidradenitis suppurativa since 10 years, and she had undergone IND once and also antibiotic therapies 3 to 4 times for the management of the same. So now since 6 months, the condition got aggravated and it was not relieved by any of the antibiotic therapy, hence the patient approached our OPD for further management of the same. So coming to the examinations, with the personal history, she was married and her bowel was regular with disturbed sleep and normal appetite, maturation to be normal, being a vegetarian with no history of any habits or allergies. A general examination was found to be normal and Asta Sthanika Pariksha was also found to be normal. Even the systemic examination, there were no abnormalities seen. Coming to the local examination of bilateral armpits, that is coming to the right axilla, on inspection, number of abscess was found to be 1. There was no discharge, but no foul smell also, and but discoloration was present. On palpation, tenderness was present and induration was present. But whereas on the left side, there were multiple abscesses which were small with mild discharge and also foul smell. And on palpation, there was tenderness and induration which was present. So diagnosis was made as hidradenitis suppurativa, that is Nadi Vrana, and the treatment adopted was initially Shodhana was planned. We get a direct reference from Charaka Chikitsa Sthana, that is Vivarani Adhyaya, wherein if any Vrana which is chronic in nature, if it is associated with Pitta and Vata, clinically we can use Virechana as one of the treatment protocol. That is first line of treatment protocol that was planned. So Snehapana was given with Gugulu Tiktakagrita with a dose of 30 ml, 60 ml, 90 ml, 120 ml, 50 ml for 5 days, followed by Abhyanga and Bashpasvidava with Manjushadi Thaila. Later Virechana was planned with 50 gram of Trivrit Leya and Triphala Kashaya as Anupana. Patient had 18 Vegas followed by Samsarjanakrama. Locally, after Shodhana, the abscesses which were found on the left side was completely resolved, and also the multiple small abscesses over the groin and nose also were completely resolved. So the one which was present on the right side was still persisting, for which probing was done, followed by the application of Kshara Sutra. And the thread was changed regularly at the interval of 1 week. So it has taken almost 4 sittings for the tract to completely undergo the cut through. And also orally Shamana Ushadis were given with Triphala Gugulu 2 BD, Gandhaka Rasayana 1 BD, Aragudadi Kashaya 10 BD before food, and Panchavalkala Kashaya was used for cleaning and dressing of the sinus tract. So this is a picture. So the right axilla post Virechana, it showed like this, and probing was done to the sinus tract. Then Prakshalam was done with Panchavalkala Kvata. Kshara Sutra was placed in situ. This was changed regularly for 4 weeks with an interval of 1 week, and that is the picture that was seen after 4 weeks. That is the cut through. This is the images before treatment and after treatment. The first image depicts the left axilla before treatment with multiple small discharging sinuses, which was completely resolved post Shodhana, that is post Virechana. Even the small abscesses which were there on the groin and nose also was found to be completely relieved. Right axilla, this was cured using Kshara Sutra. That is a picture before treatment, and the right axilla after Kshara Sutra treatment. So the treatment line goes like this. The patient came to the OPD. The first visit was on the February, that is in the year of 2024. So initially Shodhana was planned, which was followed up with the Kshara Sutra application. So it has taken almost 2 months for the complete healing. That is, in the month of April, the complete healing of the tract was found. And later, the regular follow-up was done, but there was no recurrence that was seen. Again, this year in the August, second sitting of Virechana was planned and it was executed, and the last follow-up was done in the month of November, that is the previous month, November 2025, wherein there was no recurrence that was noted. So the result goes like this. After the Shodhana procedure, the small abscesses over the groin, left armpit and over the nose were completely healed. After 4 sittings of Kshara Sutra, the tract and the right axilla was healed. No recurrence is 19 months post-treatment. So the last follow-up was made on November 2025. Coming to the discussion, Acharya Sushita has explained Upanaha, Vidharana, Prakshalana, Tailapurana and Kshara Sutra Prayoga in the management of Nadi Vrana. So here Virechana was used to reduce the vitiated pitta dosha and vata dosha. Gugulu based Apamarga Kshara Sutra, which was used, it aid in healing the tract by its Shodhana and Ropana property. Gugulu possesses the anti-inflammatory and analgesic effect due to its Snigdha Guna, Pichala Guna and Vatahara property. Apamarga due to its Kapha Vatahara properties, because of its Katutikta Rasa Ushnavirya Tikshna Guna, it also helped in faster healing. Also Apamarga had Vrana Shodhaka and Ropana property, also Krimihara property, aiding in complete healing of the tract. Coming to the conclusion, based on one's yukti and after careful assessment of bala and abala of the patient, the treatment strategy demonstrated encouraging result in the management of hidradenitis suppurativa. Adapting to regular shodhana and sustained follow-up helped in minimizing the recurrence, which remains the major challenge in this condition. Thus, this approach may be considered as one of the promising therapeutic protocol in Ayurvedic management of hidradenitis suppurativa, highlighting the importance of holistic and personalized intervention for long-term disease control and improved quality of life. Thus, we could achieve the sustained relief of hidradenitis suppurativa with 19 months of follow-up post-treatment. Thank you.
Thank you, Dr. Ranjana. Next, I call upon Dr. Varuni S. Bairi, Munial Institute of Ayurveda, Manipal, for her presentation.
As a part of our scientific session, we have Jivana session pending. As all our speakers and the chairperson getting awarded as Ayurveda Vishwaratna, they are being awarded in the main stage. They'll be coming here anytime soon. Meanwhile, we are continuing our presentation.
Shri Gurubhyo Namaha. Good evening to one and all present here. I, Dr. Varuni S. Bairi, Assistant Professor from the Department of Agada Tantra, Munial Institute of Ayurveda Medical Science, Manipal, going to present a case on the topic management of leukocytoclastic vasculitis through the Ayurvedic intervention under the guidance of Dr. Mahesh P.S. Saulgimat. Coming to the introduction, leukocytoclastic vasculitis is a small vessel immune-mediated complex skin vasculitis. So it is a rare case with more than 50% of the case being idiopathic, and if you see the treatment protocol, it is usually restricted to usage of corticosteroids, and also it is with the immunosuppressants. It is not only poor prognosis but also with the higher chances of relapse. So today I am going to discuss one such diagnosed case of leukocytoclastic vasculitis which was successfully treated using the Ayurvedic intervention. Aim to demonstrate the clinical effectiveness of an evidence-informed Ayurvedic treatment protocol in managing leukocytoclastic vasculitis with the objectives to understand the clinical features, to recognize the Ayurvedic diagnostic considerations, to analyze the treatment protocol, and also to evaluate the clinical outcomes achieved through the Ayurvedic interventions. 10-year-old female patient came with a complaint of sudden onset of reddish rashes on the bilateral upper and lower limb associated with burning sensation, slight itching and swelling since 10 days, with no history of any fever or other systemic disease. These are the images on the day of visit of the lower limb and this of the upper limb. Coming to the history, patient with a diagnosed case of LCV from the alternate medicine came with a history of multiple ant bites to both the lower limbs 15 days ago. After 3 days of bite, multiple red lesions appeared first on her bilateral lower limb, then on the upper limb with the previously said complaints. There was no much improvement seen even under the modern medication, so the patient approached our hospital for the further management. There was no any history of major illness and or any allergies. Moving on to the treatment history, 40 mg oral prednisolone was ongoing medication when the patient visited us, and antibiotics and analgesics were prescribed before, details of which were not available with the patients. Appetite was reduced and sleep was disturbed. Coming to the bowel and the micturition, it was normal. Local examination revealed a reddish macule with the palpable purpura was present on the dorsal and ventral aspect of both upper and lower limb. There was no any discharge and it was with mild tenderness, and lesions were confined only to the extremities. So based on the chief complaint, history and the local examination, the case was diagnosed as Pittaja Kita Visha. By considering the Hetu as ant bite, using the basic principle of Ayurveda, that is Trisuta Siddhanta, Hetu Linga Aushadha, in Aushadha along with the other Shamana Aushadhi, Hetu Viparita Chikitsa, that is Vishavat Sadayet, Agada medications were prescribed to the patient. So on the day of visit, to reduce Daharaga Visarpa as a Ruk Pratikriya, Patolokaturunyadi Kashaya was given, and as a Hetu Viparita Chikitsa, Bilvadi Agada and Doshivishari Agada was given, and Nalpamaradi Taila was given for the external application, and patient was advised to lower the steroid medication dosage. But by the 4th day, as a result of reduced steroid medication, patient presented with the added complaints of abdominal pain. So Hingvastika Churna was added for further 3 days, and Rukshata was increased in the lesion. So Nalpamaradi Taila was changed to the Manjishtari Taila. So these are the pictures where the symptoms were aggravated as the result of steroid tapering. So on the day 10, majority of the erythematous lesions were reduced. So only as a Hetu Viparita Chikitsa, Bilvadi and Doshivishari Agada was given, and Nalpamaradi Taila external application was continued. And by day 30, to reduce its recurrence rate, which is known for this disease, Doshivishari Agada was kept for internal medication and external application was continued. By the day 40, all the internal medication was stopped and only external application, Nalpamaradi Taila, was given. So as the recurrence rates are high, patient was under observation for 6 months, and there was no any recurrence rate and no any new lesion found in the patient. So the assessment parameter shows the before and after treatment, the scores were reduced from 13 to 1. Images of before, during and after treatment with no recurrence rate. So coming to the discussion, the recent research article shows that Patolokaturunyadi Kashaya has the ability to limit the endothelial injury and to decrease the local inflammation by limiting the nitric oxide. And Bilvadi Guttika and Doshivishari Agada studies reveal that it has an anti-inflammatory, antioxidant and cytoprotective activity, and enhancing the regulatory cytokine, it acts as an immune modulator, and it by promotes the tissue repair via cytokine modulation, supports the healing process. Coming to the Nalpamaradi Taila, which was given externally, presence of curcuminoids and flavonoids resulted in reducing the pro-inflammatory mediators, and antioxidant activity protects the vascular endothelium. Antimicrobial action helps to reduce the secondary infection, and microcirculation tissue healing was found by the usage of Nalpamaradi Taila. These are the publication detail. Coming to the conclusion, this case demonstrates that Ayurvedic management guided by the Agada principle can address the limitation of conventional therapy in pediatric leukocytoclastic vasculitis by targeting the endogenous inflammatory toxins and modulating the immune responses. The intervention achieved complete remission with no recurrence over the 6 months. Finding encourages further clinical research, standardized protocols, and integrative models combining modern diagnostic with Ayurvedic therapeutic frameworks. These are the references. Thank you.
Thank you, Dr. Varuni. Next, I request Dr. Rajneesh V. Giri, SDM College of Ayurveda, Udupi, for his presentation.
Good evening all. Shri Manjunataya Namaha, Om Shri Dhanvantaraya Namaha. Presently I am working at SDM Ayurvedic College, Udupi, and today I will be presenting you a case presentation on an effective management of pilonidal sinus with Pratisaraniya Kshara. So these are my contents. So whenever we are talking of certain diseases in the context of Vrana, Sushruta has given a reference for Nadi Vrana. So whenever a Vrana is in its Pakwa stage and we don't adopt surgical procedures, the doshas which are present in the area of Vrana Shofa, because they are not being expelled out or removed, they go into the deeper tissue and result in the formation of a Nadi Vrana. There are different types of Nadi Vrana, among which one of the Nadi Vrana is a Shalyaja Nadi Vrana, where the presence of a Shalya prevents the healing of Nadi Vrana. So in today's context, pilonidal sinus, a disease which is characterized by its manifestation in the natal cleft, buttock, between the buttocks, or in the axilla, or between the fingers, between the toes, can be compared to the pilonidal, can be compared to the Shalyaja Nadi Vrana. This has a preponderance or main occurrence in males of younger individuals, and it has been seen that this disease has a notorious involvement or association with recurrence. Even after the best surgeries, the recurrence rates are very high, as a result of which people are looking towards Ayurveda for an effective therapy. So a patient presented with a tract with pus discharge, if you see, and one more swelling on the opposite side. So one side there was a tract which was leading to an opening in the midline, and another on the other side there was an abscess. The patient had undergone a course of antibiotics prescribed elsewhere, and since there was no effective cure, he came to us for an immediate relief. So after local examination and proper Ashana or probing, it was seen that the tract was leading to an opening in the midline, and on the other side there was an abscess. So the diagnosis was purely clinical. Even though there are other diagnostic investigative measures available, the pilonidal sinus is a disease which is predominantly diagnosed clinically, and the patient was posted for surgical procedure, and all the investigations came to normal, and as a result of which surgery was planned. So if you see the Shalya, which is the Nidana here, that is the patient's hairs of his own body, they enter and they create a cavity inside the sweat pore, and they vitiate the local tissue, the local dhatu, resulting in the formation of a Vranashofa, which is the Purva Rupa, and which, when not treated or as a due course of time, breaks open, resulting in the formation of a discharging sinus, which is the Rupa, which is the Nadi Vrana. So what is the Chikitsa adopted? The Chikitsa adopted was, if you go through the text of Nadi Vrana, Sushruta has given the first line of treatment as Chedana. So the patient was taken up for laying open of the tract under local anesthesia. As you know, the basic preoperative precautions are all taken, and the patient was taken in the prone position, and after due part preparation and other precautions, the probing was done after infiltration of the local anesthesia, and if you see, the tract was laid open, and whatever hair follicles were there, all these hair follicles, by the procedure of Lekhana, by scraping, the hair follicles were removed. This process is not sufficient. Why? Because there are a lot of hairs embedded in the lining of the tract, which result in recurrence of the disease, which is most important to be set right. As a result of which, after the scooping, Pratisaraniya Tikshna Kshara was applied till Samyak Dagda Lakshanas manifested, and later the Kshara was removed by washing it with lemon juice. Then the area was packed with Yashtimadu Taila. The other side also, similarly, if you can see, the abscess was also laid open. Post-operatively, there was no antibiotics given. We give this, and this is enough to manage the infections, the Trifla Gugulu 2BD, Gandagrasayana 2BD, and the important thing was daily Shodhana was done with washing of Gomutra Arka. If you know, Gomutra Arka has also Kshara in it. So when we are washing the wound with Gomutra Arka, it cleanses the debris present in the tract, and as a result of which any remnants which are present get cleansed, and the chances of recurrence gets reduced, and later the area for the purpose of Ropana was packed with Yashtimadu Taila. So these are some of the images to show you why, because pilonidal sinus cases are some cases which we get often in our clinical practice, especially they have been operated once or twice elsewhere and they come to us for an effective treatment. So this I want to show you to tell you that we have a very effective treatment. If you see, this is the follow-up after 1 month, that is after the 2nd month, and on the 3rd month, if you can see, the wound has completely healed without any recurrence. So pilonidal sinus, since it is associated with surgery, it is a challenge because the patient wants 100% result. Patient does not want much loss of work hours and he wants to be treated at OPD level. So this way of treatment answers all these problems. So Kshara, if you know, it has been told as Ksharanat Ksharaha. So the Kshara causes Dushta Mamsadi Himsranat. So it destroys or debrides the unhealthy granulation tissue which is present there without any surgical usage, and as a result of which, once all the dead unhealthy tissues have been liquefied, they flow out, and as a result of which we get a Shuddha Vrana, and by the proper dressing with Yashtimadu Taila, we get 100% result in the healing process. So the Kshara not only is important here, but apart from that, keeping the area clean with usage of Gomutra Arka and Yashtimadu Taila. Yashtimadu Taila's extracts have very good healing property. So thus the usage of Pratisarniya Kshara and the dressing daily with Gomutra Arka and the dressing of Yashtimadu Taila played a very important role in giving a complete healing of the pilonidal sinus without any recurrence. So just to illustrate you, the first figure shows you the tract. Whenever you do the surgical procedure, even though the tract gets laid open, on the posterior surface, certain amount of fibrous unhealthy granulation tissue gets remnant. So when we do Kshara Karma, the third figure shows that the complete debridement of the unhealthy tissue takes place, as a result of which it becomes a Shuddha Vrana. During the process of healing, there is no chance of recurrence. Thank you.
Thank you, Dr. Rajneesh. Now I call upon Dr. Sukanya Bhusari, JSS Ayurveda Medical College, Mysuru, for the presentation. Next, Dr. Fariha, please be ready.
Om Gurubhyo Namaha. Pranamas to Suturu Guru Parampara. Myself, Dr. Sukanya, second year PG scholar from JSS Ayurveda Medical College and Hospital, Mysuru, under the guidance of Dr. Vidya Narayan ma'am, HOD and Associate Professor. Today I am going to present on the topic Managing Fetal Growth Restriction due to Placental Insufficiency with Narikela Rasayana, a case report. Coming to the introduction, fetal growth restriction is defined as failure of the fetus to reach its genetically growth potential due to its pathological factor. So, it is characterized by estimated fetal weight or abdominal circumference less than 10 percentile for gestational age. The most frequent etiology for FGR is uteroplacental dysfunction. So coming to the incidence, in 18.6% in women with chronic hypertensive suffer from FGR, and other medical problems in the mother like hypertensive, anemia, diabetic mellitus can cause the FGR. So in Ayurveda, it can be described under Vata Bipanna and Garbha Shosha. So Brumana Gana Siddha Kshirapaka has been explained as primary line of treatment. So in this case report, discuss the role of Ayurveda treatment in managing FGR, aiming to support the fetal growth and optimize maternal and fetal well-being. Coming to the chief complaint, a 46-year-old female at 6 months of amenorrhea came with the complaints of tiredness and weakness since 2 weeks. For this complaint, she visited our OPD, and she is a known case of gestational hypertensive since 2.5 months on medication, tablet Labetal 100 mg TID. History of present illness goes as per the statement of patient, she has an active marital life of 2 years from her second marriage. She underwent tubectomy 20 years back and wanted a child from her second marriage. Therefore, she conceived after third IVF. Early pregnancy up to 10 weeks was normal, and NT scan suggested negative for Down syndrome and trisomy. But at the 18-week scan, the uterus arterial PI was slightly raised, and at 25 weeks of gestation, she went for a routine growth scan where she was diagnosed with FGR due to placental insufficiency.
Thus, for this complaint, she was on modern medication until 25 weeks at Apollo Hospital, but didn't get better result. So, hence she approached our hospital for Ayurvedic management of FGR due to placental insufficiency, and her LMP was 26th of Jan 2023 and ETD is 1st of November 2023. Personal history, she used to consume more salt in her meal, and marital life is 2 years from her second marriage, that is non-consanguineous marriage. Obstetrical history, gravida 3, parit 2 and live 2. P1 delivered through full-term normal vaginal delivery, 24 years male child, and P2 is FTND, 20 years female child, and G3 is present pregnancy with POG, 25 weeks plus 3 days of gestation conceived by IVF. Her menstrual history was regular with LMP 26th of June 2023, and past history suggestive that history of tubectomy 20 years back, and 3-cycle ovulation induction has been done, and 2 cycles of egg retrieval done 1.5 years back, and 2 IVF got failed. On clinical examination, her BP was 160/100 mmHg, and on examination, her uterus is not corresponding to the period of gestation, and fetal heart sounds were heard, and it was 144 beats per minute, and perceiving fetal movements well. And on UST, on Doppler scan, which was done on 6th of June 2023 at 18 weeks of gestation, her estimated fetal weight was 178, which was supposed to be in 250 gram. And UST again, which was done on 17th of July at 24 weeks of gestation, her estimated fetal weight was 418 gram, which was supposed to be 750 gram. And again, which was done on 24th of July at 25 weeks of the gestation, estimated fetal weight was 454 gram, which was supposed to be a 900 gram, and also suggest early onset of FGR. So these were the blood investigations which were within normal limit, like HB was 11.8 and albumin was 3.4, which was within normal limit. So it was diagnosed as Garbhashosha, and according to modern, it was diagnosed as stage 2 FGR with a placental insufficiency and gestational hypertension, because in the Doppler it's suggestive of reverse enterodiastolic flow. It was diagnosed as stage 2 according to Barcelona criteria. So treatment planned was Narikela Rasayana for the 4 sitting on alternate day. First sitting was done on 26th of July at 25 weeks plus 3 days of gestation, and 4 sitting it was done on 3 of August 2023 at 26 weeks plus 4 days of gestation. Along with this, Karjura Dimanta was given once in a day 90 ml for 1 week. So these are the Narikela ingredients which were prepared and given. Along with this, patient used to take Labetal 100 mg TID and Icosprin 75 mg OD and LMWH, that is low molecular weight heparin, 60 mg subcutaneously was given. So progress of the treatment, before treatment at 25 weeks of gestation, the estimated weight was 454 gram, and after at 26 weeks of gestation, it was 512, so 58 gram has been increased. During the treatment, fetal weight gain has been increased within 1 week of Ayurvedic treatment, and maternal improvement has been observed. Along with this treatment, she was advised chanting of Om and soothing musical therapy. So these were the reports which were before treatment at 25 weeks of gestation, which was 454 gram, and after the treatment it was 512 gram. This is a graph showing head circumference to the abdominal circumference, which was supposed to be 1 at 32 weeks of gestation, and in between 30 to 34 of gestation it is equal to 1, and after 37 weeks of gestation it will get elevated. Here in this case report it was below 1, so it was diagnosed as FGR. Outcome, patient underwent elective LSAS at 27 weeks of gestation due to placental insufficiency and gestational hypertension and end diastolic flow absent and intermittent reversible flow and high risk of maternal weight. And her fetal weight was 512 gram after the treatment, and when she was delivered, the baby birth weight was 780 gram. So Ayurvedic management not only helped in the womb but also after the delivering of the baby progressing in weight. This is because of the effect of Dravya, Guna, Rasa, Virya and Vipaka and Prabhava. Discussion, coming to the discussion in Charaka Samhita, Sharirasthana 10th chapter, that is Garbhini Vyakaranam Adhyaya, it has been said that Vata abhipannam yevam shushate garbhaha sa matu kukshi na mo purayati mandaha spandati tam brahmanam paryobir mamse rase rupachare. It means that Garbhashosha is being characterized by Akukshi Purana and Manda Garbha Spandana. Because of this, Matraja Rasadhatu and Vata dosha is hampered. When Rasadhatu get hampered, it will lead to Garbhashosha, and Vata dosha, which is responsible for the movement, when it get hampered, it will lead to the Garbhashosha. So Brahmanagana Chikitsa has been focusing on Rasa Prasadana, which enhances the fetal nourishment, and Vata Shamana. Hence Narikela Rasayana has been planned, and also Shita, which is mentioned in Sita Madhuka Kashmaradi Yoga for Garbha Shosha, and Narikela, which is rich in nutrient and water, supports the fetal development, and Ela, which is beneficial in Kshaya, helps in Rudha and Deepana. Narikela also contain vitamin C, sugar, phosphorus and calcium, and Ashwagandha, because of its Vata Kafagna, Rasayana and Garbhastapaka property, improves the fetal nourishment in helping the placental circulation. Shatavari, because of its Balya Pushti and Rasayana effective, treats the Garbha Poshana caused by Dhatukshaya, and Ashtimati, because of its Balya, Garbhastapaka and Rasayana property, reduces mental irritation in pregnancy, and Karjuradi Manta, because of Madhurarasa and Snigdha Guna, helps in tissue development and provides essential nutrients like iron, calcium and folic acid. Conclusion, Narikela Rasayana for managing the FGR in this case report demonstrated positive outcome with improvement in maternal and fetal health. An integrated approach with conventional treatment and conservative management was adopted. It helps to enhance the fetal growth as evidenced by significant improvement in estimated fetal weight, fetal biometry and Doppler parameter, and the patient positive response to the treatment undergoes the relevance of Ayurveda principle in addressing maternal and fetal health during pregnancy. However, this is a single case report and further research with a large sample is necessary to validate these findings and establish the Ayurveda protocol for managing the FGR. Acknowledgement, I thank Dr. Vidyanarayan Ma'am, HOD and Associate Professor for guiding in this case. Take home message, early detection, maternal health optimization and timely delivery are the key for better outcomes. Long-term monitoring is essential for future health risks. Thank you.
Thank you, Dr. Sukanya. Next, I would like to call Dr. Chandu Maitri, Sri Krishna Ayurvedic Medical College, Sankeshwar.
Very good evening to everyone, respected dignitaries, all the delegates. I welcome you all for my case presentation on the very interesting topic on avascular necrosis, that is AVN, critical insights into etiopathogenesis and Ayurvedic therapeutic approach in a case series. Myself, Dr. Chandu Maitri, Associate Professor, Krishna Ayurvedic Medical College, Sankeshwar, and PhD scholar from JMC, Bangalore. So, all of you know that avascular necrosis is that osteonecrosis or the dead bone, also known as osteochondritis, and it's also called as Candler's disease. In young adults, 60% of the cases being bilateral presentation, it occurs in 3 to 4% of the patient receiving corticosteroids. With the most common site, that is the involvement of being the femoral head and resulting the morbidity. And conventional management includes pharmacological intervention, surgical procedures like core decompression or the complete hip replacement or the joint replacement maybe. And Ayurveda provides an alternative approach focusing on the root cause, encompassing the systematic detoxification, that is the Shodhana, and the herbal medication and the lifestyle modification. The case series aims to explore the Ayurvedic understanding of the AVN etiopathogenesis and its therapeutic outcomes. So what is the purpose of this study? Is the purpose of researching Ayurvedic management for the avascular necrosis is to explore how Ayurveda with its holistic and traditional approach can contribute to the managing and potentially improving the conditions of the AVN. So objectives are symptoms relief and the pain management, and improve the bone and joint health, and circulatory and cellular support to the particular joint, and reducing the dependency on invasive treatments, and understanding the pathogenesis in Ayurvedic terms, and holistic and long-term management. So method, a case series of 5 patients diagnosed with the AVN with a stage 2nd to 4th stage based on the clinical examination, and also the MRI reports were selected for the study. And the Ayurvedic assessment considering the dosha samuchaya and impaired asti dhatu and the vata dosha imbalance was assessed in this all the cases. And management involves the customized Ayurvedic protocol like Shodhana, Shamana, Snehana, and the Swedana with dietary lifestyle modification for Ayurvedic as per the Ayurvedic principles. Here, as a prime line of the treatment, in the Shodhana, the Basti Karma was selected in almost all the patients. So clinical presentation, as you all know that, the symptoms, Bedo Asti Parvanam, that is breaking type of the pain, and Sandishula, that joint pain, Satata Ruk, continuous nature of the pain, and Karmakshayata, unable to walk, and the physical findings, the tenderness, bilateral hip joint, at the bilateral hip joint, and movement will be painful, limping, gait, and also the shortening of the any one limb or the both side, and tone it is hypotonic. And with all these clinical symptoms, when we are correlating with the Ayurvedic symptoms, it is correlated with Asti Majjagata Vata. So here a simple understanding of the pathogenesis of the AVN goes like this. The normal function of the Vata, Pitta, Kapha, so where the Vata considered, it is a basic energy behind the cell division, and when the Pitta is considered, it is the energy behind the cellular metabolism. When the Kapha, what it does, it is the energy behind the cell growth. When the abnormal causes, the abnormal of the Vata, Pitta, Kapha causes, when the Vata is getting abnormal, there is a decrease in the cell division, and when the abnormality of the Pitta causes the improper metabolism, when the abnormality of the Kapha causes the improper cell growth. So it leads, the Vata abnormality leads the no nutrition supply to the particular part of the joint or the particular part of the cell, and abnormal function of the Pitta causes the stops of the cell stem growth, stoppage of the stem cell growth, and abnormal function of the Kapha causes the obstruction of the micro and macro channels. It leads to avascular necrosis to the particular part of the cell of the bone. So this is the healthy joint and avascular hip joint. So in Ayurvedic perspective, a case series goes, a diagnosed case of AVN, head of the femur were taken for the presentation. All the 5 cases were presented with all the symptoms related with AVN. Each case was thoroughly assessed with the dosha and dosha samurchana, and the treatment advised as per the samprapti and subprapti vigatana meva chikitsa, and shodhana, brahmana, shamana, rasayana chikitsa were advised in almost all the patients with the pathya and lifestyle management. Shodhana Basti Chikitsa were selected in almost all the patients as a prime line of the management, and Basti combination changed as per the need, like Shodhana, Brahmana, Shamana, and the Rasayana. So here coming to the first case, where the 19 years of the male patient were treated long back. He has a grade 2 avascular necrosis at the left femoral head. It is a 19-year male patient, where the first line of the management, when the patient visited to the clinic, so I have planned for the Manjishtadik Shara Basti and Matra Basti with Bras Saindava Taila and Sarvanga Abhyanga with Bashpa Sweda for the purpose of Shroto Mukha Shodhana and to release the Avarana. So whenever the patient is coming with the AVN or the stiffness or the pain, the first line of management will be the Shroto Mukha Shodhana and to release the Ama as well as the Avarana. That is the first line of management. So the Manjishtadik Shara Basti was planned here because Manjishta contains the Gomutra, Kanji and Manjishtadik Kashaya. So after the 2 months of this case, and in between these 2 months, I have advised the many of the Shamana Aushadhis, I will tell later. So after the 2 months, patient got 50% of the relief. So then after the 2 months, I have planned the Tiktaka Kshira Basti because previously I have done the Shrotomukha Shodhana and to release the Avarana. And then the Tiksaka Kshira Basti was planned with the Matra Basti with Gugula Tiktak Gratam and Sarvanga Abhyanga with Bashpa Sweda for the Brahmana purpose. When without the Kshara Basti, without the release of the Avarana, directly if we are going for the Brahmana, it is very difficult to reach the nutrition supply to the particular part. So you have to do the Soto Mukha Shodhana first. For that, the Manjishtadik Kshara Basti were advised. And second visit after 2 months, the Tiktaka Kshira Basti were advised. And after the 3 months, the Virechana was planned because the patient also having the monoarthritis. Maybe the patient is having with a secondary infection, he may be getting the AVN. So that's why Virechana was planned. So after the 1.5 years of the continuous follow-up, the patient, when we repeat the CT scan, there is no evidence of the AVN after the 1.5 months, 1.5 years. So there is no evidence of AVN. So this is a case 2, the 30 years of the old male patient diagnosed with AVN of the femoral head. The MRI report shows that avascular necrosis of the bilateral femoral head stage 2. So here also the Manjishtadik Sharabasti was planned because of the Shodhana and to release the Avarana and the Ama. So after that, in between the first and second Basti course, Jaloka Charna was done in this patient, and after the 1.5 months, the Tiktaka Kshirabasti was planned with the Sarvanga Abhenga and Bashpasveda for the Brahmanartha and the tissue regeneration purpose. So after the 3 months of the gap, again the Rajayapana Basti was planned because there is no any ama, there is no any stiffness. The patient was freely moving his hip joints bilaterally. So I have planned the Brahmana Chikitsa. That is the Rajayapana Basti was planned because Rajayapana Basti is having the Mamsarasa. So Rajayapana Basti was planned. After the almost 5 to 6 months, patient is running without patient is running after the 5 to 6 months of the treatment. But when the patient was first visit was there it was very difficult to walk. So the case number 3, the same, the Manjishtadik Charbasti was planned. It is also grade 3 avascular necrosis, and Rajayapana Basti was planned for the when the patient was getting the Nirama Lakshanas for the Balya purpose, and Tiktaka Kshirabasti was planned for the Brahmanartha purpose. And this patient was not able to walk before going to the treatment, and after the treatment patient is walking normally. So this is also the 4th case where the patient was having completely limping gait, and again the Manjishtadik Sharabasti was planned 2 times because the Amalakshana was more in this case. So almost 2 courses between the 45 days. The Manjishtadik Sharabasti was planned. The later Tiktaka Kshirabasti was planned for the Brahmana and the regeneration of the tissue. The patient is walking after the 3 course of the Basti. So this is the 5th case where recently I am treating. The last week only the patient took the Rajayapana Basti course of the Chikitsa. So that is a before treatment. And this is the Shamana where I have planned the Punarnama Mandura, 1 TDS, Gokshirad Gugulu, Maharasnadi Kashaya, Kaishora Gugulu, and Arogya Vardhini. In between, changed the same prescription I have planned to almost all the patient. As a Rasayana Chikitsa, Gugulu Tikta Gratam, and Kshirabala capsule and Gandha Taila were planned. So to conclude, the Samprapti of the Dosha and Dusha and Ama and Nirama Lakshana should be identified in whenever you are treating the avascular necrosis cases. Manas Upachara is very important, and Pachana and Deepana must be planned, and Shroto Shodhana to be done, and Shodhana with Brahmana Chikitsa is needed for the avascular necrosis cases. Rasayana is must. So the Shodhana is the just for the foundation of the treatment, but Rasayana Chikitsa is needed for the complete treatment, and Patyapanta should be followed. Thank you.
Thank you, Dr. Chandu.
Thank the organizing team for giving me this opportunity. Thank you so much.
Thank you, sir. My heartiest congratulations to all the winners and sincere appreciation to all the participants for their commendable efforts.
Good evening, all of you again. We are starting our Jivana session now. Our renowned speakers are Dr. Rajgopala S. New Delhi on the topic Autism ADHD, Dr. Lata Damre from Bengaluru, the topic is PCOD and ovarian cyst, and Dr. L. Sucharita Bengaluru on female infertility, and our chairperson is Dr. Shailaja U. Hassan. And I would like to invite our chairperson, Dr. Shailaja U. Hassan, on the stage. With a thundering round of applause, let's welcome Dr. Shailaja U on the stage. Dr. Shailaja U is a prominent Ayurvedic doctor and academician in Hassan, serving as head of the institute at SDM College of Ayurveda and Hospital, leading institution, with qualification including MD and PhD and specialization in Kaumara Bhritya. She is recognized for her expertise in child health, research and leadership in Ayurvedic education. We welcome you, ma'am. And now our speakers are Dr. Rajgopal S. New Delhi to come on the stage, and Dr. Lata Damble Bengaluru to come on the stage, and Dr. L. Sucharita Bengaluru to come on the stage. Dr. Rajgopal S. is a prominent Ayurveda doctor, New Delhi, known for his role as head of Kaumara Bhrutya at the AII India Institute of Ayurveda, specializing in autism and holistic child care, while also being a respected figure in Ayurvedic research and education, particularly regarding pediatric health and ancient texts. We welcome you, sir. Now I would like to welcome Dr. Lata Damble, a distinguished Ayurvedic physician, scientific innovator and chief scientific officer at Atrimed Pharmaceuticals, blending traditional Ayurveda with modern pharmacology. With expertise in plant chemistry, drug discovery, and developing natural therapeutic products for skin and other conditions, holding degrees in Ayurveda and research experience. We welcome you, ma'am. And now I would like to welcome Dr. Sucharita L. is a highly experienced Ayurvedic doctor in Bengaluru, India, with over 40 years in the field, holding BA, MS and MD from the Government of Ayurvedic Medical College. She is known for personalized care, especially at her Pandit clinic, focusing on weight loss, gastritis and all the different conditions. We welcome you, ma'am. With this, I would like to call upon our first speaker, Dr. Rajgopala S. New Delhi, on the topic autism and ADHD. Over to you, sir.
Thank you very much, the MC of the ceremony. To begin with, a warm welcome to the program. My sincere thanks to the organizers, particularly Dr. Giridhar Kaje, who is a good friend of me, and the team Prashanti for organizing this beautiful program. My topic is ADHD, ASD and Ayurveda. I'll be talking on the Tattva, Shastra and Vyavahara of this disease particular condition. This is the institution from where I come from. On the left side you can see All India Institute of Ayurveda, Delhi, which is the premier national institute under the Ministry of Ayush. And on the other side we have got a satellite center in Goa. This again a new establishment under our aegis. Coming to the objectives, this presentation will be talking on foundational understanding, diagnosis, establishment of dosha framework, pathophysiological insights and mechanisms, clinical diagnostic framework and therapeutic interventions with evidence and some scope and limitations in between. If you see, children are not miniature of adults. Does everybody agree with this? Our ancient acharyas also mentioned the same thing, and they have their distinct dosha status, they have their distinct dhatu status, they have their distinct Agni, Prakriti, Bala, Avastha. So considering all these factors, a child-centric framework of care and medicinal application is necessary, and that is why the speciality of Kaumara Bhrutya has come into existence. Autism spectrum disorder, it's a spectrum of disorders where a group of diseases are clubbed together having similar clinical presentation, similar pathological background also. Diagnostic tools, we generally use DSM-5 or MCHAT criteria, which examine persistent deficits in interactions of social communication and analyze the response in terms of yes or no, items that cover different developmental domains. More than 1/3 of the ASD cases currently have ADHD, because earlier ADHD was taken as separate disease entity, Rett's syndrome was taken as separate entity, autism was taken as separate entity, but now the present approach is ASD, that is autism spectrum disorder, because the approach is almost, clinical management approach is almost similar. More than 40% of have experienced or other experiencing ADHD. That is a case presentation what we see in our day-to-day clinical practice. Coming to ADHD, yes, it presents as lack of attention, lack of concentration, disorganization, difficulty in completing the tasks, being forgetful in nature and losing things. The onset is usually before the age of 12 years. Symptoms present at school, work or home. Generally, parents come with when it exceeds their control limit, they come to the hospitals. Otherwise, they consider that their child is bit active, or if I say Usharagidane, Shane, these terms they are using. But that may be the initial phase of ADHD presentation. If it is not attended or if it is not properly attended, that may lead into established case of ADHD. The disturbance causes significant impairment of social, occupational and academic functioning of the child. The disorder is not accounted for by any other behavioral disorders. You can see the types of ADHD, predominantly inattentive, combination type, and predominantly impulsive and hyperactivity. These are the general types what we see. Most of the times we see the combination type. Epidemiology, if you see 1 in 65 Indian children, because this is again in the last 2 decades we started giving attention to this particular entity. Otherwise earlier it was clubbed under mentally challenged or mental retardation or something like that. Up to 1.8 to 2 million children in India are thought to be having ADHD according to one study. Lack of systematic epidemiological research as compared to developed countries, it is a case of India, undiagnosed cases, reduced prevalence rate than the actual value, and cases that come to health facility may represent only tip of the iceberg. That is what is shown here. Many of the times it is misdiagnosed, or many of the times it is misattended also. Global prevalence is also just of almost similar, 0.22 to 3.60% we see. Gender difference is also seen. More significant gender difference is seen male to female. Male predominantly higher, that is 4:1 ratio you can see. Regional differences, of course, though the studies in the Western countries, they show some regional differences. In our country, it is not reported. Despite of advances in early diagnosis and intervention, no definite therapy is available today, and completely reversing the condition is almost impossible. 24 to 76% of children with the ASD are exposed to some form of complementary or integrative or alternative or complementary alternative medicine with herbal drug interventions. That is what the study shown here in Journal of Herbal Medicine highlights. Similarly, you can see herbal medicine treatment for children in autism spectrum disorder, a systematic review. There is a good systematic review available on this. There is one book recently published by CRC Press, that is Tyler and Francis, international publication on traditional and complementary and integrative medicine for neurocognition, which of course includes autism and ADHD as one of the chapters in this. If you see the classical reference of ADHD, one-to-one correlation of ADHD or ASD with Ayurvedic terms is not available. It is an anukta vyadhi. It can be compared as a sahaja adibala pravarta vyadhi, knowing that it has got a genetic predisposition, or sometimes based upon the clinical symptoms we can compare it with the different types of unmadas. Of course, it's a broad term unmada, because in unmada we see buddhi vibhrama, smriti vibhrama, shila vibhrama, bhakti vibhrama, cheshta vibhrama, achara vibhrama, sanjnana jnana vibhrama and mano vibhrama. All these things to some extent, sometimes more, sometimes less, seen in cases of this type of ASD, that is autism spectrum disorder complex. Coming to the pathology of autism and unmada comparison, if you see, childhood autism has got parental genetic defect, matra pitraja, sattvaja apachara, random mutations you can see, swakarmaja in nature, antenatal or psychological stress, that is vivruta shyani, naktam charani, this type of presentations, defective child rearing practices, gluten and casein sensitivity, that is ahita annapana. This type of comparison can be made with unmada, but this is again not one-to-one correlation. This is just comparison with available textual references. Similarly, maternal factors also can be compared with all the maternal activities as shown on the right side of the slide. One of the studies say that 70% of the mothers of autistic children followed inappropriate dietary practices during pregnancy. The same study says that 65% of adhered to unsuitable regimes consistently throughout the pregnancy. Likewise, Garbha Purva Paricharya, Garbhini Paricharya, these concepts of Ayurveda, they have some links, or we can make some links with the retrospective study on maternal factors. So these are all hypothetical comparisons. Nothing is established. Similarly, if you see the Samprapti Ghataka, you can frame a Samprapti Ghataka with the dosha, dushya, agni, srotas, all those things comparing. And when coming to the sadhya, sadhyata, it is not a sadhya vyadhi, it is not a asadhya vyadhi, it is an vyapya vyadhi. If a vyapya vyadhi can be treated, a long-term treatment can make it to sadhya, and of course, my experience is children with ADHD or ASD with constant continuous management, they can run with the group. They may not be the forefront runners, but they will be with the group runners. School performance, they can attend the normal schools, they can attend all homework or scholastic activities. This can be achieved, which is a great achievement if you compare with the available other modalities of treatments. Similarly, this table I just try to compare Vatika Unmada with ADHD. Symptom correlation is made here. Paitika Unmada, again symptom correlation is made. Similarly, Kaphaja Unmada symptom correlation is made here. But one-to-one Kaphaja Unmada alone, such not available. It is always comes in Dvandvaja in nature, or many of the times it is Tridoshaja in nature. Shadbhava, whatever Matrajadi Shadbhavas are there, that is also can be compared theoretically or conceptually with the Unmada as well as with the ADHD and ASD. This is just understanding things. Coming to the management principles, single pathy management is not effective. To some extent, you can give with the sedative drugs and such drugs, you can give with ADHD and suppress the things. But once you withdraw, same thing will relapse, or it will have the drug-induced side effects also. Here, behavioral educational interventions, pharmacological interventions, these are widely practiced in the conventional medicine, whereas complementary alternative medicine approaches like Ayurveda medicines, homeopathy, Siddha, Chinese medicine, naturopathic, Unani, yoga meditation, hyperbolic oxygen therapy, chelation therapies, transcranial magnetic stimulation, these things are also practiced in defined or advanced centers. Nutrition and diet also plays a vital role in the management when you are planning the management. If you combine the best of these things together, yes, we can achieve the success more quickly in comparison to isolated treatments. Manodahika Vyadi, presentation is more of manasika in nature, but daihika symptoms also will appear, and all the three Sharirika doshas involvement is seen, predominantly of Vata in ADHD and predominantly of Kapha in ASD, autism in, condition. If you see the modalities of treatment to be approached, Daivivapashya Chikitsa from Ayurvedic point of view, or behavioral therapy or other therapies, non-medicinal or non-pharmacological intervention therapies, that includes in Daivivapashya Chikitsa. Yukti Vyapashya Chikitsa, rational use of medicines. There are a lot of medicines are available, and Sattva Chikitsa, the psychotherapy. Particularly here, one thing is to be remembered is treatment is not to the child alone. The treatment is to be given to the parents or family as a whole. That gives more better response in comparison to, again, isolated treatments. Unmada Chikitsa, just an outline I given here. Daivapashya, Yukti Vyapashya and Sattva Chikitsas are there. In the Shodhana Chikitsa, Vamana, Virechana, Basti, Nasya, Rakta Mokshana can be done. I am telling can be done, not a must. Vamana, Virechana administering in children is very difficult. Generally, Shodhana is required, Mrudu Shodhana is done with Virechana, and I have highlighted Nasya. What we have seen in our clinical practice is, if you are doing the Nasya therapy, the hyperactivity comes down, the quality of sleep improves, the command obeying capacity or command obeying of the child gets improved. However, Rakta Mokshana is out of question here. Simply Panchakarma, Shodhana Chikitsa, Nashaka, Rakta Mokshana is there. That way I just mentioned it here. Coming to Shamana, Bahya Chikitsas, particularly Udvartana Abhyanga, soothes the child. Murdhi Taila or Murdha Taila, particularly Shiro Pichu, if possible, Shirobasti definitely helps. Shirodhara also can be done. That also helps in improving the quality of sleep as well as reducing the ADHD hyperactivity conditions. Lepana, particularly Shirolepana is of help. Svedana, Anjana and Dhumapana, of course, wherever required, certain conditions, Dhumapana can be done, but Svedana is part of Sneha Sveda we do just to ease out. Abhyantara Chikitsas, lot of medications are available, Churna, Vati, Grita, these are the dosage forms. Generally, we are using Grita form. Asavarishta or self-generated alcoholic preparations and preparation containing fats. These are the ideal dosage forms for children, particularly for the mental faculty when you are targeting. Rasayana drugs, Bala Rasayana or Medhya Rasayanas can be used. In the Medhya Rasayana, if you closely observe, there are two categories. Some of the Medhya Rasayanas are Ushna, Tikshna in nature, Uttejaka, stimulating, and some of the Medhya Rasayanas are Shita in nature, which are Shamaka. So what is required at what condition? ADHD preferably requires a drug which is Shamaka in nature, something like Brahmi, Shankhapushpi, such things. Whereas autism alone and Uttejana is required, you can go for drugs like Tikshna drugs like Vacha, Brahmi, Vacha, Jyotishmati and such things. Of course, in Daivapasha Chikitsa, there are a good number of studies on Daivapasha Chikitsa also. One of the studies are shown here, that is International Journal of Yoga, where efficacy of Sattva Chikitsa and Ayurveda drug therapy is highlighted. The outcome of the study is remarkable improvement in immediate recollection in terms of short-term memory, while Shankhapushpi found much better in long term. Shamaka type of Medhya Rasayana was used in this study. Yukti Vyapasha Chikitsa, of course, Charaka says Yuktisya Yojana, you have to use your knowledge or your intellectual level knowledge rationally. Nidana Parivarjana, Samshodhana, Shamana and Ahara, all those things I have mentioned, these things can be applied in the Yukti Vyapashaya. Of course, some of the specific diet practices can be practiced. It is not successful in all the cases. Some cases we get good response. Classical management of Unmada can be applied. If it is Vatika predominant Snehapanadi, if it is Paitika predominant Virechanadi, and if it is Kapha predominant Vamanadi Chikitsa, along with other allied therapies like Snehapana, Samsarjana Krama, Shiro Virechana, such things can be done. Of course, it's again patient specific. If one patient gives a good response to one particular therapy, it is not mandated the next patient will give the same response, despite of having same doshic status. So it's all individual, and you may have to do plus minus, or you may have to do some additions, deletions, modifications in the management. Commonly used Ghrita preparations I have just listed here, like Brahmi Ghrita, Kalyanaka Ghrita, Mahakalyanaka Ghrita, Mahapaishachika Ghrita, Saraswata Ghrita, Panchagavya Ghrita. If Kapha predominant is there, we prefer to go for Panchagavya Ghrita, Lashunadi Ghrita, Hingwadi Ghrita, and other drugs like Tiktaka, Jivantyadi, Mishra Ghrita, these can also be used. Going ahead, Lepa, application Shiro Lepa, of course, which is called as Talapodichil in the Kerala practice. This is again a good practice which gives good response in children with ADHD particularly. Shiro Lepa can be done. Then commonly used drugs are Brahmi, Jatavamsi, Ashwagandha, Musta, Amalak, etc. Some approachment principle which is used in Unmada, like you take the medicines, you make a paste of it, keep it for overnight, make it little ferment and then applying. That is also helpful in case of hyperactive children for Shirolepa purpose. There are a lot of nootropic drugs available, Medhya drugs. The list of drugs already we have discussed, like Brahmi, Shankapushpi, etc. Smart drugs, memory enhancers, neuro enhancers, cognitive enhancers and intelligent enhancers comprising of supplements and nutraceuticals. They may be helpful in improving the mental function. So there are a set of drugs which increases the acetylcholine levels in the brain, set of drugs increasing the oxygen supply to the brain, a set of drugs are there supplying neurochemicals like neurotransmitters, enzymes and hormones, and such things can be used. Again, it is all these things are patient specific. These are the 4 common Medhya drugs mentioned by Charakokta Medhya Rasayana, that is Mandokapurni, Guduchi, St. Madhu and Shankapushpi. And all these 4 drugs can be successfully used in the management of ADHD, ASD conditions. Internal as well as external applications we can use. Brahmi, there is a publication on Brahmi, Bacopa moneri, in autism spectrum disorders, which the outcome was behavioral improvement, sleep improvement, cognitive function improvement, mood improvement, and of course it has got anti-epileptic nature also. But when we are using treating patients with seizure disorders and patient is already on anti-epileptic drugs, we should be careful. There are certain drugs like Shankhapushpi and Vacha which interferes with the absorption of anti-epileptic drugs. So that has to be kept in mind while using the nootropic Ayurveda drugs along with conventional therapy. Which is nootropic among this? Medhya. Of course, all the 3 are considered to be Medhya, and again, how to use them, that is left to us. Kapikachu is also said to be Medhya. Amalaki is also said to be Medhya. Ashwagandha is also said to be Medhya. But if you are using Kapikachu in children, what will happen? It's left to you to decide. Ashwagandha, excess use of Ashwagandha in children, again, it will result in a different way, whereas use of Amalaki is always safe. Dietary role. Diet also plays an important role as an adjuvant but not as a curative. Of course, phytochemicals as neurotherapeutic agents in autism spectrum disorders. There is a good publication from Indian researchers itself. So we can make, you have to make modification in the diet also. The most neglected vegetable, which is Medhya. Can you recollect this? Many of you don't like it. Kushmanda. Kushmanda is said to be the Medhya drug. It is very good for children also, but we don't use it. In the dietary categories, of course, vegetable stands first. Fruit stands next compared to omega-3 sources, proteins, nuts, seeds, grains, etc. So the best way is to use the nootropic, the best vegetables available, the best fruits available in the diet of the child while managing. Some things are to be avoided again. The drugs which are rich in pesticides, artificial additives, gluten-rich items, dairy-sensitive products, corn, food coloring agents, preservatives, these such type of chemical added or chemically preserved items, better to add in the management. Essential micronutrient list is given here. Again, if you see the critical things, most of them are in the vegetable source. Probiotics also play important role. Good probiotic, there is a good publication from Dr. Dinesh K.S. and his team on effect of Ayurveda management of dysbiosis with special reference to bifidobacterium in children with autism spectrum disorders. So again, all these studies suggest that diet plays an important role in the management of the conditions. I would like to highlight one particular protocol developed by Dr. Dinesh K.S. and his team over a period of 4 to 5 years of intensive study, that is called as Agastya protocol. It is said that Ayurveda gut therapy, AGAST, he has made a mnemonics for that and successfully applying it is not purely Ayurveda alone. It is a conglomeration or combining Ayurveda and conventional non-pharmacological therapies together in the managing the child, and as a very successful protocol need to be implemented by all. There is a Cochrane review also on autism spectrum disorder therapy. Journal of Ayurveda Integrative Medicine has a publication on yoga and pranayama in the management of ADHD and ASD conditions. Increased tolerance of sitting and adult proximity and subsequent socialization. These things are the outcome of the present study. The studies this suggest, again, there are studies on mantra also, yoga therapy, there is study on mantra also, and all these studies suggest that they are all complementary to add on to your conventional or your classical Ayurveda therapies. Application of Marma or Kalari Marmas. This is also said to be helpful, but we should be very careful here because improper application of Marma therapy can result adversely. So should be careful while applying, only expert suggestion or expert guidance, we can go for the Marma or Varma therapy. Effect of mantra. Again, there was a recent publication on effect of Gayatri mantra on memory, Brahmari pranayama on memory activities, and such studies are there. So if you are able to, very young children it will be a bit difficult, but elderly, yes, definitely these things can be applied for a better outcome. These are some of the studies, Cochrane review studies available on Ayurveda therapy on ADHD and autism spectrum disorders. The outcome of all these studies are that it is all suggestive, it is all supportive to the better care of the child. Oramarunu or folk practices are there. There are a lot of folk practices also. The proper application of these folk practices, like the Oramarunu practice of Kerala, the Balaguti or Janmaguti practice of northern part of Kerala, northern part of India, Janmaguti, Gudakattu, Eranda Taila use, Gardhava Kshira is said to be good. These are all, there is no specific evidence for this, but said to be good, can be tried because non-harmful therapies. Similarly, Prakara Yoga, of course, practically practicing this Prakara Yoga today is a very big task, not possible. The use of Prakara Yoga, immune enhancing drugs, though it is mentioned as immune enhancing drugs, 90% of the Prakara Yoga drugs, they are all Medhya in nature and supporting the higher functions. There was one study, of course, I had conducted on Vachadhatriya Javaleha of the Prakara Yoga in immunity enhancing. It was a very positive result I found. I didn't do any nootropic activity or specific clinical study on autism. Similarly, role of Panchakarma, as I said, Nasya plays a vital role. Abhyanga Sweda, the Purvakarmas plays a good role in calming down, and Virechana, of course, Shodhana can be practiced. Other is left to the Yukti. Certain kitchen items like Mudga said to be good in the management. So what is required is good start at home, right from the kitchen to your garden. Herbs, you can grow the Medhya drugs like Shankhapushpi, Medhya drugs like Brahmi in your kitchen. That will be very helpful. We can train the parents to do this. Some of the factors influencing, if you are able to control these things like Shukra Shonita, that is Shukra Shodhana, Shonita Shodhana, proper Garbhavakranti, Atulya Gotra, all these things if you follow, to some extent definitely we will be able to prevent such things. Garbhini Paricharya plays an important role here. Preventive measures like Garbhini Paricharya, Garbhadana, Prasava Paricharya, Jatakarma Paricharya, Lehana Karma, particularly Swarna Prashana, Madhugrita Prashana, Brahmi like drugs added with Sushrutokta Swarna Prashana, such things are also supportive in the preventive part of this type of diseases. Similarly, Vak Shuddhikara Grata, Medha Grata, Medha Smriti Vardaka Grata, such combinations are available in our classical texts. They are helpful. Stanya Dushti can be prevented. If you are able to treat Stanya Dushti is as a cause, it can be attended with along with Ahara and Vihara. They are all the preventive measures. Other things are early child care practices like use of Bal Rasayana, use of Dinacharya and Rutucharya modified, because all the Dinacharyas you cannot imply on children, particularly on ADHD children. You have to do modifications, which of course Agastya protocol has done. Abhyanga, Murdha Taila, Ahara Vihara, Madhugrita Kshira, Pana. These things are also helpful in preventing, helpful in giving adjuvant support to your management. There are certain spiritual practices too. You can see if you refer the Google or if you refer today the AI and all, you will get some temples are related with mental health. It is not for children specific, but for general mental health, like Balaji temple in Rajasthan, Chotanikara Bhagavati temple in Kerala, Gunashilan temple in Tamil Nadu, Muthuswami temple in Tamil Nadu, then Vaidyanath temple in Kerala, Jnana Saraswati temple in Telangana, and finally it said that Kashi Vishwanath temple. So this temple visits may boost not the child but the parents and their confidence. Definitely that will help in the proper care of the child. Now there are a lot of Karnataka students here. Am I right? See, there is one temple complex in Karnataka which is on the banks of river Kaveri, that is Talakadu, and Talakadu is related with child mental health. This I have taken initial reference from Professor C.H.S. Shastri from his book, and then I did some research on that. Vaidyanatheshwara temple is said to be the place, and of course there are other temples too there. The visit to the temple and worshipping here is also said to be improving the mental faculty or mental activities of the children. Jyotisha and mental health, and again this is another area where of course research is required. Chandrama Manaso Jataha, it comes in the Ayurveda, and Chandrama or moon is linked with mental health. The weak moon can cause mental health challenges. Of course it has then role of Mars, Mangala, Rahu and Ketu, Rahu and Shani also in this. So some links are there. This is beyond the present day understanding, but there is something, a ray of hope which needs to be researched out. With this all I want to talk about ASD, ADHD management. If you speak about the experience, yes, we are able to give better quality of life along with the conventional management with Ayurveda approach. And yes, we can help the parents, we can help the children, at least we can make them run with the group. With this I conclude with thanks to our Director of All India Institute of Ayurveda, for giving me permission to come here. Dr. Namita and Dr. Karthik, my students. Dr. Dinesh K.S. for supporting the Agastya protocol. My department faculty members, scholars, organizers of this conference, particularly Dr. Giridhar Kaje and his Prashanti team. Let us all pray, let all be happy, let all be free from debilitations, let all see goodness, that is Sarve Bhavantu Sukhinah, Sarve Santu Niramayaha. This is the Upanishad Vakya which supports our concept. Thank you very much.
Thank you, sir. That was very insightful scientific presentation on the topic. Thank you so much. And now I would like to welcome Dr. Lata Damble to present her topic. Thank you, ma'am. Over to you.
How far is the dinner time? How far is the dinner time, I asked. Good evening, everyone. It's in fact, first of all, let me thank the organizers of, carrying this huge event and making me a part of this and calling me to share my thoughts or views or whatever you can say, or my studies that I have done in PCOD. Well, it was long back actually, maybe a decade back. I should also confess that I'm not, compared to very accomplished ladies on the stage, Dr. Shailaja and Dr. Sucharita, I was not treating much of a gynecological case at one point of time. In fact, they are, I could say, the stalwarts in that field. But luckily or most of my works revolved around skin diseases more than gynecological disorders or maybe neurological disorders. But this was a decade back, or yeah, maybe a little more than that. I was treating a case of PCOD. That was the time actually we did not have this much awareness as PCOD that we have today. So, in fact, most of the times doctors' idea towards that, or the prescription, when a patient comes with PCOD, a girl comes with a PCOD, they are, especially in the counterparts, allopathic, they would always say, why do you bother? Even the patients are happy not having the periods for a long time, right? Who wants that bothersome time? Well, we now at least have a menstrual leave, but during that time we did not have that also. So everybody, definitely nobody would love to have that 4 days of troublesome period. So this was a time when I was treating a case of PCOD, and suddenly that lady, she was a married person, and I was mainly treating her for PCOD. After a few months, they came and invited to the naming ceremony of their kid. And when I went, then they had kept a name Vallari. If you all know Sanskrit here, Vallari is another name for Lata. So I was pleasantly surprised and happy, and I was telling, I was treating you for PCOD, what happened? Okay, they conceived after that. Because that was one thing that gave me, oh, there is something I have to look through my prescriptions, go back to these, we give, because PCOD itself is such a multifarious disease, we give so many things, and still sometimes it works, sometimes it doesn't. It's a pain for most of the doctors. I'm sure you will agree with me. So this is when actually I started thinking that we should think of, understanding this more. And luckily that was also the time when I had, licensed the first company of Ayurvedic company actually have licensed the bioinformatics suits from Schrodinger. And drug discovery and development is my key forte. I thought we should bring out some, at least a medication which will tackle the multiple problems that are in that particular disease. Of course, any disease, if you say is a complex disease, nothing is because of one particular reason. But this being PCOD is something which is far more complex than it actually presents. So when we, so let me just talk about PCOD a little more now. Oh, sorry, I think, how do I go back? Oh, I've gone, sorry, without knowing I've pressed a lot of, So now in fact the PCOD is so common, especially if you see the global prevalence, it's not really that much, 6 to 13% they say. But unfortunately in India, it has become 17 to 26% in one of the study. That means every 5 young women suffer from this condition. And also there was a nice book written by Gauri Pathak, if you get a hand on that, please read that, where she mentions about toxic locations being very important cause, you know, for the development of PCOS. In fact, the PCOD has already now become a syndrome, more of a disease. It has actually encompassed many other systems like insulin resistance and these hyperandrogenism, all these putting together it into a syndrome. So she has actually mentioned many very important aspect of toxic locations. This doesn't mean a geographic location actually. What she talks about is relocations from one place to another place, or you're in a very stressful place. For example, when they studied the conflict-ridden Kashmir had a very high prevalence of PCOD of 29 to 35%. Imagine, almost half of them. So this actually boils down to what stress can actually lead to this whole pituitary and GnRH ovarian axis. So you should read that, or economic stress, or especially nowadays women are into, I would say, kind of, they're also part of racing in this, you know, to the take career or all of these actually putting a stress on the biological parameters that we need to understand. You know, that people are, it is good when you don't have every monthly periods, people are happy. And even doctors are saying, okay, when you actually get to go to, you know, conceive, that time we do have clomiphene citrate. You take for few months, you will conceive. As if the body works in isolation. Body is such a mechanism that even a small, just think, somewhere you have, suddenly your hand goes to that and scratches. You know, the body can realize that. When such is the condition, how stupid are we to actually focusing the whole aspect of ovary and the pelvic, the genital organ, whatever, the uterus, everything, to just a fertility bearing apparatus, right? Of course, in the thing we also have ovarian cysts, but I'll not be actually touching much upon that, because that's, whenever I see an ovarian cyst, my rule is if it is more than 4 to 5 centimeters, please suggest surgical remedy or something else. Better to avoid medical management in due, but people who have better idea or better case studies can put a light upon that. And most of the times they are fluid-filled functional cysts, which usually mitigate with you know, some kind of medicines or naturally self-limiting also. But at the end of the day, PCOD actually affects not just the reproductive health, but the metabolism and the long-term well-being, which we are actually missing. Well, everybody, I'm sure most of you are students of Ayurveda, and you would know the clinical features of polycystic ovarian syndrome. Mainly, we need to have a menstrual irregularity or amenorrhea for more than 3 months or extended period of amenorrhea. And there are hyperandrogenic signs which will be hirsutism, acne, or androgenic alopecia. Then you have weight gain. In fact, all of these symptoms are linked because of one and other forms. It becomes a vicious loop of cycle which is very, very difficult, hard nut to crack. Infertility and subfertility. And in fact, that was the reason why that person whom I was treating for PCOD actually landed up with the good fertility rate. I'm sure more light will be shed on that with my dear next speaker, Dr. Sucharita, who is a very authority in infertility, I would say. Then acanthosis nigricans. In fact, this is a very marker of insulin resistance, where you see blackish pigmentation, especially on the intertriginous area. Then very importantly in the pelvic ultrasonogram, we see the pearl of string. Of course, cysts are there, but if you observe, they will be in the form of pearl of string, string of pearls, cyst in the ovary that you see. So this used to be earlier idea of PCOD and PCOS, when people used to come with the very minimum, PCOD alone. Say they would just have a period of amenorrhea or maybe some issues with the during bloating or abdominal pain during minor symptoms, which is not actually connected with the long-term implications. But nowadays it has turned to almost PCOS, where it is mostly endocrine and metabolic disorder, where actually the insulin resistance and hyperandrogenism rules the whole scenario. So the ovulation stops and it is more serious. Also, it has a high risk of diabetes and other related cardiovascular problems. And more importantly, the endometrium itself, when it is not being shed every month, now they have realized that it is very, very important that the endometrium sheds and renews itself every month. When that doesn't happen, at least 4 times in a year, this can lead to an endometrial cancer at later time. So this much of long-term implication was just focused on fertility in the earlier days actually. Even now, of course, many people do not take, lack of periods or monthly regularity. People don't take that seriously. I'm sure physicians would agree with me. So where we need to tackle all this? I mean, because now you see have insulin resistance. Insulin resistance is, why is insulin resistance happening? Insulin resistance basically means that the cells are not able to process the glucose because of they are insensitive to the insulin. Why is it happening? Because many of the inflammatory markers that actually are released because of, it could be obesity, where you have more of free fatty acids, or inflammatory markers like TNF-alpha, IL-1, 6, IL-1 beta and such other, they actually block the insulin receptors and make the cells insensitive to insulin. So what happens in turn? The hyperinsulinemia, that is the pancreas will actually increase the insulin secretion. Now this insulin, other than actually digesting the glucose, it also has another important factor, because it's a growth factor as well. So now this stimulates ovaries to actually increase more of androgens. You see, more of male hormones are released. Now when this cycle happens, these male hormones, when actually pronounced, they suppress the, these hormones should be, there is something called metabolism of these hormones in liver. This is what happens in liver. But the steroid hormone responsive, those binding elements, they are suppressed because of the high androgen levels. So what you have is more of free testosterone in the blood circulation. So this becomes a loop. So you have more of, so naturally that higher testosterone level will suppress the production of follicles. This is what happens. So the follicles are arrested, and also another thing happens is in hormonal imbalance. That is, the LH and FSH ratio gets disturbed. The body actually works in such a nice balanced equilibrium status, where because of many change, of course, definitely lifestyle changes, a lot of triggers and other factors, we have messed with biochemical processes. So naturally what happens is when LH and FSH, there is something called GnRH pulsing. So GnRH pulsing, the gonadotropic hormone pulsing, when it happens very fast, you have a higher secretion of LH. Then that whole negative feedback system goes off, and what you have is the follicular arrest, and it will never rupture. That's why you have increased LH to FSH ratio. That is almost double, like 2:1 or 3:1 in PCOS cases. Of course, genetics also matters. Mostly first degree relatives of women who have PCOS or irregular menstruation will have higher degree of, they found that 20 to 40% of female of first degree relatives of affected women are at risk of PCOS. Then exposure to testosterone in utero, in the uterus itself, during the womb, this can predispose to the later development of PCOS. Then the ethnicity, there also we have bad luck. South Asians are said to be at higher risk of developing PCOS. Then of course, lifestyle factors, which are the most important, which can affect your gut metabolism, which can affect your, mess with your hormonal system. The diet that is high in carbohydrates, processed foods, trans fats, naturally the dinacharya, rutucharya, everything we have forgotten, right? So this has put more implications on, it's putting more risk on getting PCOS. And also, of course, sleep deprivation, stress, all these aspects. Inactivity, that is another, in fact, it is said to be the new virus. Sedentary lifestyle, inactivity makes, weight gain, especially the weight gain which happens at the central area, the abdominal visceral obesity, which actually increases the metabolically active free fatty acids, which can actually cause many problems. In fact, insulin resistance begins with that. When you check the fasting insulin of the, that's why they say, I think you must have heard of this waist to hip ratio is very, very important. When it crosses 0.85 in women, you have to be alert. Okay. Then stress, chronic stress definitely increases cortisol, which again is a growth hormone. Definitely it will increase the hormonal imbalance. Inflammation in the body because of the food, because of the environmental factors. Every day we are actually, and a lot of free radicals being released with the kind of, the air quality, whatever. So this will definitely increase the inflammation, and inflammatory markers in turn can also trigger the cascade of hyperandrogenism and insulin resistance. Environmental factor is very high. In fact, plastic that contains bisphenol A, or the medications, there are some hormonal medications that we take, or even the cosmetics that we use, like if they have parabens, phthalates, all these are called endocrine disruptors. So these can affect, and we should stop, in fact, drinking water in plastic at least as early as possible. We should start carrying our, metal cups or glass cups. So obesity, though not the last, but very important cause in fact, people can have obesity and still have normal, once in a while, normal periods, provided they are exercising well, which is possible. They have found out just 5 to 10% reduction in the fat percentage of body can actually reverse menstruation. So this is, as I said, this happens in the general biochemical pathway that produces how the obesity can result in the insulin resistance, and how some of the interleukins like interleukin C3, interleukin 22, all these can affect. And also, when you don't have a proper gut metabolism, you have a lesser secretion of the short chain fatty acids. Even that can actually result, when it goes back to, you can see that PCOD it can result in PCOD. Triggers may not be the real cause. The person may be at risk already, and when they are exposed to these kind of triggers, definitely PCOS is on the way. Like long work hours, you can think these are there for literally almost every profession today, right? Long work hours, increased exposure to environmental pollutants, irregular eating patterns, and high consumption of processed foods, sleep deprivation. We are so much glued to reels now. In fact, even doctors are bound to make reels now than actually practice. So people look at the reels review, and I heard that they go to doctors. I'm sure that's not the case with Dr. Kajay anyway. And of course, stress from students. You all are at stress from academic or career pressures. So this can actually definitely increase the chance of getting PCOS. So this is just a summary which I talked already. You have an altered GnRH pulse, then the frequency increases and LHFS ratio is imbalanced, which causes an ovarian androgen production. This causes again insulin resistance that again exacerbates the hyperandrogenism. Then you have the follicular arrest causing the polycystic ovarian morphology. What are the hurdles to treat this? Because this is not easy. You must have seen a lot of patients, okay, their periods will start to get regular, but suddenly they will stop taking. That's because one is lack of awareness. I said even in the medical fraternity, there is no good awareness that this needs to be treated, and the menstrual irregularity has to be taken care of. Not just for the fertility focus, but for preventing the long-term implication, including endometrial cancer. Poor adherence to treatment. Naturally, when you have, the diet has to be taken care, the lifestyle has to be settled, and then comes the medication. So part of the medication is only 30%. The 60% lies with the patient herself. It's so difficult to manage, proper diet, proper exercise with all this fast-paced life. So naturally, adherence drops. Then socio-economic factors, that's another very important, because most of the, if you see the tests involved are hormonal profiles, the scans, follicular monitoring studies are all quite expensive. If you have to keep doing, as a way to follow up, it's not possible to for every private patient, it becomes a little difficult, definitely. So I think the government should think about this, because this is almost becoming like a crisis now, with almost, imagine, 1 in 4 or 5 women suffering for this, definitely puts our major chunk of society in risk, right? So the government should think of subsidizing these treatments or probably the tests with this. Then you have cultural factors and stigma, which is very, very, even today, though we talk about menstrual leave in Bangalore, but if you just go out of Bangalore, maybe a few kilometers, people have a taboo talking about this, menses issues. It's not freely discussed amongst people. Even the mother will not know many a times. Very difficult to discuss about these things still. So this needs more of awareness amongst public. And as I said, knowledge gaps among the providers and this fertility-focused approach. The uterus and ovaries are not just to bear the children, that we need to start educating the patient, from the patient, every patient that we see. Then lack of multidisciplinary care. This is very important because you can actually talk about all this diet, everything, even in your OPD practice, you don't have this much time to completely give them the diet chart or talk about their mental counseling, because most of the times patients of this suffer from a lot of anxiety, panic attacks, then depression. So you need some caregivers or some specialists in that who can handle this, not just giving the medicines. A nutritionist, it's a collaborative, it has to be a collaborative approach. So this becomes a hurdle when you have to include many specialities in the treatment profile. Then the disease complexity itself, because even if you have to take care of many aspects, still you will see in some of the studies, it will take some time to reduce the fasting insulin. So maybe if you stop after some time, it is possible the disease reverses itself. So it is a difficult, complex situation, makes it all the more difficult to treat. And multifactorial nature, not just the hormonal, the mental issues, the diet issues, the lifestyle, the exercise issues. At least diet they can probably manage, but the exercise is another difficult task, right? And also it is varied presentation, because everybody does not have the same, some people are more bothered about their increased hirsutism. They are not bothered about, you do whatever you want to. I don't want to take any medicines because I'm not bothered about the menstruation, but I'm bothered about the hirsutism because that's more of cosmetic appearance. So every individual has different issues and they have to be treated, addressed separately. So I would suggest for any generally public, if they are listening, when you have no periods for more than 3 months, there is a sudden weight gain or difficulty in losing weight, or severe acne which is unresponsive to the OTC medicines, whatever they, or excessive hair growth or hair thinning where you have androgenic alopecia, or difficulty in conceiving after trying for 6 to 12 months, please consult a doctor for this. So when we are talking about long-term implications, I was talking about that fertility approach, right? Imagine this much problem the girl can have in future if her PCOS is not treated for. And they have to be educated, parents have to be educated about this long-term implications. They can have insulin, of course insulin resistance is very common. Now this can lead to high blood sugar and diabetes, or increased risk of hypertension, high cholesterol, stroke, heart attack, metabolic syndrome where you have excess belly fat, abnormal cholesterol levels. Then you can have a build-up, which is actually, this is also becoming a crisis situation now. Everybody you see has some amount of grade 1 or grade 2 fatty livers. So non-alcoholic fatty liver disease is another. Infertility, endometrial cancers. Then apart from this, you can also have sleep apnea. Because of the obesity, sleep apnea is another complication that she can have. Mental health, increased risk of depression, anxiety and eating disorders, which puts them back in the loop of having the problem, not getting the problem treated. So I already got a time limit. Sorry, let's just quickly move through now. Lab tests, as I said, they are all the hormonal profiles, FSH, LH mainly, then testosterone you will have to. Then there are some things which you are doing to rule out. For example, dihydroepiandrosterone. That is the DHEA to rule out that there is an adrenal cause to the problem. Or AMH. AMH is very important anti-Mullerian hormone which actually shows the reserve of follicles. So mostly they are very high in PCOS because of the number of, very high number of immature follicles. Then fasting glucose, insulin, HbA1c, thyroids and ultrasound will have to be. So the diagnostic criteria I will not go through. This is what mostly 3 Rotterdam criteria they are called. So either 2 of them, either irregular periods, hyperandrogenism, or PCOD in the ultrasonogram. That will make the diagnostic criteria. Coming to Ayurveda, PCOD can be thought of as a kapha and medo dhatu involvement. Not only that, many of the artava vyapad or artava dushti like Shina artava, Nashta artava or even Kashta artava can also be thought about. So these treatment all have to be actually combined, I would say. Then yoni vyapads can be, PCOS treatment might be lying in yoni vyapad, putragni or udavarta, because abdominal discomfort is the mainly seen, or artava yoni. So vandyatva, all this can be, I won't go to the details to this. So by looking at all this, we actually have come out with a capsule. In fact, this particular peripoise, we have done clinical trials. Of course, it has gone through the path of drug discovery and process. I wouldn't go into the detail of the drugs that it contains. In fact, if you read Lakshmana Sahadevi Chiravilva, Kanchanara Asana, Gokshura, Methi Kalajaje, that is Nigella sativa, Krishna Jiraka, Shata Pushpa and coconut flower, that is Tengin Pokula we say. So by seeing that ingredient itself, you can think that it is actually addressing multifarious aspect of the PCOS. So peripoise is to control the period, so period issue. So this is how any of drugs in, any of the products in Atrimed would undergo. Initially, we will screen it through more than 5,000 phytomolecules that we have virtual computational methods. We will understand the drug likeness and all of this. We have a library of them that will go through that. And then we will extract and we will understand. This is the bioinformatic docking results of some of the representative compounds that are present in peripoise, like tirostilbin, marsupin is from asana, quercetin, nijolidine is from Nigella sativa, and also you can see the RMST value has been so well of some of the compounds and even the superimposition of them against some of the targets that have like TNF-alpha, interleukins, PPAR gamma, which have very important target in the diabetes where metformin is, that's the reason metformin is used. They were also been tried in the in vitro. You can see the inflammatory markers assessment against TNF-alpha, IL-6 and IL-1 beta, which have very key role in PCOS. Then this we also give it in rats to understand the toxicity of the product. So this is just the toxicity. I wouldn't go, everything is under control. There is no toxicity involved. The clinical study, you can see there is a very significant change in menstrual irregularity before and after treatment. We treated 60 patients. Of course, 2 patients dropped out, so the N is just 58. With the significance of P less than 0.01. But even the painful and pain-free cycles have improved. And if you see mean score assessment of the pain per se has also reduced from 6.8 to 2.4. Then there is also a reduction of mean BMI in patients. Of course, here is the thing, 26 is still a high BMI. So about 25, So it is still a high BMI, but the study was only for 12 weeks, so we can't expect very big result. So I would actually request the dignitaries or the other co-doctors to try this and make a case study of yours. There is the reduction of hair fall also. But the problem with if you see the change in mean ovarian volume, if you see just right and left ovary, it is not statistically significant, but overall when you see a bilateral results, you have a P less than 0.005. So this indicates that it requires longer duration of treatment. Even if you see the fasting insulin, it is still high. About 10 is still high, so that needs to come down. So this requires, and even the patients this was not just, the diet and lifestyle was also advised. Then this was another study that was done in GAMC Mysore, where also they had, if you see the last thing, P less than 0.05, irregular menstrual cycle, menstrual cramp, bleeding weight gain, hair fall, and abdominal bloating, which are main key symptoms, have all given good results. So I wouldn't go through the ovarian cyst at all, as the time is also running, because they're mostly functional cysts, and treat it if it is less than 4.5 centimeters only. I wouldn't dare treating anything more than 5 centimeters because of this emergency situation that can land them in the ICU with the sudden torsion of the cyst. So these are the symptoms. If they have very severe pain, with fever and chills and other things, it's better. They need to get into the ER. So treatment plan definitely has to be Nidana Parivarjanam. All the factors that, the diet, everything, what the high carbohydrate, high processed trans fats, they have to be avoided. Then Samprapti Vigatana. I have also heard Shodhana done and then started with Shamana gives a better results, which is possible, but this was only a 12-week study where we could not do all that. Then of course Patya. So all these three has 30% relevance in them. So everything is important. Thank you very much for your patient listening.
Thank you. Thank you so much, Dr. Lata Damle ma'am. That was very insightful information on the topic. Now I would like to request Dr. L. Sucharita ma'am to talk on the topic female infertility. Over to you, ma'am.
This is like this. Just show me. Center. Good evening, and also I think I should say good night because most of you are hungry, waiting for the dinner to happen. Respected Chair, Dr. Shailaja ma'am, and my co-speakers, Dr. Rajagopal and Dr. Lata Dhamle. And at the outset, I would like to thank the man behind, the brain behind this mega event, Dr. Giridhar Kaje. I'm very happy that you are here, Dr. Kaje. Thank you so much. Thank you so much for having given a very good opportunity for us to speak. See, I'm not an academician or neither a research person. I'm just a clinician. I'm going to share my few experiences which I've had in my clinical practice. So as you all know, I don't want to go very in detail with the theory aspect of it. Successful cases of Vandyatva, that is female infertility, a case series. I have just documented few cases, very important cases, different kinds. So just I'll go through that. Definition, as you all know, Vandyatva, Anupalabdhi of the Garbha is said to be Vandyatva. And as you all know, that infertility is defined as a failure to conceive within 1 or more year of regular unprotected sex. So hope you all understood this. And the types, according to Charaka, Vandya, that is absolute sterility wherein there is no treatment can be done. It is the absence of the organs and there is no production of the eggs. Such kind of problems cannot be handled. And the second one is Apraja, that is what happens, they get married, they will try for a child and they never succeed in having an issue. So that is called as Apraja Vandatva. The second one is Sapraja, means the couple will be having one child and then they will fail to conceive for the second child, that is called as secondary infertility, Saprajavandhyatva. So according to Haritha, there are 6 types which he mentions. One is Kakavandhya, that is one child, as I explained. Anapatya is totally primary infertility. Garbhasravi means what? The woman will be able to conceive, but she will not carry the pregnancy for the full term. And Garbhasrava, that abortions or miscarriages happen. Then the other one is Mrutavatsa. Here also, the wife will conceive and then she will take the pregnancy to the full term, but before birth of the child, the fetus will be dead. This is called as Prutavatsa. See, all these they have observed in old, like Haritha, Charaka and all, they are from 500 BC. Balakshaya, that is, according to Ayurveda, we always speak of immunity, immunomodulation, immunoprotection, and then the balance of all these hormones. Where it happens at Balakshaya, the woman will not be having capacity to even conceive or to take the pregnancy for the full term. The last one is Garbhakosha Bhanga, but there is any injury, the major injury to the uterus or the genital organs, then she will fail to conceive. So the next type is the factors which you all know from the beginning. You keep studying about this, the Rutu, Kshetra, Ambu, Bija. So I will not go detail into this. Shad Bhavas, the speciality of Ayurveda is Shad Bhavas. Maturja Bhava is, of course, you know, the eggs and the Pitruja, the sperms, and here comes a very great importance of Atmaja Bhava, which no other complementary system of medicine will tell. See, I will give you one example. Because nowadays there's so much of technology and in vitro fertility is happening. So they have check on each step. They retrieve the eggs, they collect only the eggs, they check the quality of eggs, they take the good sperms which are highly motile. Yeah. They check the quality of the sperms also. Everything, each step they will examine everything. And then they will fertilize it in the test tube, embryo will form, and embryo also they will wait for some blastocyst to happen, and then they try to transfer into the uterus. All these procedures are controlled every step. But sometimes what happens, the pregnancy will not happen, the implantation will not happen. That's a big question mark. Nobody yet, so much of technology advanced, cannot say why the implantation doesn't happen. According to Ayurveda, we have an explanation that soul, see the thing has to invite the soul has to come and decide that I am going to go in this kshetra. So this is very, very important. For that, our past karmas or whatever good deeds we do in this life. So this is very important aspect of Ayurveda which we all have to note and promote it to the generations. And of course, sattva, that is mental aspect, is also very, very important. Charaka always says Saumanasyam Garbhadharanam. So how much importance has been given to Satya, we all know. So Satmya is also, as I said, immunity. Like the same wife the same wife's egg can fertilize with somebody's sperm. This is called as antigen-antibody reaction. So she will fail to conceive with the same the husband's sperm. So because there is some immunomodulation which is happening there, it is antigen-antibody reaction. So these are all the extra reasons other than what the complementary system of medicine says. The next slide, please. The next slide. Yeah, this is, as you all know, very beautiful. In Charaka Samhita, they have mentioned that Yoni Pradoshat Manasobhidapat Shukrasuruk Ahar Vihara Doshat Akala Yogat Balasamkshayascha Garbham Chirat Vindati Saprajapi. So all these, the whole in nutshell, he has explained what are all the causes for not conceiving. So next we will go. See, Yoni Pradosha means complete pelvic organ we have to take. It is an anatomical position. So in pelvic causes, what are all the causes? Like endometriosis, adhesions, and uterine factors, that is unfavorable endometrium for nidation, chronic endometritis, fibroids, congenital malformation, and in cervical factors, it is ineffective sperm penetration, and because of chronic cervicitis, and immunological factors, that is ANA, APLA, and also and so. Ovarian factors, as you all know, this is a very important thing, anovulation and corpus luteum insufficiency. And tubal factors following the tubal infection, pelvic endometriosis, which you are very seeing in common nowadays, and the tubal block, wherein she will not be able to, because the fertilization takes place in the tubes. If the tubes are blocked, IVF is the only answer. Earlier they used to do tuboplasty and all that, but now they have stopped all the procedures now. Only IVF is the result. So the next, I will go through some of the cases which maybe you find it interesting. See, number one, sorry chairman, because I should not put the names of the patient, but otherwise I will forget. Because of my age, I may forget. So if I see the names, I can remember things. So this is one couple who had problem with both of them, like both male and female infertility, you can call it. So what happened? They have already gone for one IUI. They have tried for so many years. Intrauterine insemination has been done, wherein she conceived, but what happened? She had an ectopic pregnancy, the lady. After some time, of course, it was managed with the medicines. They didn't cut off the tubes or nothing else. The tubes were very healthy. But the next time they have tried IVF, wherein even the blastocyst formation did not happen, and it was not fit to transfer, so they have not transferred it also. See, then when they visited us, we gave all these medicines. Previously, this is the history what she had. Of course, she also had the fibroid, and the myomectomy was done long time back, and then artificial procedures was done before, and then HSD, of course, tubes were patent. Though she had ectopic pregnancy, they had preserved the tubes. So these are all the reports what she had. And then what we did when they came to us, because both were, you would have observed, they were obese. The husband was weighing about 124 kgs and the wife was weighing about 84 kgs. So what is the next step? Because as we all know in Ayurveda, once the mamsa or medo dhatu is become over pushti, further dhatus will not get properly. So the asti, majja, finally it is shukra. So the quality of shukra in both were very, very poor. So even now, when you go to the infertility centers, most of the doctors will suggest, they check the weight of both parents and then say, first you lose 10 kgs of weight or 20 kgs of weight or 5 kgs of weight and then come to us for the treatment. So this is the common saying nowadays. So here, both had overweight. So we planned Virechana before, and then see, after the Virechana, the lady lost about 6 kgs. So this is what the treatment went. And then follicle scan, of course, ruptured. And we have given supportive Shatavari tablet, Arogyodin Putran Jiva, because I'm just brushing it aside because it's already time. So Kasisa Yoga is a very beautiful combination wherein it improves the, because she has undergone IVF before and implantation had not happened. So because endometrium is very, very important part of the uterus, wherein triple line has to form, and then there should be good blood circulation to the endometrium. This Kasisa Yoga does that. It improves the blood circulation to the endometrium, and then Pushpadanvarasa is also improving the quality of the egg, and along with Shatavari tablet. So Arogyavardhini for basic metabolism. The liver is the bigger brain, what we say, which controls the fat metabolism. So all these combination I thought of and give it for them. And then finally, then finally after about 6 months of treatment, the above the dates are wrong, but here what we have mentioned that 18-5 viability scan, she became pregnant. See, earlier she had one IUI, artificial procedures, IVF, both failure, natural conception, both of them lost weight, and I'll just show you cardiac activity, everything, and then they, of course, they gave birth to a boy baby after 9 months of pregnancy. And then what medicine was given to the husband, I'm just telling, that Shivalinga Bija Churana Vyadhihara Rasayana, which is very important because Vyadhihara Rasayana is given for a short period of time wherein there is morphological problem, structural problem of the sperms. So this Vyadhihara Rasayana, when given for 45 days of changes, it changes the production at the level of the production. The structure of the spermatozoa. Many times what happens, the count will be very good, the motility will be good, but the morphological status, just all 99% will be defective sperms. So then the sperm will not be able to fertilize the egg. So if by giving Vyadhiharana Rasa, that was corrected, and Vajika Rasayana, of course, all these Rasayanas was giving. For his weight maintenance, Decrin Plus was given. Svaranamakardvaja to boost his libido and all that, naturally, because once they are obese, they have less activity. Even the sexual activity is also less, and they become very fatigued and tired very fast. So these are the combinations which was given, and it resulted in a Very good. The changes of the stem analysis you can see. See, first it was viscous and it became normal, and liquefaction was more than 50. It should be within 30. It became normal, and sperm count, of course, yes, no problem. Motility, it doubled up, and normal forms, see, 40 to 80% after giving that all the treatment. So this made them a successful pregnancy, and then she delivered a male child. The next study, that is primary infertility with very low AMH. Now all of you must have heard about the famous word AMH, anti-Mullerian hormone, which is a very important hormone which in a girl child, when she is born only, it is decided how many eggs she is going to produce in her life. So this AMH decides this. See, imagine, such a, that female, Deepti Nahata, is a Bengali. She was just 29 years and her AMH was very, very low. So when she visited our complementary gynecologist and all that, they suggested for donor egg. So she was almost, they will be shattered, in such young age, having married for 3-4 years, they are planning for a kid, and when you go for the test, they say, no, nothing can be done with your egg and you have to go for donors. So then they came to us, and then this was the treatment done. Of course, they are vegan also. See, these people are headache people, we are not supposed to use all dairy products in them when they are vegan. So, but of course, I have to, just convince her just to take that Sukumara Gruta, and for all others we just gave the Thaila. So these are the internal medication before. See, look at just changes. See, usually when they come, when they all Google nowadays, all ladies, they come, the patients, they come, they say our AMH is so low and then we don't want to go for dose. I first tell them, don't look at the numbers. Numbers are just numbers. Okay, see, just improvement from 0.16 to 0.23. So usually AMH should be about 2. 2 to 4 is the peak fertility level. But still, with this limited AMH only, this lady conceived. So the pregnancy confirmed after 7 weeks. She became, and now she delivered. She wanted to go for water birth also, and then she delivered a male child, and they are all coming for checkup even nowadays. Third case, of course, this is an advanced maternal age. They came from Chennai to me. So both were 42 and 39 you can make out. And then earlier also they have tried. And the madam, Lata madam mentioned about endometriosis. That's the toughest job for Ayurvedic doctors or even allopathic gynecologists to treat. Very, very, very much unpredictable results we get with endometriosis. So, of course, even her husband had some problem. So we treated, and then, of course, earlier she had very irregular periods. First, we gave her Virechana. First thing we suggested was cleansing, Virechana, and then started with all the medicines. So earlier, occasionally seen just 3 millions. That's why I tell you, numbers are numbers always. So motility, which was nil, it became progressive for 5, and then morphology improved at least 1%. So severe oligoasthenoteratospermia improved, and then for her the medicines what was given, mainly we tackled improve the gynocare, and gynocare is of course there's a combination of medicines which are very good, Varanadi Kashaya and Palakrita Kanchana Gugulu. Please note down because I have hardly very less time to go. This is case number 4, wherein BOH is bad obstetric history, wherein a woman undergoes multiple miscarriages. So with bicornuate uterus, what had happened in her case? See, all these patients were referred from an allopathic infertility centers. So she had G1, G2, G3. All were UPT positive, but never she had, she got the MTP done 3 times also. And then husband, there was no problem. And then finally, BOH, because of bicornuate uterus. What happens in bicornuate? The uterus, it is divided into 2. Many times there was one of my friend who was a doctor herself. She had bicornuate uterus. When she carried pregnancy, one horn she was menstruating all the months during pregnancy. The other horn, the fetus was growing, and she delivered normally also. So this can happen. So these were the medicine given. See, usually Sukumara Grita, See, always nahi vata drute yonihi. So when there is any problem with the yoni, you have to always think of Eranda, Sukumara, all these medicines which are very important. You have to regulate the vata. So Sukumara Grita, Kainocare and Ritu, all to increase the quality, because she had conceived, usually first trimester failure, we always attribute to poor quality of the eggs or poor quality of the sperms. So you have to diagnose when they come with first trimester failures. So you have to do that all hormone tests and just to find out whether everything is in shape or not. So these were the medicine given, and finally she confirmed the pregnancy, and she was very thin and very very small built lady. You could, when she used to come inside our OPD, we could observe one side there was fetus, one side there was hollow, because one corn was carrying the baby. So this was the condition we saw, and then finally she also delivered. So the next, Garbha Shosha. Sometimes what happens, IUGR, see, usually in complementary system of medicine, from the time they conceive only, they start with aspirin, low dosage of aspirin and folic acid and progesterone and all that. But still sometimes it will not grow. There is an intrauterine growth retardation, maybe because of the less blood circulation or hypertension during pregnancy, whatever. So it was referred, because they have tried even giving Clexane, that is low molecular heparin injections also, but still her growth retardation was there. And then we started with these medicines. She came only when she was 24 weeks and 5 days, this which is called as Garbha Shosha, and these were the medicine given. See, before it was just 560 grams when she came, and it improved. The Cardorium Plus is the one medicine which I gave. It is given for good blood circulation. So the uterine artery should have good blood circulation. Otherwise, if continuous pressure on the uterine artery, which supplies the nutrition to the fetus, there will be notching formation. If there is any notch, the proper supply of nutrition will not go to the fetus, so it fails to grow. This is called as intrauterine growth retardation. For that, we planned the medicines which give good circulation to the uterine artery. So she improved in her, the fetus improved in her weight, and she also delivered 1.85 kgs. No problem. She was not put into NICU or anything, delivered. So this is the case 6, wherein PCOD, of course, Lata ma'am spoke in detail about this. This was a very tough case. In PCOD, what happens, there is no regular pattern of period, there is no regular pattern of bleeding, there is no regular pattern of amenorrhea. Everything is disorder. If they get periods, it will not stop. They'll keep on spotting for 1 month, 2 months like that. We have to give medicines to stop the medicine. And then otherwise, they don't get periods at all, long time of amenorrhea. So then you have to induce periods in them. So first we have to saturate all these, and then finally give medicines to make her ovulate regularly. See, the answer of PCOD is not reversing the PCOD. You can't reverse. It is like diabetes. So it is permanently there, but pregnancy is the answer for PCOD. If you make her pregnant, your job is done. Once again, after the birth of the child, she may become PCOD once again also. So that is a trait they have. So, of course, with lifestyle and all, definitely you can change them. So this is the treatment given. And she is a mother of second child also now. After the first child, she again, after 1 year, they wanted to plan the child. Again, they came to us. They planned again. First course of Virechana was done, and then the medicines were given, all Rasayana therapies. She conceived for second one also, 2 boys. She's a mother of 2 boys now. So next case. So it is with multiple fibroids. So she also, she had multiple failure also. Huge fibroids, number of fibroids. When you just do the scan, you can count the fibroids she had. But earlier also she had she conceived with some of our medicines. See the size of the fibroid, 4.1, 3.8, 2.1, that too multiple intramural, which is very painful. She used to have a very bad intramural fibroids, always gives lot of dysmenorrhea and pain. Subserous and all you can manage, but intramural is always a little bit difficult. So we treated, you might just see the medicines which we have given, Paranadi Kashaya, Kanchan, simple medicines only. But see, first she conceived, but what happened suddenly, she had an inevitable abortion. She had gone to some different place, that is Mandya from Bangalore. She traveled and suddenly she had anhydramniosis. She was diagnosed and she started leaking the amniotic fluid. And 16th week, Papa, she lost first pregnancy, but she didn't lose her weight and she again came to us. She took the treatment and finally now she is a mother of one female child. Okay, then see, this is an interesting study of a male study with azoospermia. Azoospermia is a very difficult case to treat because there is no production at all in them. What happens, there are few cases in my whole 40 years experience, maybe about 5 or 6 azoospermia cases have been successful, but this is also one among them. What happened actually, see, they went to IVF, of course, azoospermia, you cannot expect them to conceive naturally. When they went to the centers, they did TESA, PESA and all that. They could obtain 1 or 2 sperms with 0 motility or 5 sperms second time. But they underwent one IVF, that was a failure. The lady did not conceive. And then they came to us, such a trust patients, they followed each and every step we mentioned. And that 1 year of treatment, all this, the Panchakarma therapy, Basti, which helped him a lot. Same thing after the previous one. See, I just told them, 3 months we did one analysis, no change. 6 months, no change. 1 year also, no change. But again, I told them to go to the infertility center and get the IVF procedure done by TESA or PESA. They extract the sperm at the site of production in the testicles and then fertilize it with the egg. So he was referred and then after our 1 year of treatment, again he was made to do that PESA and TESA and then embryo transfer done. So she is a mother of one child now, and recently they also came that they want to have, because they have preserved some embryos there. They said they want to go for cleansing procedures and they want to have one more child now. See, that is the inspiration for an azoospermic to have one's own child, which is very difficult. So usually they will send for donors and all that. So biological child, if one has to do, of course technology we have to make use with the help of our medicines. The bicornuate and bicolis. This is also same bicornuate, 2 horns, earlier failures. See, 3 failures she had, and later on she's a Marwadi woman, very thin, and this one. And she is also carrying for the second child now after first child. So these are the medicines which are given. So now, which is ongoing case now, this is Manjushri and Nikhil. So this is with hemorrhagic, what madam said, it is very, very difficult. See, when we gave the medicines and then she still had that hemorrhagic cyst. When we did the scanning, she used to have that hemorrhage. See, the first follicular tracking done and then net pattern hemorrhage. Hemorrhagic cyst, all the time endometrial cyst used to happen. Then finally, when we gave that, there is one Santati Bindu capsule which some company, like Chatayu company has made it. After giving her for second cycle, this lady conceived. Of course, there was hemorrhagic cyst on the other ovary, but the left ovary produced a good follicle, and luckily she conceived that cycle, and she is running now 34 weeks, going very strong. And last case, I think this is also a running case now. This is also multiple pregnancy loss. This here you have to observe all termination in the 4th month. I told you first trimester loss is because of the quality of sperm and egg. Second trimester loss is always due to some cervical problem. The cervix, it can give way, or maybe some infections. She used to have all the time leukorrhea and white discharges, even before the marriage, after marriage. So she had conceived with the medicines, but still, see, she could not continue the pregnancies. So later on, what we planned, we planned vaginal douche. See, local treatment is very, very important. As Charaka said, yoni pradoshas means we have to consider even the vaginitis, cervicitis, each thing is very important. So we did treatment with douching for so many 3-4 cycles soon after the periods, and given her, because it was a second trimester loss, egg was good, the quality of egg was good, quality of sperm was good. The loss is because of the infection which she used to have, a very chronic leukorrhea infection she had. So that we treated, and then she is now running pregnancy, and she is also, why I am giving Manasa Mitravati is, she is under depression also. So because of, she had one girl child, usually you know that caste they will have a number of children. In her same house, joint family, her co-sisters they have 2-3 children, but she has only one child. That was a very kind of, and she was looking down upon in her family, so she is always depressed. So for that, I am also giving Manasa Mitravati regularly, and counseling is also very, very important. Each time she comes for antenatal care, we give good counseling, we make her think positive, and we make her smile, laugh, everything. And now almost she is due for delivery in February. So, yeah, this last one I want to explain, the Charaka Saumanasyam Garbhadharanam. This she is a doctor, radiologist, this lady, and husband is an IT professional. So they had a good marriage for 1 or 2 years, and then started to think of having one baby. But you know, the complaint, when first the doctor came, she said, no, I want to have a child and my husband is not interested. He's always with the screen time. He comes home late, and then always after dinner also he doesn't sleep properly. He's always the screen, always the mobile, always the laptop or tab or whatever it is. So they hardly had any good understanding and good, even to have sexual intercourse, that man was not willing. First 2 years they had a very good family life. So this was a problem. So there was she was very obese, that lady radiologist, but still she was producing. She only, as a radiologist, she used to track her ovulation every month, and there was good ovulation, and she used to try having contact, convincing her husband, everything. But still it did not happen. She came, cried in front of me, and I asked her to send her husband to me once when I am free. So he came on a Saturday because he is an IT fellow. I talked to him for an hour. Just counseling how much it is important. Sattva Vajaya treatment is very important. So I counseled him, I told him few things, to be positive, and how a family life should go, how the understanding should be there between the couple. All these are very important. And what is the kind of sexual management in case of men, how frequently they should have. All these, everything, though he was a technically person, they will have read theoretically everything, but practically they fail. So this is how it helped. Just 1 or 2 months of treatment. Of course, the count, everything was, motility was a problem. So astenosospermia. So all these treatment, see, look at that, what I have given, just Kanashata Vadi Kashaya, as she was a little bit. And for him, that Svarana Makaradvaja, it helped him. And also some kind of medicine is also required, and also counseling, and then positive thinking should be there. So now she delivered recently to a boy baby, and of course being a doctor she delivered through LSCS. So this is, see, that's why very, very important. When a couple come to us, they are already, because when they don't have child, their minds are always shattered. First, you have to, as Dr. Kajay used to say, Barni Maduva, Ene Agli problem Barli. First we will discuss with the problem and take step by step. That done. Yeah. So that is very, very important. So first thing I tell you, don't send any couple that we are not able to treat this kind of problem. But you have first patience, and then make them to sit comfortably and understand the things. And the positiveness in Ayurveda, what we have, such a good medicine, such a simple therapies, such a beautiful Panchakarma therapies. So controlling, balancing the hormones are the main treatment. And Sattva Vajaya, of course, very, very important. Thank you so much. Thanks.
Thank you so much, ma'am. That was very insightful information. Now I'd like to request Dr. Shailaja, you to sum it up the program.
Respected speakers of this session, Sucharita Madam, Rajgopal Sir, and Lata Damble. There is, actually when I got opportunity to become a chairperson for this session, I was thinking, yes, Sucharita Madam, her student became my student, Ashwati. And Lata Damble Madam, we both are from same place, Uppin Kudru. My name is Shailaja Uppin Kudru, and Lata Damble's ancestors are from Uppin Kudru only. And Dr. Rajgopal. So he started Kaumarabhratya department in our institution, and then I led the department up to till now. And once again, topic. So all are my favorite. PCOD, fertility or infertility, and autism. But time. So few messages I want to give. I thank all the speakers for enlightening all of us in these all topics. So I will start it from PCOD, infertility, and then autism, ADHD, because PCOD, since the age of adolescent, when the menarche starts, they are with PCOD, and then they become victim of infertility. Fertility becomes the problem. And treatment of this PCOD and infertility nowadays is leading to autism, ADHD like problem. So they are connected each other. And one treatment, important treatment for these three also is Saumanasya. Saumanasya Janananam Garbhakaranam. So for infertility, Saumanasya Janana is told, and even PCOD also, Saumanasya is very much important. Then during pregnancy also, and when the children become victim of ADHD, autism, Saumanasya become very much important. And in PCOD, I was thinking that the PCOD can be divided into two. One is Yoni Vyapat Arajaska, and another is Pushpagani, that is Jataharini. So once again, the concept in Prameha, Stula Pramehi and Druksha Pramehi, the same thing we can adopt here also, understanding PCOD and also management of PCOD. Even the same principle we can adapt in infertility also, and even in autism, ADHD also. So these all with the thing of Agni. So Manda Agni leads to one type of that anovulation and PCOD, and Tikshna Agni once again leads to Arajaska Yoni Vyapat, and same type in the autism spectrum disorder. You can say it as the Unmada spectrum disorder, or they may be Kayas also. So Kayas, if they are, maybe because of genetic, they are Yapya or Asadhya, and the Unmada, when it becomes, once again you can divide them into two, that is Pitta Vata and Kapha Vata. So introverted, extroverted. So depending on that, we can manage, and already the management is nicely discussed by all the speakers. So I am not going to discuss much. I thank the speakers for a very, 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 very informative session, and also I thank the organizer for the opportunity. And also one thing I want to say, that is patience, if it is, patients will come to you for doctors. So since 4 o'clock, sitting silently is also making us to learn patience. So that is also a learning in this what we can say. So thank you for that also. So same message I want to give all the budding doctors. If you have patience, the patients will come to you. So once again, thank you all of the audience. Up to now also, I can see few audience in the audience seat. Thank you.
Thank you. Thank you, Shailaja ma'am, for a insightful message. By this, we are coming to the end of the session, and we request Dr. Shailaja you ma'am to give a token of appreciation to all our speakers. Dr. Rajgopal, yes, thank you, sir, for being here and presenting your scientific presentation. We request Dr. Shailaja you to give a token of appreciation. Thank you for your time. Thank you, sir. Now we request Dr. Lata Damle ma'am to receive a token of appreciation for giving a wonderful presentation. Thank you so much. Thank you, Shailaja you ma'am, for giving a token of appreciation. Now we request Dr. Sucharita L ma'am to take a token of appreciation. Thank you, ma'am. Now we request Dr. Manjusha Rajagopal ma'am to honor our chairperson Shailaja you ma'am. We request Dr. Manjusha Rajagopal ma'am to honor our chairperson Dr. Shailaja you ma'am. Thank you, Dr. Shailaja ma'am, for your time. We request Dr. Manjusha ma'am to honor our chairperson Dr. Shailaja you. Thank you all the speakers for your presentation and the chairperson for being here and enlightening all of us. With this, we are coming to the end of the second day's scientific session, and tomorrow we have, as the planned, our session going to start at 9 o'clock. We have Sushvasa session, Vishwasa session, Abhaya session and Nirbhaya session. Morning speakers are Dr. K. Sridhar Bairi Udupi, Dr. Arun Chaugale Belagavi, Dr. Jagadish V. Yaji Bengaluru, Dr. Rangesh Parmesh Dubai. They are the chairperson, and Dr. Srivatsa Mysore, Dr. Vijay Chaudhary Himachal Pradesh, Dr. Suhash Kumar Shetty Belagavi, and Dr. Debashish Panda. And the next Abhaya session would be Dr. Narayan Chahane, Dr. G.G. Gangadharan Bengaluru, Dr. Ashok Kumar Panda, and our chairperson Dr. Mahesh Vyas. And the Nirbhaya session is Dr. Gopi Krishna Kottekal, Dr. Veena G. Rao Mysore, Professor Abhay Narayan Tiwari, Dr. Jayaprakash Narayan. This is going to be our tomorrow session. We are going to have all the first three sessions continuously with 5 to 10 minutes break, and we are going to have a lunch break after the third session. So have a good breakfast and come and sit here so that we can have a good time here. Thank you.